Hello, Robert Sarkis. Good to meet you finally.
Nice to meet you, Susan. Come on around. So you get to enjoy some of our traffic.
And learning about your weather.
Oh, yes.
And your allergies.
Are y'all miserable?
I forgot to take my allergy pill this morning, and
I can offer you some Benadryl, but I don't.
I was taking
I was going to say, is there a doctor in the house? I think
Yeah, we've got allergy medicine. Everybody pretty much is affected with it right now. So good. That's you.
Oh.
No, that's not.
Oh.
Come on around. This is my office.
Wonderful.
Have a seat.
do you want the door shut or?
Whichever shut, open. Yeah, I don't think we're going over anything
Okay.
extremely confidential yet, but
Okay.
it's good. All right, so where did you come in from?
California
Oh,
originally.
it's California.
Yeah.
I'm kind of in states. We've been so many. Like, what state is this right now?
We have monitors that do that, especially some of the monitors for our clinical trials that are not regional. They go everywhere, and when a study is enrolling heavily, quickly, they go from state to state to state, and they're like, where am I?
So I apologize if I'm asking. In fact, Robert was just catching me up. I asked, is there someone here on site that knows how to go through, find what we need? Was it Tram?
Right.
Okay.
Tram is who I met at the national meeting when we were exhibiting there a couple weeks ago.
And maybe y'all can give you one of my business cards. You can tell me a little bit more about what your needs are and what.
Right. Can I just go through
Yeah.
a checklist with you?
Checklist
Before my allergies get. I believe I didn't take that medicine.
A second. Hello. Do you have any allergy medicine that is non-drowsy?
Oh.
Like Zyrtec or Allegra, not
Allegra,
Allegra D, Allegra, anything like that?
She's so sweet.
That's kind of funny, actually. They've added some medication over in the workroom with our ibuprofen and naproxen and all that other good stuff. Would you mind checking there? Because our guests are suffering. Yeah. Okay. Allegra's got some Allegra. Okay, I love it. All right, thanks. Bye. We have a staff named Maria Allegra, and she said, I just gave my last Allegra to Maria Allegra. And I said, that's kind of funny, actually. But go ahead. She's going to round something up for us.
Okay, so I just want to go through, try and get an idea of the process, the time, and all that. So, first,
Maybe to back, so we understand that your affiliate has done tissue collection for quite a long time. So you guys have a system, and
everything from residual specimens, discarded specimens for urine, blood. You probably know fetal tissue doesn't really fall under the same category. It does, but it doesn't. And then, because of the nature of fetal tissue, we also have some of our own policies regarding it. It's
affiliate specific.
That are specific. Yeah, these are actually specific to any Planned Parenthood in the United States in terms of fetal tissue donation. So any Planned Parenthood that you would work with for fetal tissue, we all follow the same procedure. So additional documentation.
I was just because we've found a lot of different variations so far, and Deb Nucatola is kind of our contact on the national level, and has said actually it's not really a national policy. It's kind of like it's very much in flux right now.
Yes,
So.
The paperwork piece of it, the documentation that we have to have in place is consistent. How that's implemented facility to facility is different because of state laws. And Texas has some of the strictest laws in the country. So
really, obviously, abortion care in general, we all know what's going on with.
Yes. So and that's so with fetal tissue, all the way up to in vitro diagnostic studies where we collect additional specimens, drug studies. Generally, we don't deal with anything phase 1. Most phase 2 we don't, just because of the risk to our patients, because most of our subjects are our patients. Phase 2, it depends on the product, and phase 3. Phase 4, we've done those studies post-market, and then also we've been involved in some vaccine trials and some, the term is escaping me. My coffee hasn't kicked in. It's it's the type of clinical trial, it's highest risk, that is drug, it's certain biologic category. You actually have to have an IRB and a biosafety monitoring committee, a BS. I'll think of it in a minute.
It'll come to you.
It'll come to me in a minute. So the whole range falls under the scope of what we do in the research department. So we even have some sponsors that are working, diagnostic device companies, where they're developing a new instrument or whatever. And we have high complexity CLIA. We're one of the few affiliates in the United States that actually has our own CLIA and high complexity CLIA. We do our own gonorrhea and chlamydia testing here. And I'll show you when we do a tour.
Yeah.
The leftover tubes. They look, it's not an exact one, but they look similar to this. This is another brand. After they run on the instrument, we even had some people buy these. Then they wanted the leftover tubes. And said, okay, cool. So yeah, that's basically the scope of what we do. I'd say about 90% of our business right now is in vitro diagnostics, where we collect additional specimens from people at the time of their visit. Vaginal specimens into cervical, lesion if it's a bump for that, urine. We've had a request recently for nasopharyngeal swabs. So yeah, that's the scope of what we do. But yeah, go right ahead.
Okay.
So that's kind of nutshell of ours.
So the consent. Well, how do you handle that? What's your
Well, we obviously would have to have a written protocol and submit it to the IRB, developed informed consent. That's generally specific. Now, I say generally specific. We actually have 2 protocols that we call that are just umbrella protocols. And, I was thinking about this with Trom's email, and it's been rattling in my head for a couple of years that we need to do this with fetal tissue, that we just have an umbrella protocol that isn't specific to a certain, is for specimen donation or specimen procurement. It isn't specific to, the protocol itself is for procurement, but there's not a specific study that it's for. We're not going to do any data analysis or anything. We're collecting these for general research use in the future or whatever.
And is it not for a specific type of specimen either? It could be for cervical biopsies, or
we have 2 that exist currently for 2 different diagnostic device companies for their R&D needs. So the protocol is just for general specimen acquisition. And then we have a consent form underneath it that specifies why you're here for your visit. We have studies going on. You may be eligible for participation in a study and collect. Hello, Allegra.
Not have Allegra, but she has Zyrtec.
Allegra has Zyrtec.
Allegra has Zyrtec, does not have Allegra.
This is so kind of you.
Oh, you're welcome.
We live here.
Yes.
Are you not from Texas?
No.
Yeah, this is just kind of our life. Yes.
Right
Yeah,
now.
it's becoming my life. So thank you so much.
Welcome.
Welcome to Houston.
So this is just how.
Sometimes the procedures are longer. So then anything that we piggyback onto that for collection purposes, obviously, would have to reflect that additional time, cost, administrative burden.
So that our compensation that's hired to you for our specific specimen intact could be built
And
into
that's something that getting more information about it, as intact as you need, how we're going to do that. Then from there, when I'm working with our clinical trials and all of our specimen collection, additional specimen collection needs, I'm pretty bullish about getting as much information as I can prior to budgeting. Because I can't budget effectively and correctly if I don't have all the information. And otherwise I'm budgeting blindly. And I have an expression, I say, you can't budget for crazy. I need to know everything that's involved, have it in writing so I can sit down with the parties that are actually doing the work and say, okay guys, let's work this out now. And then we will even go so far as to have time trials where we go up there with a stopwatch and times how much, so we can at least know what our cost is. Because, you know, I think in terms of budgeting, if you don't even know your cost, how can you develop a budget to cover that?
Right.
Okay,
So,
so
yeah.
I want to tell this to you, that this might prevent some of your crazy.
Good.
That if you run into crazy, I want you to come back, feel free to come back to me and say, you know, for that request to match those requests, we need a little more for that specimen.
Right.
That you come back to me and say, what's your compensating for that? We want to raise it because I don't want to be crazy.
Yes.
Okay? Feel
Yes.
free.
Yeah, and I think crazy also comes when from my experience, when we have sponsors who aren't aware of the clinical component. So their preconceived ideas about how we're going to collect and how we're going to process are not in line with what we actually do, and for whatever reason they've got earmuffs on when I'm trying to explain what we do. So that's where crazy comes in, when we don't really have good lines of communication. But it sounds like you guys are really, really familiar with the process.
Exactly,
So.
and we try to pay. I think what can kind of make us different is that we can be very attuned to the practice environment that you guys have. And I'm just thinking, as we were thinking of Kate and someone who is not very attuned to the practice environment at some of their collection sites, and there have been problems because of that.
Right.
And that's not sustainable for anybody, and it's really not profitable or beneficial for anybody. And it, you know.
Well, and that's another thing it's you know, a lot of folks. I get this mainly from academic institutions. They see Planned Parenthood. Oh, you're nonprofit. That means you're non-budget. And they will come to us with, you know, budgets that are quite frankly insulting. You know, I'm like, really? I mean, where in the United States can you a consent form, you know, 8-page consent form for this amount of money, and it takes 30 minutes to administer that to a patient. So, you know, again, with the understanding that, you know, just because we're nonprofit does not mean we're physically unstable. I mean, if anything, we have to be, because we serve the community and we have to provide services to the community at a very, very low cost. So,
and
we can't underwrite anyone's research project to do that.
And what I have found, what's been very, very positive for me to this little startup, that just what the rewards that I have gotten from it personally, emotionally, that we can come into an organization that is nonprofit like Planned Parenthood and with partnering we can make it very fiscally rewarding to you, for both of us. But I understand, you know, I don't ever want to insult you, and I want it to be fiscally rewarding to you, and no crazy on your part.
Yeah, and we can definitely work on that. And as I've explained, I try to do as much as I can on the front end in having conversations like this, getting as much documentation as I can, working out all the logistics ahead of time. And as you can probably see, you know, trauma immediately got me involved, knowing that this is going to be what it takes. We already have done this, so we have some expertise here that I think maybe in other situations that you may have experienced, that not knowing what's involved and how to make this work in a facility, they couldn't account for the crazy, and the crazy was self-imposed.
Right.
So
and some of them can't see the fiscal growth for their own clinic just by thinking outside of the box and making sure everything's in place and it's framed the right way, but that this can be very beneficial for their clinics.
Yeah, and you know, and definitely, you know, want to get as much information as we can, because I'm hearing you talk about, you know, maintaining the integrity of the specimen. You know, clinically, obviously, when they're doing their follow-up with specimens, it's just to ensure everything is there, nothing was left in the patient, and move along as quickly as possible, because we've got so many people we have to serve in the community. when we have a research need or we have a procurement need, they recognize, okay, we got to slow it down a little bit. They will bake that in. We can even take it so far as to bake it into scheduling, because we have had situations where everyone that's coming in today is going to be approached about a study, and they enroll them and they collect. I mean, we've had days that we've had 6, 8, 10 specimens that we get in one day, and that to recognize that everything had to change in order to enroll. That's another thing that we do strategically as well, because my understanding is the second trimesters are only done on certain days, knowing that, okay, we have a need, and they're only done on certain days, and they're only done by certain physicians and other certain staff, and they already scale back the schedule, working that in, So I think we already have a lot of the infrastructure that will make this very successful.
Okay, very good.
So just as soon as y'all can start throwing paper at me, that'd be great.
Well, so I'm wondering, maybe we can just, and we can't get probably as specific as we would both need, obviously, right now, but I wonder if we can maybe play out a little bit what the process will look like, specifically for, let's say, just to make it easy for like a paired liver thymus. We have, there's a new client in Oklahoma, Medical Research Foundation, that's doing a lot of really interesting immunology work and expanding in that area. So if we can provide them with intact liver thymus pairs, paired from the same donor, 18 to 22 weeks gestation, and I mean, obviously, at least one a week would be good. If we can get 4 or 5 a week, it's even better. And this is for humanized mouse models. What is that going to look like from start to finish if we're using your process, imagining that we're not even sending maybe we send one of our techs out, initially just to kind of go over the protocol with trauma and everything. Yeah. But then after that, what are we kind of looking at?
So ordinarily, it's a little bit different, because the protocol comes to me. Generally, we have our meetings internally. How is this going to look? What is this going to look like? How are we going to make this work, in order for me to then move forward with budgeting? So we do that all on the front end, and look at our schedule. How does this fit into our schedule? Is this even possible? We do a feasibility assessment on the front end. Again, getting as much information as that we can to sit down and kind of write out a plan, and then I can budget, and I can come back with a budget on it. And then I'm very much a person that when we look at something like this, under promise, over deliver. So I need to get with Trom and just get specific information on how we can make this happen. Is this something that we can actually deliver on? I know last I heard, and things change a lot upstairs, that we had 1 or 2. I'm sorry, we're right next to the freight elevator here.
Oh, okay.
I think it was 2 days a week that a certain part of the schedule is dedicated to second trimesters.
2 days a week.
Yeah. Now, that may have changed. That was the last I heard, so I need to verify.
Here's something that also we've run into: if there's a specimen that you collect later in the day and we're needing to ship it to
Oklahoma. Oklahoma's close here, I guess.
Or further away.
New York, North Carolina.
Is that
we
doable?
We do that on a daily basis right now for research. There are 5 FedEx hubs in Houston that are open till 8 p.m. And my staff and I all have cars.
Awesome.
And so we drop off specimens all the time.
They're shipped out of state all the time.
And you're providing...
There's nothing in state that we ship.
Oh, okay.
Everything goes
Is that couriered, or how does it...
We will go out to our offices and collect our specimens. We're all IATA trained, credentialed, so we know how to ship biologics. We ship dry ice, flammables, UN 3373 diagnostics. So so we're doing all
I don't
of that
think
already.
we need to be talking about packaging or.
Yeah,
it
no,
sounds
no.
like you've really.
And so you
I'll show when we get to do the
Yeah.
lab piece. It'll make a little
yeah,
more sense.
and you ship fetal specimens to other states.
We
unless
have
you-
not shipped any fetal specimens.
Okay.
Everyone that has come in and collected specimens have been local.
Mm-hmm.
So,
Is that a possibility?
Oh, yeah.
Oh,
Yeah.
oh
okay.
yeah.
'Cause that's
Yeah,
just- that's where
it's
it-
really just a matter of what category does it fit into according to IATA and shipping
Yeah.
according to that category. It's also going to depend on the media because if your media is ethanol methanol based, then that puts us into category 6, which is flammables, and we're limited in how many we can put in a box. We can still do it. We just have to split it up into different
Right, right,
boxes.
no.
So we
Fetal
can't have more
tissue,
than 50 cc's in a box. So
Yeah.
yeah.
No,
And it-
not to interrupt. Fetal
No,
tissue
no.
will never be in media
sure.
like that
Okay.
because the
Especially
cells need to
type
be
B
viable.
viable.
Like it needs. Yeah, it's going to be RPMI or something
Okay.
like that.
And what's the cost there? I'm not familiar with that, so would that make a higher cost for you?
Typically with our sponsors, they set up a FedEx account for us, and we just use that account. We go online, we have it set up in our FedEx World account, and just put everything in, print up the air bill for the day, slap it on, put it on dry ice, put it on freezer bricks, whatever we need to do, and either drop it off. We have daily FedEx pickup here at about 3 to 4 p.m. And then anything that's got to be late, like something that was collected late, we drop off at FedEx. I've got a FedEx hub literally on the way
Okay.
home for me. So,
So
yeah.
we could make it across country.
Oh, yeah.
Okay.
That's
Yeah.
good because just with the fetal specimens, it's kind of taking it to the next level because the timing is that critical for the cell viability and time from procedure.
Most of our other additional specimens, because they're investigational use only, IUO, you'll hear about that some maybe from some future clients of yours, their viability hasn't even been established. So we have got to get them out of here as quickly as possible, and they're there either at the 7:30 a.m. delivery or the 10:30 a.m.
Yep.
delivery. So
Oh, excellent.
yeah, and right now is a good time because most of the time we don't have any weather issues. Wintertime, it's outside of my control.
Wow.
Yeah.
Okay, okay.
So
That's good to know.
we ship and it goes wherever. So anything that's going East Coast generally has to go through Indiana. If Indiana's having issues, Indiana or Kentucky are the big FedEx hubs for things going to the Northeast. Then things that are oddly enough, we generally don't have issues with stuff that goes to California. That's East Coast. We have a
It's
lot
difficult.
of issues. Now, if anything needs to go to Louisiana, we need to have a whole separate discussion because Louisiana we've got clinics in Louisiana. There is some sort of bad mojo or something when it comes to FedEx in Louisiana. I
Wow.
mean, we routinely have things not delivered on time, and we don't have any abortion clinics in Louisiana, so we're not even, it's not a topic of discussion, but
And Louisiana
we
might
have
be-
issues with Louisiana shipping.
Might be courier distance. How long is it the drive to New Orleans from here?
8 hours.
8 hours.
We're using FedEx or UPS. We have damaged boxes. We have things that don't arrive on time. When there's freezes that are well north of them, that's their excuse not to deliver that day in New Orleans. So
Wow.
I don't understand it. It's just we had so many issues in Louisiana. It's maddening. When I go over there and train our clinics for additional specimen studies, I don't ship anything in advance anymore. I bring it with me. I rent a Ford Explorer or something. I pack everything in the back because it's the only way I know for sure it's going to get there. No, Louisiana is unique.
You've learned.
It's very unique. At some point, we hope, we're building a new facility in Louisiana, in New Orleans. We have a clinic in New Orleans right now for family planning services. We're trying to expand and have abortion services there. So go ahead and look online at the Louisiana Picayune, which is the name of the...
Oof.
It's in the newspaper all the time.
You're trying to depress me.
It is extremely frustrating, yeah, because there's a need there, but it's just the nature of politics in the South. I mean, right now you hear about it almost every day, even in Congress and the states, on the states level. I mean, just the rollbacks in reproductive health care dynamics in this country are amazing. I mean, now they're even attacking birth control.
Right, right. What's your take on that? What do you have any?
The American Taliban? Like,
What do you think? Do you see it
there's-
changing or?
I think, unfortunately, our society's become too complacent where, some of this kind of radicalizing is been able to flourish. And I think part of it is an education thing, that people make statements about abortions causing breast cancer or birth control causing autism or things like that. And our general public is so ill-educated.
scientifically uneducated.
Exactly.
Yeah,
That
scientifically
they
illiterate.
don't understand. So if they say, oh, well, emergency contraception is an abortifacient because it doesn't allow the fetus to implant. And not understanding,
What fetus? There's no fetus in it.
they mix up terminology, and it sounds good, it looks good. People, oh yeah, that sounds right. And in some cases, like some politicians that are actually OB-GYNs that come out and say these things, they're credible. So yeah, I think it's multi-pronged. There's a lot of reasons for it, but we can just kind of.
How do you fight that though? I mean, what kind of plan can education obviously one? What
Education, one, we just keep providing the best service that we have, because 1 in 3 women have attended a Planned Parenthood for services in their life. So when you have media spin about, Planned Parenthood's goals are this or whatever, you have people that have been here and like, I didn't get that. I got really good service. I got treated nicely. I wasn't judged. Got to do these studies. I got a stipend. I got free testing. What more could I ask? We have our patients say that all the time. So all we can do is just counteract it.
right? Okay.
Yeah, to an extent.
Yeah. So don't be depressed.
Don't be too depressed. Yeah, it's just one of those things. Every once in a while we step into a time travel machine and we end up back in the 1950s and politically. So, yeah.
Kind of comes in waves.
Comes in waves.
Yeah.
All we've got to do is keep researching, keep science out there, keep valid information out there, So,
Okay. Very good.
good.
Excellent.
Okay, so I need to talk to Trom about ways, just with this little bit of information, visit with
Right.
her about feasibility in general. Before we make any commitments, how is this possible? Let's think about this, let's think about that. And then the shipping, that's not.
Yeah.
It sounds like that
That's
is
a
very
that's a
streamlined already.
non-issue.
Now,
Yeah.
your later cases here. What is your exact upper gestational limit?
That was something I'm glad you said that, because with the laws that changed, our terminology is slightly different.
Okay.
So instead of, we still use gestational weeks, but it's calculated differently from estimated date of conception versus L&P. So I need to make sure I'm speaking the same language. I think we go up to 20. I don't think we go past 20. Pretty sure of that.
And do any of your providers use DIG?
No idea. I have to ask.
Oh, okay. Yeah, because digoxin kills the tissues, nukes the stem cells. No feticide, can be used for.
I don't think we do.
Uh-huh.
I have not heard of that. And we get together for certain types of meetings within the organization. There's operational discussions. I've never heard of digoxin.
Okay, yeah. I think Tram said that you weren't using it, but I just wanted to cover, because that's kind of a pretty important baseline.
Yeah. It would impact your tissue samples.
They would be unusable. I
Yeah.
have a colleague that tried to do, just for kicks and giggles, tried to do a cell isolation on a liver from a digoxin case. Nothing. Didn't get anything out of it. It's a feticide. It destroys everything, so it just can't be used. And then the other question, the later cases, are those 2-day procedures, 1 day? What's the cervical prep like for those?
Cervical prep for You saying later, like
For 16
16
plus.
16
Yeah.
plus. Again, that is state specific. The patients are required to come in on, for instance, on a Monday, have their ultrasound, do a lot of their documentation, et cetera, et cetera. Then they come back on Wednesday for their actual procedure.
Right.
So, and depending, there may be some activity at home in terms of medication or whatever on Tuesday in between. So yeah, I have to get those details.
Okay.
Because that, again, when the laws have, as the laws have changed, we've had to change our procedures as well. And we're kind of in a weird point right now where we've changed a lot, assuming that House Bill 2 is actually going to be upheld by the Supreme Court. So we're kind of in this limbo right now of this is the way we were doing it. We went ahead and have started changing it, just assuming worst case scenario. But now I have to get updated on that personally because I'm not aware of the changes.
Okay.
So what is the cervical prep for 16 weeks plus? Is any other prep that you're aware of that happens elsewhere that?
I mean, it used to be the case. Second trimester, especially later second trimester, was always at least a 2-day procedure. You get whether lambs or Dilapan the first day inserted for overnight cervical dilation, and the next day is the actual procedure. Lots of affiliates are starting to use misoprostol now, either just alone or in addition to some kind of mechanical dilator. And sometimes they're doing that overnight. Sometimes more and more are moving to all same day prep, even for up to 18-20 weeks.
I think we're doing, because of the regulations, I think it's all same day.
It's all same day.
I think just when you're saying this sounds familiar to something I've heard recently. So okay.
Would it be helpful for you to see, or I don't even know if you have this, a client list and what, like just today's, just to see what's going on today, what's the volume, what would that be helpful to you? I don't know if you can provide that.
It would be, yeah.
Yeah, I can't in terms of a client list. I can see if Trom's got something.
Is there anyone in surgical today who's around, or when we do the tour? If
I can. Do you have it? Finish this here. Yes. It will depend on when we get wrapped up in their. They've got basically 2 clinics that happen. The ultrasound clinic, because the ultrasound has to occur 24 hours for the procedure, and then we've got the other half where they actually do the procedures, and it varies day to day, which is first, which is second. So I'm going to shoot her an email real quick and see if we can pop up there, because she had asked, and I said, I don't know if we will need to see your facility. I will let you know.
Oh, is that Tram?
Huh?
Is that Tram you're talking about? Oh,
yeah.
So she's here.
Yeah.
That'd be great to see her again.
Yeah. She's awesome.
Yeah, I could tell that she was really passionate about it, and it just looked like it. Now, is she the only procurement technician that they use in the? No, so she's got a team of people.
She's got a very large department.
Oh wow.
Oh, Robert, I'm thinking about that, the conference call,
Do y'all need time for?
No,
a conference call?
I want, if we need
What
to
time
talk
are we
about
at
this
right
with
now?
you, the sickle cell anemia, the research that was.
Oh, so that's the other. So there's another potential client who is working on sickle cell anemia, and is looking for specimens. He needs kind of everything from the hematopoietic system. So we're talking liver, long bones, and cardiac. So heart specimens. From
intact also.
All intact from African American donors only, because we're looking for then this is probably, as I was kind of playing this out in my head the other night, thinking about it. I mean, in theory, there are prenatal screening tests for sickle cell anemia. That's probably too complicated to try to insert that, and it might be easier just to.
Gestational age, they
Right. No.
it
But
would have to be family history.
right, exactly. Well, and so it was. Do you guys take family history for stuff like that, or is that in your
Again, that falls
records?
under the research part of it. If we're doing this under a research protocol and we have a need for that information, it's something
Right.
that we can integrate into what we do.
Right.
So
Right.
I don't think that that is assessed initially.
Yeah.
Different types of anemia are, obviously, because we're doing
Right.
a procedure.
Right.
So sickle cell anemia may be included in that. I don't. One second, I can ask.
Okay.
Hey, quick question. You're upstairs. Do you remember if any of the intake involved assessment of sickle cell anemia or on any of the history questions or anything? Okay. Okay, so you've seen it. Okay. Okay, all right, thanks. Yeah, there's an anemia question, and there's an other, and if patients have sickle cell, it's generally a write-in.
Oh, interesting. Okay. Because the other thing is, too, it's something, I think it's the prevalence of the carrier gene among the African American population is like 1 in 12. So if you have 12 patients, you have 12 termination patients of African American descent, during the week, and that means statistically at least one of them is likely to be a carrier, so at least one of those fetuses will have, will be appropriate for inclusion. And I imagine that he would want controls as well. So it might just be a matter of, if there's 12, if there's
everything from
collect.
African American, and you're going to have your controls. You're going to just by numbers. You're
Exactly.
You're going to see it.
Exactly.
So instead of trying to find out, because some people just really don't know.
Yeah.
They don't know, and yeah. So it's a little. Let me grab this because she may have follow up. Yes, ma'am. Oh, okay. Thank you. All right, bye. So speedy. She just sent me the intake form so I can look at it and see what is on there. Let me print this up for us. And then, so again, whenever we have a need for additional information, for our family planning samples, Pap samples, endocervical samples, what have you, we have electronic medical record. So our research questions, we build what's called templates. So we get the information from our study sponsors on what data they need that is not our standard of care. And we build a template. So as a patient is seen, let's say she's coming in for her well woman exam, there's a template. It's just think of it kind of like a back in school, how we had the projectors with the transparency. Another question and another question. Yeah, so you put the transparency on there and all these questions get asked. And if she wants a depot, then we have another template for that. Well, then anything that's research specific, once the patient consents, our procedure is to then merge the template and ask all of those questions that are specific for research. So anything that we would need to do in terms of the data behind the sample, we can integrate that in too. So, because now, Trauma's department has not moved over to electronic medical record yet, but that is something that we can still integrate in there. Let me go grab that off the printer real quick.
Okay.
Right back.
Excellent. While you're doing that, is there a restroom
Yeah,
around here
right
that
here.
I could use?
Very close by.
If we could just.
No, I have another question. Were you up there when they were doing the second trimester procedures? Do you know because I know they have the ultrasound like on one day and then 2 days later they actually have the procedure. Do they do anything in between, or is the entire procedure, including any cervical prep, done on the second day? Or second visit, I should say. Okay. Yeah, just wasn't sure if that was part of what you got on the front end. Okay, just curious. All right, thanks.
Were they doing second tri cases today?
I'm not sure.
Oh.
That's actually one of my staff who worked up there. But she worked in a kind of a specific area. Yeah, I don't have access to the calendar to see what's on the schedule. going to check that out. Okay, so we'll wait for Trom. But this is an example.
Oh, is she coming down here? She's just
I
calling in.
sent her an email. We already had dialogue back and forth, and I told her you may or may not want to go up there, and so we've already talked about it.
Yeah,
So
we would.
I
Yeah, I
shoot her
think we
an
would love
email.
to take a look. It's just
Oh,
mainly
sure.
the path lab to see
Yeah,
if there's
see.
any specimens today.
And
We
if
could
they're-
just kind of get a baseline of like
They're
what.
doing, what is today? Today's Thursday.
Oh, today is Thursday.
I was thinking it was Wednesday. I was
Almost
going
Friday.
Yes.
TGIF tomorrow.
Exactly. I can't remember what they're doing in the morning versus, because if they're in the middle of procedures right now, we can't. But if it's ultrasound time, they're not even using the procedure room, so it would be a perfect time. The only hitch is it's an ASC. It's an ambulatory surgical center, so it's like a surgical suite in a hospital, and you have to be scrubs, booties, everything
Oh gosh.
to go back there.
Is it even if there aren't procedures going on? Oh wow.
Oh yeah, it's sterile environment. Yeah. So, but I'm sure. I mean, we've got a scrub service.
like
So they probably got
extra,
scrubs
yeah,
and stuff
yeah.
we could change into. Even me. I mean, I'm in scrubs, but I've been outside. You know,
Uh-huh.
so you have to be in those scrubs.
Yeah.
So, but yeah, I can check with her.
Is that something that you need me and both of us? I mean, or are you okay?
I mean, if you, I thought you probably wanted to see it, but I mean,
Well, I've
if you
seen-
trust my judgment.
I do trust. I mean, it's really your
Okay.
expertise, and I mean, I would like to see it, but the whole scrub thing.
Not doing that.
Changing. It's not necessarily the scrubs. You have to go through changing and
Right.
the
Yeah.
hair and everything. Yes.
See, she gets it. It's the hair.
Mine generally, this is my God-given gift, and my hair, my curly hair, but it does get out of place when you're changing frequently. Things kind of, get fine.
So, what would it? I mean, I really would like to see it, but is it something I could just slip over, or do I have to take off?
I don't know what they'll require.
Okay.
I rarely have to take anyone up to the actual surgical area. For
Okay.
most of my research stuff, they want to see the ultrasound suite because, you know, there's ultrasounds
Yeah.
that we do for our contraceptive studies and what have you. So, which is not part of the actual surgical suite itself.
Yeah, I mean, it's really just the path lab is one.
Yeah.
You know, the specimen lab, or I don't know what your term of art is for it here, but
You know, I think they call it the POC lab.
the POC lab.
Yeah. In our, they might call it the procedure area too, depending. So, yeah, I'm not gonna bore you
Okay,
trying to
we'll
describe
see.
it. You'll see.
Yeah,
It's
yeah.
nice. Yeah,
Okay.
you'll see.
And you don't have to be in scrubs for that area. Is it?
Oh yeah,
Oh, you
it's in the
do?
procedure.
Ah.
It's
In the
attached to the
surgical suite, yeah.
procedure areas. So
Okay.
yeah.
Okay.
So yeah, I'll talk to. I sent her an
We'll see
email.
what Tron
She's
says,
really
yeah.
good about getting back with me. So yeah, just glancing on here and seeing anything. It's pretty thorough. They have hemorrhagic disorders, blood won't clot properly, leading to too much bleeding, blood clotting disorders, factor
Yeah.
V Daleiden, protein disorders, blood clots. So.
No, they have
But this-
anemias mentioned twice, on
Yes.
once on each of these forms.
So yeah, I'm pretty
That's
sure
good.
it comes up in discussion if it's an issue. How about while we're waiting for Trom to see the email and respond, I give you a little tour of our space, our
Yeah.
lab. Lab will probably be more pertinent for where we actually ship from. So any specimen that is collected upstairs, processed upstairs, generally we work out something with the staff where one of my folks runs up, grabs it, does whatever we need to in terms of maintaining temperature, either put it on dry ice or whatever, and then we bring it and ship from our own area. So we can do a little tour of our space in my lab, just so you have an idea for future reference what else we have. So if you don't mind,
Yeah.
I'll move around a little bit. And I've got my iPhone so I can see when she's replied to it.
Oh, good. We'll come back so we can get these later.
Oh, yeah. So you saw where you came in the front and you checked in with the security and the intake desk. Directly across the hall is our family planning dysplasia, and vasectomy clinic. It's all on the other side. They have about 9 exam rooms, probably about 20 staff that work in that area. The majority of the patients that come in are for family planning services, but again, we do a lot of our research activities over there in terms of enrollment.
Okay.
This area, as you come in here, is primarily the research wing. We have a couple of offices over here. They're for our HIV outreach counselors, and as the name implies, they're outreach and they're out of the building most of the time. They're here often when they're doing results and counseling patients. Conference room. From a research perspective, we have a lot of meetings.
Yeah.
So we have a conference room that was built into this space.
Good.
Our startup meetings, our training meetings, just, constantly. The storage closet with additional specimens. We have, and as you can see, there's barcode access. With additional specimens, we have a lot of product that comes in that we have to utilize, in terms of collecting those additional specimens. So we have to be a little diligent about making sure that all of our product that is for one particular study stays with that study, because oftentimes we have studies that are using similar approved products as a comparator. I don't know if you've been exposed to that yet. You have it's like, let's say if you're developing a new test for herpes, and you want to demonstrate to FDA that this works, you have to compare it to an already approved test. So if multiple companies are doing studies on herpes, they're comparing to tests that are already approved. We have to keep all of those approved products that we're going to be using separate, distinct, and not commingle them. Yes, so anyway.
Are you guys working with Lisa David with Medicines 360, the new IUD that they're developing?
Yep. Oh yes, been involved in that. So this whole hallway is the research space of a lot of our drug studies, and all patients come in. We have to get our vitals, we have to collect blood, we have to collect urine, so that's kind of a mini lab. This is Christina. She works in our department. She helps move budgets and contracts.
She helps directions
yes,
too.
she's a traffic cop. And this is LaShonda. She is our research nurse, and she also handles employee health. Who knew employee health done in research? So
and guest health.
I'm sorry?
I said and guest health.
Yes. And this is Erica's office. She just walked down the hall. If you want to go in here. Hey, did you notice I've fixed the sign?
Fall again?
It's gone. I don't know where it is. I swapped them.
Oh, okay.
We have our own exam room. We, again, because we do drug trials, patients have to come in more frequently than standard, so we can make sure that they're safe. So that happens in here. We have done in the past a lot of phlebotomy collection for new HIV tests, new hepatitis tests. So patients come in and they just donate, 3 or 4 tubes of blood. So we have lots of phlebotomy chairs around here. So we're all checked off to collect blood. This is our investigational product storage area. Temperature maintained. So our study drugs that have to have restricted access, or any types of products that have restricted access, they're kept in here. And this swipey, only like 5 people, us and our security manager, are able to get in the room. And this is Joanna's office. Hi, Joanna. And Joanna, I stole from our family planning clinic across the hall. She comes to us with a kind of varied background, working in family planning and dysplasia, and she's also worked in our surgical services area. She's the one I was calling a minute ago. She's
A good steal.
Access. I got access. Okay, so we ship a lot, and we ship often. And all of these different types of shipping containers are what we use to ship different types of biologic specimens, from dry ice to refrigerated, Category 6 flammables. So it's organized, though you might not be able to see it, and then the different volumes as well. So these, depending on what types of studies are going on, all these boxes in this room will get turned over probably about once a week, once every 2 weeks, because I mean they just go out and come back, go out and come back. So we also have had some projects where we are doing the lab testing for an investigational product, and other facilities that are collecting or participating in the studies send the samples here. We handle them here. Our loading dock is right here. When we were building out, we bought this building and completely took it back down to girders and beams. Strategically, we put the research wing here because we do so much shipping and receiving. It makes it easy for shipping and receiving because then they're not taking things all over the building. And we're just right here. So yeah, it works out really, really well. And then yeah, it's a full-size loading dock. We can take pallets. So.
Who handles your medical waste disposal? Is it Stericycle or someone else?
No, it's somebody else. I can't think of their name. It's a recent change. I'd have to ask. So this is our lab. The lab is split into 2 pieces. The lab on this side is our clinical lab, gonorrhea and chlamydia testing. We do our point of care testing. Controls are generated here and sent out. This instrument actually diagnoses gonorrhea and chlamydia, herpes, and trichomonas. And then this is the research side. We have dry ice container here. We have another dry ice container on the other side of the freezer. We have dry ice containers in about half of our family planning clinics. So a lot of our specimens that we have, as I mentioned, are not stable for very long, so we've got to put them on dry ice real quick. Computer set up and everything in here. It's really one of those things that's neat to see in action. You know, when we're handling a lot of the specimens, we have, as I mentioned, 2 incubators, 1 freezer that locks, the big tall one's a freezer, and then the 2 refrigerators. Just lots and lots of space here in the lab for our stuff that we've got to do, and of course, you know, all of them CLIA compliant. We maintain temperature logs and everything. Sure.
So I could take a look inside. Oh, excellent.
We have all of our studies broken out to little baskets, kind of squirrels or things in baskets. And I don't have any studies right now that are using dry ice, so there's nothing in the dry ice box. So it's
Very nice.
yes, very nice.
This is reminding me of a laminar flow hood. Do you guys use those for fetal tissue collection? I don't know.
We don't. We did have a study many years ago that used a hood, and I can't remember exactly what it was for. But it turned out it wasn't even a hood. It was actually just, it blew air down, which I'm like, that sounds counterintuitive to what you would want to do.
Is that just boxes for storage? Yeah, it's a storage back then. But
Yeah, the instrument goes through a lot of products, so Miss Jane keeps the products in there. There's a lab tech, she's at lunch now, that works on the other side.
And still empty shelves. This is good.
This is the area where the couriers that bring the samples, our family planning, our gonorrhea and chlamydia samples from all our family planning clinics, they pick up empty boxes. The clinics send their samples back in boxes. These are extra boxes for that. This is the research side. So when we're functioning as a central lab and other facilities are sending us their research specimens, that's here. So shipping and receiving, I usually give them a list. These are all the facilities shipping to us, to our lab. They're going to have this code on it. Those boxes go here. So we instead of taking them to my box room, they go over here. So yeah, we have a system in place for that.
Very good.
But yeah, this is my favorite part of the whole building. I love the lab. I think I was a lab tech or something in a previous life. Excuse me. See if Tom has applied back yet. Hopefully we'll have time to go in there and visit.
What time is it?
It is 11:03.
Do you know the range of that call? What
They're supposed
time?
to text me sometime between noon and 1 and let me know
Okay.
what's going to happen. So.
No, she hasn't replied yet. Wait, I checked with. Hello. It's Thursday. Do you know if they're doing ultrasounds first or clinic first? You know what their schedule is up there today? I don't either. I know what it is on Mondays and Wednesdays because of Dr. Fine. Well, I sent Trami an email and I didn't want to. I went into ECW, but apparently I don't have access. Yes? There was nothing? They're not doing that ITT training today, are they? I thought that was just Southwest. Okay. Okay, I see what she chimes in a meeting. Okay. Yeah, because when I click on it, nothing comes up at all. But you may have different access because you with the employee health stuff. Not that that should necessarily mean anything in terms of, you know, patients. Mm-hmm. Okay. Because we're going to need to go over to the area where they process the POC and look at that, and that would be ideal to do during ultrasound clinic. Are they running the clinic simultaneously? I was under the impression they were not. Yeah, that was my understanding too. So it sounds like it is. And concurrent clinics today. Oh, okay.
So that's not good, right? If we have concurrent, it's kind of high.
Okay. Okay. All right. Well, it Outlook shows she's in a meeting, so okay. No, I'm seeing items. So okay. All right. Thanks for your help. Bye. Yeah, they're having, today's a concurrent clinic day, so they're
Oh, wow.
ultrasound and procedures. And Trom's in a meeting right now, so, but she's only in a meeting until noon. So did you guys need to get on a teleconference call?
We're not sure yet. We're going to find out in probably the next...
Because, I mean, I can set you
Yeah,
up in
just
the
text it
conference
down,
room
yeah.
next door
Mhm.
if you need to, and,
We're just waiting for a text. We're kind of in limbo here.
yeah.
It might
Kind
not
of
even
I'm waiting for Tom, and we're kind of in limbo. I want to take you up there and have you see the space, but if they're doing concurrent clinics and they've got people in one half of the clinic having ultrasounds and the other half of the clinic doing procedures, and she's in a meeting, so we'll just wait for her.
Yeah.
We can tread water here for
Yeah.
45 minutes or so.
When do you think she'll be done with?
Her meeting on the schedule, she said she's in a meeting from 11 to noon, so she's
Got
in a
it.
meeting this hour. But I don't know if she's in the meeting talking where she can't look at her phone and see that I emailed, or if she's in a meeting just, you know, attendance check, and she can actually look on her
Yeah.
phone and answer me. So
So you said that you guys have been able to provide neural tissue before to multiple
yeah,
researchers.
we
it seems.
had. I'm trying to remember specifically the company that was doing the procurement. When I got here, and a little while after I first started here, I've been here for 9 years. I am positive theirs was for neural.
So when you got here, there was an outside company that was handling procurement. It was not.
Yeah,
It was not an internal PP Gulf Coast thing. Oh wow.
Yep.
Okay.
It was a company that they were doing stem cell research. So, and I don't know what happened to them. I really never followed up to see, you know, what became of them. So I think I heard their name mentioned in reference to something because, you know, Governor Perry has had some sort of stem cell procedure.
Oh really?
So, yes.
How ironic.
How ironic. Yes, so yeah, he's a little more relaxed about the whole adult stem cell topic than maybe some other folks that, you know, stem cells just, you know,
Yeah.
bad.
Yeah. No, you know, when I go to stem cell conferences, regenerative medicine meetings, they have whole sessions where that's all about how do we talk about what we do publicly, and how do we educate the public, how do we frame some of this publicly, similar to some of the discussions that you'll have at like NAF or the Planned. And it's really interesting how there's a lot of crossover in some of these worlds, although maybe the levels of intensity aren't always the same.
Yeah.
So it's just been a real neat
I think
thing to see.
there's a lot of areas where there's just, again, the public is so uneducated on the topics that, you know, even when I talk about research and drug research and what have you, there's this weird faction of society that, you know, anything from a drug company is bad, and you know, these conspiracy theories that people are trying to manipulate you through drugs, and you know, drugs, you know, drug companies they have the cure for, that's my favorite, they have the cure for cancer, but you know, they won't make any money off of it, so they don't use it. And yeah, I mean, it exists, I think, in lots of areas of medicine, not just specific to abortion or fetal tissue or stem cell, even though it is a little more rabid in, in those groups.
Yeah.
Yeah, so, now tell me, you mentioned, her name is escaping me, up at PPFA, our national office, not Ellie.
Deb Nucatola.
Deb Nucatola. So are y'all going to be working with the national office?
Yeah, we've been coordinating with them as much as we can, and Deb's been really helpful in terms of figuring out, you know, which affiliates to kind of hit up first, and which providers are going to be most.
Usually they try to centralize this within the research department. Are they not doing that?
No. So I mean, so what Deb has told us is that they used to be trying to do everything under research, and then decided because it's not, you know, just collecting tissue unless the affiliate is directly partnered with an academic scientist, which you guys have been for the most part, but it's different for like a third-party collection agency like us. So just simple procurement or collection is, you know, they said research is kind of overkill for that, and in some ways it you know, sometimes is. But I guess the national office also, there's a lot of discussion about exactly how involved they want to be at all in this whole issue, and maybe and like legal is saying no, like we don't want to get too involved with it, like let it be on an affiliate by affiliate basis. And yeah, so it's kind of, it seems like it's all, I guess there was a whole, I don't know if you were at the, no, you weren't at the national meeting because we would have met you with Trim otherwise. There was a whole panel discussion on tissue procurement, you know, kind of in the context of fetal remains disposition. And I guess they're, you know, maybe looking at drafting a new national policy or memo or something, but it's kind of all up in, it's yeah. I mean, you know, when we first started talking with her really in depth over the summer, I had said, you know, really what would be great is, you know, could we get some kind of like national clearance, like with PPV National, so that we just go into any affiliate that has the volume. And apparently one of our competitors had actually approached National a year or two ago with exactly the same request, and that had generated a lot of discussion. And legal had said, you know, at this time we don't feel with the Supreme Court, and we don't feel like that's a wise, you know, move for them to be doing.
Especially it was state to state, the regulations are just so different in terms of how abortions are performed. I think that's probably the biggest underlying factor there, because historically anything research related over the past, I'd say 5 years, the national office really wants to centralize anything that's research related. So if we're going to have ideally, the way I see it, any kind of a ongoing procurement type of system, we're going to need a general sample acquisition protocol. We're going to need a consent form that can be utilized. Even though it's not absolutely required per regulations, it makes the most sense to have an informed consent-like document that the patient signs and says, you know, I am giving this up, I'm not being paid for it, blah, 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 has all that language in it. To me, that makes the most sense, and that would make the most sense to do at a national level and ask affiliates who wants to be involved and submit that to an ethics board on a central level. That makes the most sense to me, but for whatever reason it sounds like that's not, because I mean that has been the deal with research for the past 5 years. They really would like all research centralized, and affiliates like mine, we've had a long-standing research department for 20-something years. We're a little resistant to wanting everything centralized because we've been doing our own thing for a long time. So, that's kind of surprising to me that they're taking that position with the fetal tissue.
I mean, it sounds like the positions are all in flux right now. I mean, because then I don't know if you know Deb Vanderhei with PP Caps. I guess she's only been there for about 2 months or something. And that's kind of like one of her first tasks now is to try to get a handle on who all is doing tissue collections. They don't even know at the national, you know, how many affiliates are doing it and what the situation is. So it sounds like, which is unfortunate for us because we were hoping that CAPS could provide like, you know, just the master list of who's going to what gestation and what the volume is and all that. And it sounds like it's all.
I'm so surprised.
Yeah. You would think with researchers, we kind of like, we would have our whole spreadsheet and everything already figured out.
I am very surprised by that because that information is collected. I mean, it is part of being a Planned Parenthood. It's very loosely related to like a franchise. And there is annual information that we have to submit about our operations. There's policies that are called our standards and guidelines, you know, for how we conduct our business. Every affiliate is a separate and distinct corporate entity, but we still function all under the same guidelines and principles. So when it comes to whether or not they have the data, I know they have the data. I know they have the data. I know they do. How they're parsing it and able to get that for you is another question.
Yeah, maybe it exists in like 500 different emails and it's not in.
I just have a hard time.
I was surprised, but several people from CAPS said the same thing. That we don't know.
Do you see it as an easy thing to have and produce, or like what? I'm sure you have a very efficient system here.
Yeah, well, because they're not part of our electronic medical record yet, the numbers are kept, but they're not kept where I can get my hands on them because they're not in our medical record, because anything like if you were to ask me how many PAPs we did this year, I can pull everything up and look it up. But because they're not in ECW yet, I can't. I have to go to Trom. But that number is kept because we have to report it to the national office.
Right.
So that's why I'm confused that no one is able to get you that information.
Yeah.
Because I know there's reports out that get sent out every year about how many family planning services we provide, how many STI checks, how many HIV, how many positive HIV tests we detect, how many abortion procedures are provided. I know that exists because I've seen it.
Yeah.
So if we have to compile it in order to report to the national office, they should have the ability to compile it and generate a report. Now, does it go into a breakdown of per trimester or, per week, gestational week? I don't know if it goes into that level of detail. I know that it definitely exists on our level. Whether or not it's a required reporting element up to the national office, I don't know.
Yeah. So now, do you guys have required reporting for your fetal tissue collection? Like, is your program something that, because you said they do want to centralize research, are you guys providing that? So, yeah.
So in terms of reporting, any study has to be registered with the national office, and the legal department reviews the contracts, mainly for indemnification language, to make sure there's mutual indemnification language.
And they do that, National Legal does that for all of your research contracts, including for like Baylor researchers using fetal specimens and all that. Okay.
Yep, they review all of that. So now as far as record keeping, how they retain that information up there, every single study that we submit gets assigned an ID number. I don't know if it's in any type of database where they can search and see that there are this many studies going on out in Planned Parenthood world for fetal tissue. I don't know how it's maintained up there.
Yeah. And then on the flip side, is there a national standards and guidelines for fetal tissue collection that you guys follow, or that really? Because that's what we were asking for, is something that we could be able to tailor what we're offering
that's why
to
when you were
those.
saying
So
this,
that
I'm very confused because it's there. It's going to take me a minute to surf to it.
Yeah.
Because I don't access it that often.
You have it memorized at this point. It was just set up and your system is good.
Well, if it's for fetal tissue, I need to, unless anything has changed this year, it's been the same. There's a form that we have to use with the national office that the physician that is performing the collection is not involved with the dating, but then that obviously would have changed because that's actually now a state requirement now that whoever is doing the dating has to be the same physician doing the procedure. So
what do you mean by dating?
Gestational age.
Just doing this,
yeah. And then there's another form where we have to attest that the patient is not being paid for the sample. There's just all the little check boxes and what have you. And this comes directly from the national office. So give me a second. We just went through an overhaul of all of our network drives in an effort to clean things up. And I need to figure out where the standards and guidelines have been moved to. But let me see. Yeah, I mean, anything that falls under the umbrella of a study, so, either for sample collection, additional sample collection, I guess there's a vague definition of, because I mean, I even go so far as to submit it for our residual or waste specimens, like if someone wants to collect urine, from patients, we have leftover urine in the cups. We've done that and we register that. They've never pushed it back and say, no, this doesn't meet the definition. You don't need to do this. front end, okay. There's just the general policy that I'll research anything involving additional specimens, anything like that gets routed through me for this department, so there's that. Let's see how I do that. There actually used to be an entire section under the abortion services for fetal tissue donation.
Oh, wow.
Yeah, I just remember when I first started here, there was that project going on, and I'm like, okay, I need to, this was totally new to me. I'd not done that in my previous life at Baylor, so let me brush up on this.
It was under the abortion services section, but it's no longer there.
I'm not seeing it, but that doesn't mean it wasn't combined with something else or renamed.
Mm-hmm.
The renaming of things is something that happens.
Can you search the document for fetal tissue? No.
Yeah, no,
Okay.
the way they've got this broken up, I can't just look for fetal tissue.
Because I'm just imagining if we could, like for NAF, for example, if we can say that we've constructed a plug-in solution that is that fully tracks with the Planned Parenthood, with the PPFA standards and guidelines on. ABR and STEMX can't say that. We could.
Ideally, I would be able to go up to the national website and look out there. Y'all's timing is particularly not good. That they have recently changed vendors who handle all of the remote access stuff, and most of us here at PPGC can't access the national website at the moment.
Wow.
Well, it's kind of a pain though, because we're required when we have new employees have to go log in and do all this training online, and
You can't
we
do it
can't
now.
comply because nobody can log in. So yeah. Oh wait, what did I wonder if I went ahead and downloaded it already. Let's see. remember where we ended up archiving all the old Amphioxus stuff? Not the boxes themselves, but online. I mean, we didn't keep much online at the time. Yeah, I need to get with IT and find a way to tie stuff down to where it doesn't move like that. Do you remember, maybe let's look in the academic stuff. Do you remember the different checkoff lists that PPFA required in terms of this person, performing the abortion but not perform the dating and blah, 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 those 2 forms that we had? Where were those? Do you remember what those were tied to? I know they weren't tied to our SOPs. They came out of the standards and guidelines, right?
I texted me. I wanted anything until 3. So I can go for the call.
Yeah, no, that's okay. I'm just mainly looking at the for that form. That it's we're having a discussion about PPFA. We're saying that they don't standardize anything in terms of fetal tissue collection, and yeah. Right. Yeah, of course. Yeah, I'm just not seeing it there. I found it. I found it under pending studies, because the folder's moved again, under historical. So historical, yes. Historical studies, and then there's a tab for it. So, yeah, but this is from 2005, so it may not exist in our standards and guidelines anymore. So, okay, anyway, yeah, it existed. I'm not hallucinating. Okay, all right, bye. No, I'm not hallucinating. This is from PPFA.
Is there any way to get a hard copy of it?
It probably doesn't. They may not. If they're telling you that this doesn't exist anymore, this might not exist anymore. So let me print. Yeah, I'll print.
Yeah.
What it
Humanitarian
was.
programs. This is good.
Yeah, I mean.
I like that. Why would they get rid of that?
Well, if it's just becoming more and more complicated on a state-by-state basis, it might be that this is hard to implement. And you don't really want to enact a policy or guideline that everyone can't follow. So, affiliate aborted tissue donation programs will be monitored as part of the affiliate recertification process, because that's what I'm saying.
Has that ever happened?
Yeah, well, because it falls under research, so they lump it in, and as far as the monitoring goes, that's our registration and stuff. Counseling. See, the following must be involved in any protocol. So here's information about what we have to say in the protocol itself. The consent. There's forms that we have to use. The clinician has to sign a form that says the tissue is donated, the consent was obtained prior to collecting the tissue, and no alteration in the timing of the pregnancy. That's the thing. Timing of the termination of the pregnancy, or the method used was made for obtaining the tissue. That's why I said we can do it in terms of following this. We can't delay her abortion in order to get a later gestation. Of course, that's unethical, or anything that's going to put her at risk. In terms of no alteration was made to the timing of the termination, or the method used. So if we're going to be doing a surgical procedure, the surgical procedures going to be the same. We're not going
Right.
to say, hey, let's experiment with giving you, whatever medication.
Prostaglandins and stuff like that.
Yeah, exactly. Yeah, we're not going to do that.
Right.
So-
No, but a D&E is a D&E, and then the order that you do things in is.
Correct. So this existed. See, that's the thing is sometimes they change these titles. So I just need to find the. See, here's even the consent form that we had approved by the IRB. And I kind of neurotic about keeping those because I don't
Right.
like to be creative and come up with my own language. So
Yeah.
I like to steal language from previous ones.
That's
So
why I'd like to see for us too, and putting it in your language.
Yeah.
That'd be nice to have a copy of that.
What we can do is we've used. I'll go grab this off the printer.
Okay.
I think. How late are y'all planning to stay?
I just got the text. They pushed it back to 3.
Okay.
So we don't have to stay until 3. But
No, you're welcome. I mean, I blocked the whole day. I didn't
wow.
have any plans one way or another to cancel today. That's why I said your timing is good because some things got moved around on my schedule, and Thursday was going to be free and all day.
Yeah,
Charm's responding, so we're trying
good.
to.
Yeah, if she's available, I think it'd be good to loop her into the conversation, and I suppose just to get a kind of a baseline visual of what the POC is looking like, especially in second try. Like if there's still stuff in the freezer from, or if there's stuff from today, like it would be great to take a look. And they also, you said in the POC lab, they have like a separate station for actually doing tissue procurement and dissection, and you said there was something set aside for that. I thought.
It depends. Like if they are going to have, if the procedure is for evidence, then everything changes
Yeah,
because
sterile
it's got to be
field
sterile, it's got to do this. So it's the same space, it's just set up differently. Yeah. And we do the same thing in the lab. If we've got a study that is for a certain thing and there's a potential of contamination, then we use this bench, and it's just a matter of saying, okay, it's this space instead of this space. It's really just a matter of space allocation. So. She's going to see what she can do and let me know. Same thing. It's a dual clinic day. I didn't. I think with the increase in volume that we've seen, because there's so many of the abortion providing facilities that, with this law kind of in limbo, they can't really operate like this, and they've already gone out of business. So we've already seen an increase in volume, a huge increase in volume. So they are probably now where they used to have. Abortion clinic was one time, the ultrasound clinic, they're having to do them simultaneously, and it's probably a little hectic.
Wow.
Okay. She said that the front, if we wanted to tour up there, we could go see the front, which is intake area, the waiting room, the ultrasound area, the counselor's offices where they consent the patient and counsel the patient. But the back, which is the actual surgical area, they're running really late in the back, is what she said. If just the front is okay, anytime after 1 p.m., but the back is pretty late. And I replied back to her and I said, they really want to see where the POC lab. So I didn't.
Probably the only visitors you will ever have.
Want to see that area. So, worst case scenario, all of us are armed with iPhones. I'll go up there and just do little video snippets or a little photo, whatever we need to, so that you guys can see what you need to see. So,
excellent.
'cause I totally understand that. We have so many of our study sponsors have to physically see our space, and especially in the clinics. Do you have exam rooms? Do you have lab space? Do you have a refrigerator? Show me the temperature log for that refrigerator. I mean, we have to do this all the time. Thing. So
Yeah.
it's just, I wish I had carved out time on her day. I feel guilty that I didn't click to that. So
No, I think just being able to go up with your iPhone and
Mhm.
I can get a visual that way. Would that be helpful?
Yeah, definitely.
Mm-hmm.
Probably email is better than text, just 'cause for like stuff like that, the bandwidth is.
So, let me go grab that SOP printer. I'm notorious for leaving stuff on the printer.
It's just too bad we were in there, like, while the procedures were going and everything the other day. I'd like to be able to do the same thing here.
Mm-hmm. But pictures are great.
Yeah.
Would it be helpful, pictures, actually seeing some of the specimens?
Oh yeah, I mean that's the only picture that I would be interested in.
Okay. Would that be possible for you to capture that if they're so busy and...
I can ask.
Mhm.
All I can do is ask.
Okay.
I don't know if they will shoot it down, say, well, it's way outside the confidentiality agreement. No.
Oh.
They might. I don't know.
No, I mean we were in there, you know, picking around in the dish and everything with one of the other villages
Yeah.
recently. So we are low stigma here. No.
Oh, I understand. I wonder what this is called now. This. See, it says Medical Affairs doesn't need to approve specific affiliate protocols if they're in compliance with our standards and guidelines, but oftentimes there's changes, you know, changes in how it's processed, changes in, you know, it's not just, okay, here it is. There's usually something involved, because, and then anytime we make a change, that has to go through medical standards and guidelines, and if it's done under a research protocol, then that has to get submitted to the same group at just the research division. So I don't know. Yeah, here it goes. It says that about the registration with the research division. It's specific here. Aborted tissue donation programs will be monitored as part of the affiliate recertification process. No minors, by the way. No, we won't be collecting any tissue from minors. It's pretty complicated. I mean, for minors, obviously, we have to have parental consent.
Oh, in the state of Texas.
State of Texas, yes. We have to have parental consent. And then for research, it would be different. So if they're donating the fetal tissue, is it falling under the umbrella of research? Is it not? We're just not even going to go there.
Yeah, it sounds like it could be complicated.
No,
yeah.
I think it's going to be too tenuous in terms of maintaining compliance with regulations. And with the regulations possibly changing, I'd just rather not go there. We've got enough patients that are non-minors.
Yeah.
So affiliate protocols must include provisions to ensure compliance with federal, state, and local laws regarding minors, documentation, retention of records, and storage and transfer of aborted pregnancy tissue. Are you aware of any specific shipping and transportation regulations specific to fetal tissue? I've never seen anything that's specific to fetal tissue.
It's not just what's standard and customary for, you know, every other biospecimen collection agency out there. I mean, my feeling and what we've discussed with our legal team before is that much of this ought to just fall under the standard Uniform Anatomic Gift Act, and leave it at that.
So how do you ship it? Do you usually ship it to, like, the person or the organization in Oklahoma, dry ice? You ship
It's-
it in just a Speci Cup?
Yeah, specimen tubes are what we like to use for most materials. Just the 25 to 50 mils, similar to the vacuum tubes you would actually use for blood draws and stuff like that. I mean, and depending on the researcher and their protocol and the distance, some people want it on wet ice, some people want it on dry ice.
Okay.
You know, it's always variable, just depending on.
Okay.
I mean,
I just asked one of my team to look up in IATA and see what category it falls under, just because I'm
Yeah.
curious. We've not shipped any before, so I'm curious, because I mean, all of our other researchers that were local, or even
Yeah,
the
they were all
company, they sent a courier to pick it up.
were they all even local to Houston? They were within the state. Oh wow. Yeah.
Yeah. And
What-
so much of the research is done, like, one of the researchers that I can think about, she was performing the procedures and would look at the schedule and pick which ones and let staff know, okay, can we try to enroll these? Because she wanted certain gestational age. And
Is she still a provider here?
no, she's actually now the medical director at another Planned Parenthood, and it's escaping me.
Not in Texas. in
Dr.
Texas.
Reagan Tyler. Have you met her? Theiler?
You know, that name sounds kind of familiar,
Yeah.
but you don't know what state that would be in.
Northeast.
Oh, Northeast somewhere.
Yeah, I want to say she either went to Southern New England, which that's not true.
Yeah, I know Dr. Burkett at Northern New England, so it's
Yeah.
not Northern New England.
Southern New England is Dr. Timothy Farrell, so it's not that either. It might be southeastern Pennsylvania.
Oh, okay.
Let me put my note to look up Dr. Tyler, because she would be a good reference for you too.
hmm
She does a lot of research.
And
so that she
Pennsylvania is a
knows-
big research hub for
Yes.
this stuff. Yeah.
So she knows what's involved in modifying what we need to do to get you the specimens that are intact, because she's done it. And I'm surprised I didn't think about her a minute ago. Yeah, Dr. Tyler would be a good one, and she was doing those here.
Right.
And you had asked another question, and then I went off on that topic, and I forgot what your original
Oh,
question
I was just going to ask about the researchers that you've supplied in Texas before.
Oh, yeah.
What kind of studies they were doing? Was it primarily stem cell stuff, or was it other?
The company was doing stem cell stuff. The other researchers, Dr. Tyler's was specific to a marker, and that marker, she was actually mainly looking for the placenta tissue and looking for markers in the placenta that would have to do with implantation. And specifically because implantation could have huge impact on other types of abortifacients, contraceptives, and infertility medication for people who may have some sort of issue with that marker that doesn't allow the placenta to implant, so they abort. So yeah, that was her area of focus, and there was a very specific chemical she had identified and was doing a lot of research on that. So, and she was actually doing the research and had the lab. So, week to week, what her needs were changed, and she would just, hey, I need these on this week now. So, because she was doing the research and she was here, she would collect on her days that she was here. So that worked out perfectly.
And the ones who needed neural tissue, do you remember what they were working
No
on?
idea. No idea.
Because that is.
They were not very specific in terms of the integrity of the sample either. So as long as they got everything, I think was the instruction.
Oh,
they
interesting.
were happy with it. So yeah, I don't have any detail about that. I think they had a lot of different needs in terms of what they were doing with it, and they were mainly. I do remember a discussion specifically about neural tissue, but then a lot of work in stem cell. The company is just known for stem cell work. So.
That was Amphioxus was the other one. Yeah.
Yeah. So.
Yeah, I've never heard of them. I don't know what.
They're local. I don't know if they're even still in business. I would think that they are. I remember hearing about them. Oops, I just misspelled it. The Amphioxus song. Okay,
Song.
that's what it said.
Huh.
It appeared to still be in business. Amphioxus Cell Technologies. Amphioxus.com. Why didn't that come up? That will be funny if they're blocked. Okay. Our IT blocked some of the strangest. It doesn't appear their website's live anymore. They may not be around anymore. This was 2006, 2005, 2006. I don't see anything about them. And I know when I've looked them up in the past, I've seen a lot of media stuff, about research and what have you that they were doing. But, with the way things were with stem cell research, they may not have been able to prosper.
Yeah, certainly the state of Texas.
Well, Trom's going to let me know about. Oh my goodness. Yeah, I'd be curious if they were still in business, but I don't see. I'm not seeing any evidence that they are. Well, here's the president. He's. Oh, okay, maybe not. Really? Yeah, their website's not even live anymore. Dang it. It does that. I want to go back. Yeah, apparently they don't even exist. So. But, yeah, that was, we finished up sample collection with them in 2008. So, and they started right before I got here. So, it was 3 years. And I can't remember. I'd have to look up the parameters. Back then, we didn't keep things in electronic format. But it was collection Monday through Friday. They would send a courier over, and I don't remember if it was any specific gestational ages. I think at the time we were not doing second trimester abortions, so it had to have only been first trimester. But it was basically anybody and everybody that agreed to donate. Mm-hmm. So. Some days, like I said, we've had as many as 6 or 10 in a day. Mm-hmm. So, but I'm very curious about what we can deliver in terms of second trimester. I have no knowledge of our volume. I mean, I know it was enough that we had dedicated days that we were doing it. So, that Trom can tell you that easily, probably just off the top of her head. So.
Yeah. Off the top of your head, do you happen to remember, or I don't know if we can talk about this, the like per specimen, what compensation was like from, say, Amphioxus? Just so we have kind of a ballpark idea.
I don't. That one will definitely be different.
Right, because they're pretty different. I'm just thinking in terms of just a like a paired liver thymus from from a single donor, what we might be looking at for that.
Yeah. Because we had 2 levels of invoicing for them. The way we had it worded is per consent, because the consent process was the administrative part that we had to do. And then we had an overall administrative fee for basically working it into the clinics themselves. And at the time, per consent was $25. And that also covered if a patient consented to be in the study and then for whatever reason we didn't get a sample or she changed her mind, because I see I didn't do that budget. It existed when I got here. So there's probably some situations that somebody would consent and then just not.
Right.
We didn't get a sample, or she changed her mind, or something happened to the specimen. I can't think of anything off the top of my head, but yeah, because we technically can't. Ethically, I don't think they were. Based on what I'm reading here, I think it's paying for the specimen itself.
Right.
That
I mean,
language
on,
that we,
on paper,
yes.
it's got to
Yeah.
be massaged a little.
Yes. So the consent process is what is unique to the visit. It's consenting the patient.
Right.
So,
Now, obviously, I mean, we don't want to end up paying for material that we can't use.
Obviously,
And now it might be if so if there's a certain like consent fee and then something else that represents the specimens.
I think definitely a la carte approach would be the best, because if there is, say for instance, your project with the sickle cell, if there's this level of screening that has to happen where it's not everyone that comes in that's being approached, and that involves time. So something for the screening, and then any paperwork that has to be done that's unique to donating the tissue, and then anything that is unique in the processing. So anything that is standard of care that's going to be standard stays the same and is not billable. Everything else that is specific to acquiring the specimens, then that would be covered.
Yeah.
Yeah.
And so that's what we would want to make sure, that your compensation was higher for that sort of specimen, and how we say that, how
Yes, how we frame it,
Yeah.
I think is important too. That we're not altering anything, and it's clear that we're not altering anything. Even if the procedure itself, there's a modification in how they do it, it's still the same procedure, but we're doing it in a way that we
An
preserve
adjustment.
the integrity of the specimen. I think is something that we can definitely discuss that with Trom.
Yeah. It sounds like what will probably happen is we can kind of give you our our needs and sort of how in our according to our budgeting and our practical use, kind of what how we look at everything, and then if you guys can kind of translate that based on your experience, translate it into something that looks good on paper.
Yeah.
Then,
And again, knowing that, I think the biggest thing is staff and management want to see that costs are covered. And obviously from our model, and ideally, in my context of budgeting for crazy, budgeting for crazy also includes making sure that we budget for some things that we just can't predict for. That, okay, we think that this thing is going to take this time, and we'll take the, go through the steps of trying to time it. But then maybe when we actually start implementing it, like you had suggested, hey, come back to me, because we're finding that this particular step, when we're using the actual product or the actual instrument, we have to do this, this, and this to get it, instead of it being one step. We definitely, take that into consideration. We try to do everything we can on this end to role play it and time it and do whatever we can. So,
Right.
yeah.
Right. I just don't want turn into a situation that it's not financially
sounds-
beneficial
yeah,
for you.
Yeah, and I'll take you up on that. I'll take you up on that. We definitely want to do that because that's what staff and management need to see, that we're not underwriting any project. And I go to great efforts to demonstrate what the actual cost is for us, to whomever asks, and then this is what is budgeted. So they know, okay, yes, you're covering costs, there's margin that's covering overhead or whatever we need to make sure that everything is
Right.
covered.
And so when we're coming in and making it beneficial to you financially, you can frame it so that that's
Yes,
okay.
that's,
Because that's how we're going to keep you happy,
Yes,
right?
yes.
To make sure that financially
Yes.
you're growing your clinic and however you need to say that, frame it on the other end.
yes.
Okay.
I mean, and then we also just need what our outlays are going to be too,
know-
so that we can watch our margins.
Well,
Yes.
we also, one thing that is extremely helpful, and it makes sense, but sometimes a lot of our investigators and sponsors don't think about this. When we're involved in studies, oddly enough, we like to know about the outcome.
Yeah.
Because we are into research, we all have a little Curious George mentality. When we get information or discoveries are made or products go to market or whatever, we love that feedback. And when we had the physician that was here that was doing her own research in their staff meetings, she would tell the staff about, I realized this and I found this and what this may mean in the future is this. Oh my gosh, everyone was so engaged. And that's the main thing,
Yes.
is that engagement, is to keep people engaged. And the budget is great for our bean counters, but the engagement with the staff actually doing the procedures
Right.
is what is key. And maybe from time to time, if you guys are able to travel down and meet at a staff meeting and just talk about what's involved and where the tissues are going, what kind of research is being done, what we hope in the future this will lead to, that goes a long
That's
way.
that's how you
And
really
that's
sell
something that
people.
doesn't
Yeah.
that's not anything that's a financial benefit to the organization or anything, but keeping the staff engaged, that is, especially with long-term projects, that's something that's very important, is to keep people engaged and knowing about what is happening in advances. That's the main way that they do it, because that gives them a sense of what they're doing is valuable beyond the money.
Right.
Yeah, because I mean, it's not, quite frankly, the people that are actually doing the procedures and doing whatever are going to see no financial benefit. This is just part of their job. So there's got to be something else there that keeps them engaged.
Yeah.
So, and usually that's information. It's as simple as that. It's just information about the project.
I wonder if since they don't know the financial benefit, I wonder if somehow giving them some incentive financially so that they know there's both the down the road, this is the research and that's excellent for that emotional, but financially, is there any way to
Internally with like bonuses or anything?
right, no way at all.
PPFA actually has, from like the sponsor cannot pay us enrollment bonuses or finder's fees. We have regulations about that for our conflict of interest policies. And then internally, it is something, it's kind of a sore subject because I would really like to be able to, but it's just really, really hard to administer because we have some studies where there is room. We could potentially have a bonus. We have some studies that there is not. And operationally, each of our health centers are different, where some of them, it's just easier to do our studies there than others. And should some people get something that is really just because their clinic flow is better because their building was built differently, and so that just makes the whole thing. We used to back in the day, but
We used to be able to.
we
give
used to
the
get bonuses and out of my department. I spent a good deal at the beginning of each month doing bonus reports for the prior month, but I mean it's even spread that
Well, what about
Changes
a way?
have changed. It has changed such a way that even drug companies can't give us pens anymore.
What?
You know? Yeah, no. I mean,
Wow.
drug companies used to be able to come in and provide lunches, and they no, with all of the. But again, with the perception that
Right.
drug companies are bad and they're going out to manipulate these doctors and they're prescribing drugs that are not necessary and blah 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 blah. There's been such a pushback in Congress on that with anti-kickback laws and the Sunshine Act and all of these things that they've implemented in terms of regulations, because there's the perception that this unethical type of relationship exists. So I know. So maybe a lunch from time to time, maybe a
Okay.
breakfast if they have morning meetings, and just some information about the projects will be good. Yeah.
And just no way to write it in so that you know, okay, this is.
We could totally write it in for, we can cover it under meeting costs. That's how we cover lunches in my department. Meeting costs. Yes.
Okay.
Yeah. So if we're
So-
providing information and updates about the study, we feed them. People love food.
Okay. That's good to know.
Yeah. And I can
So
make
it's just
that
a
into the
way
budget
to.
too. Yeah. So
to-
thank you.
Okay.
Acknowledge the effort. That's the biggest thing, is acknowledging the effort, giving them the information that they need to stay engaged.
And there's two ways, it sounds like, to do it, both financially and then just feedback of what happens with. Okay.
Yeah. And like I said, staff really like to know what they're doing is valued and valuable, and there's various ways you can do that and still keep them engaged. So
Okay.
Excellent.
yeah.
Speaking of lunch, I'm starting to get a little hungry. I don't know about
Okay.
the rest of you. Is there any news from Tram? If
There's
kind of
not.
I'm wondering
Yes.
if maybe just in case we can't get in, if we could impose upon you to go ahead
Thank you.
and take this.
What I'm gonna do is I don't want to traipse up there myself until she's given me the go ahead, because it sounds like they're really busy and she's just getting out of that meeting. Let me wait for her to circle back around, because that one email that said clinic running behind, whatever, 1 o'clock. Let's give her till 1 o'clock, and
Okay.
then I'll peck at her again and see if I can go up there and either take pictures or steal you in.
Yeah. So then I'm wondering if we should make like break for lunch
Yeah.
right now, or
Okay.
yeah.
If you want to.
Okay.
What are you
Might be
hungry
good.
for?
I'm
You're the expert
here to
here
please.
with-
I'm happy
Oh my
to.
gosh. Yeah, we've got it's weird. Our building, there's nothing in walking distance. Everything we have to travel, but we have lots of good places.
What's your favorite?
Obviously, I'm not opposed to food. There are good Mexican places around. There are good Vietnamese places around. There's great seafood around. There's a Chinese Vietnamese place that's really good that's not too far. I'm just trying to keep us close by in case you get your text about your meeting, and then in case come up now, we can get back quick.
Why don't we make it,
Yeah.
it all sounds good, why don't we just make it the closest? Which one?
Yeah. There's 2 seafood places that are relatively close, and there's the Chinese place that's relatively close. The Chinese place usually gets pretty hairy after 12 o'clock, is in terms of a long wait. I'm trying to think outside the box. Obviously, because we don't have a lot of places that are, we don't have any places that are walking distance. And for us, my group, we typically just, we all bring our food, or we all plan to go out on a day where we're going to take a long lunch. So sometimes it takes a minute to get my brain engaged if we haven't been going out
Or
for a while.
delivery?
Yeah, is there anywhere that caters?
We do. All of our house accounts, all of our accounts require a 3-hour window, though, because of the travel time. Yeah. But no, we can pop in the car and head down to, it's a couple exits down 45 where there's a lot of options and we can just decide. So, yeah, that sounds
And
good.
is this my copy?
There's the research piece.
Okay.
This is obsolete. This
It's
is
good,
from
good to see the modern
2005.
language, though.
Yeah,
That would be
yeah. I think
knowing that it's obsolete, but still
Yeah.
having the language.
Yeah, and then you got this.
Oh, this is, yeah, did we get that or take another one? Did we
Take
get
it, yeah.
Yeah, this is the one with the,
Okay.
that's the intake form with all the
Good, good,
info, which is,
And those are always subject to change.
Now, do you feel comfortable with me driving?
Yeah, sure.
Okay.
I didn't give you anything that causes drowsiness, should not operate machinery, so yeah, we're good.
Okay, all right. These,
So we're in California,
we're in Southern California. Yeah, so.
San Diego area maybe?
Los Angeles.
Oh,
places,
LA.
yeah.
Do you know that area too?
I had family at one time in San Diego, and I would go visit. I love San Diego. It's gorgeous. I've been to my uncle was a police officer for 30 years in LA. So as a kid, we went to visit my uncle pretty often.
Uh-huh.
And Disneyland, whatever. So I have very fond memories of LA. And then I've been up as far north as like San Jose, but I've never been to Northern California. You know, never
So,
been.
were you born in Texas?
Houston.
Oh, okay.
I'm born here, raised here, haven't left here. So, yeah, I probably won't. You know, I like to travel a little bit from time to time. Like I could totally be a Canadian. I've been up to Canada several times. Oh, I love Canada. But yeah, just Houston's my home. So, what about you guys? Are you both originally from California?
Yeah.
Oh, wow.
Yeah.
Yeah.
So.
Cool. Cool.
Oh,
So in California, I noticed they have a lot of fish tacos.
yes.
And that's odd because here in Texas, we're right on the Gulf Coast. We have a lot of seafood. Fish tacos are not real common. Not like they are in California. That was the thing when I went to San Diego to visit former in-laws. Oh, Miss, you have to come try this fish taco place. And they were also native Texans that had moved. And I could not wrap my head or my taste buds around these fish tacos.
You couldn't. Okay. First time I had them, my girlfriend ordered. She's Korean, so I just let her order. And I thought they were really good.
Yeah.
But mentally, yeah.
Chicken, pork, beef, tacos, lamb, goat. I've had other types of meat, but the fish tacos, I
Try it sometime.
I have. I've tried it
Oh,
several
you did try it. I
times.
thought you said you had to walk to it. Okay.
No, I
Okay.
tried it and I didn't let my folks know I'm taking off.
Okay.
I cannot type today. So, other than fetal tissue, what else?
Adipose tissue is a big one, actually. We
I
have
would be happy
relationships
to
with.
donate.
That's what everybody says.
We probably have to work with, what is it called, a liposuction?
Yeah, we have relationships with several cosmetic surgery centers in the Southern California area.
Okay.
There's
I'm sure
plenty to go.
Plenty.
Yeah, we just got a real
It's
interesting.
popular here, though.
Oh, really?
Yes.
Yeah, well, you know what's most fascinating is starting to pop up in some places are combination clinics that are lipo and stem cell clinics, believe it or not, where they will lipo out a small amount of your adipose tissue. They take it out, they isolate out your own stem cells, and then re-inject it back into you. And there's some places like that popping up in LA. There's one in Colorado.
There were regulations prohibiting stem cells to be, even your own, to be reintroduced back into your body.
I think it depends on who's paying for it at the end of the day, and how it's marketed.
Yeah.
Because there's been talk in California among some of the research, kind of the research community, about there's clearly such a demand for services like that some of the more forward-thinking researchers in California, who are part of like the California Institute for Regenerative Medicine, all of that, are wanting to maybe establish a chain of state-funded trial clinics for some procedures like that are considered lower risk and more promising.
Yeah.
So that if people are going to do it, at least they can do it, safely and with full informed consent and all of that.
Is this wind normal? No. More normal during the springtime. Usually during the summertime we have what we call the sea breeze, and y'all probably have the same thing in California where you have a gentle breeze that comes up from the south. This is, we've got a front that's moving in tomorrow, and this is typical for out of the front.
Okay, so I saw something on the news that there was a terrible storm in Bomball, right?
Oh,
Hail.
yeah, that's probably not going to impact that.
Okay. I had trouble.
Have a
Do you
good-
prefer front or back, or?
If you don't mind if I sit in front, yeah.
Okay.
Motion sickness then.
Yeah.
And you gotta give me, you can give me good directions, right? Are you in?
Yeah, I'm in. Just take this out.
How wrong was your GPS?
Oh, and could you get me my driving
Oh,
glasses?
sure. Let's see.
This is, my daughter has just recently got her driver's license, and
I forget. Are these the driving ones? Okay.
she recently got her driver's license, and we went to an auto show, and she was looking at various cars, and she really liked this Chevy Cruze. She liked the big display.
That's what the rental person liked it too.
Yeah.
This one has, well, I won't mention it. This one has a little humorous sound to it.
Yes.
Do you, wait a sec, I gotta
It's
show you.
humorous to me, yes.
What was it? We just,
I think it's this leather on leather here.
okay.
I'm finding it actually. Oh, here it is. There we go. Not that I'm that tall, but the whole motion sickness thing. I'm not the actual driver.
Uh-huh. Am I going to go right, left?
You're gonna out of the driveway. You're gonna go left where this truck is at the light.
Uh-huh.
I mean, not the light, the stop sign, and then
Yes.
you're gonna turn left here again. Was the GPS really off for you? Did you
No,
have to?
actually, the GPS was okay. It's just our understanding of the way that exits work with this Gulf Freeway frontage road that was off.
And then being in a strange car.
Yes.
That's why I thought if you were uncomfortable with that, I would certainly understand that.
It's okay. And then we're gonna go left here.
Left here.
Okay.
And this thing is just in the way.
It's very strange.
Mm-hmm.
There's a welcoming committee at this clinic too, huh?
Yeah, they're Easter and
Right or left?
You're gonna go left,
Okay.
and then you're gonna jump on the access road there. You may have to floor it because even though the speed limit on that access road is 40 miles an hour,
Uh-huh.
people routinely go 55, 60 and
Okay.
above.
And when I get on it, should I be on the left lane or right lane?
Yeah, you want to get over to the left lane as quickly as you can so you can
Okay.
get onto the entrance ramp to the freeway.
Okay.
You drive in LA? And this is challenging?
It's just that it's new.
It's new, yeah.
It's new. And it just in a car that I don't have visibility like
Yeah.
I'm used to.
What do you drive at home?
Well,
I'm gonna fix your collar while
oh,
you're
thank you. Okay, so you're saying go,
Yeah, you probably.
just hit it.
So if without
Mhm.
you look up ahead over here on the right, you see where your entrance ramp is.
Uh-huh.
Okay,
That's
so
where my destination
Yeah.
is? Okay.
Yeah, have you talked with any of the Planned Parenthoods in California yet? Marmonte or some
Oh
of the
yeah,
the
yeah.
bigger ones?
So our problem is that almost all of the affiliates in California are already partnered with a tissue procurement organization.
Oh, okay.
And so it's real tough to get in when somebody was already there. And so we've been having to cast our gaze, further afield to untapped locations.
Yeah. Oh, well, that's good.
Yeah.
I have been actually hoping that we would meet up with someone. I went to AACC 2 years ago, which is a big lab conference, and there were several tissue procurement companies there, but they were not looking for fetal tissue. The most bites I got out of those contacts were they wanted urine from women with various gestational ages for whatever type of project they were working on. And there's just some communication issues, that, if you want urine alone, it's discarded urine, I can do that. But if you want discarded urine and a bunch of patient information, then it gets complicated because I need consent forms for that. It doesn't fall under discarded tissue regulations or discarded, waste. So we will be taking the Woodridge exit, which is kind of over this overpass. Okay. Have either of you ever been to Houston before? Is this your first time in Houston?
First time.
I may have been
Maybe
like
second,
10
but
years
so
ago.
long ago. How about you, Robert? What is
I think maybe like 10 years ago on a family vacation, but I don't think I remember what part of Texas that was.
On an exit to family vacation to Houston?
Well, there was some stopover in Texas, but it was a long time ago. I don't remember what part of the state
You're
it
not
was.
actually visiting.
No.
So, Robert, you sound like you have a sciencey background.
I do. My background is in molecular bio.
Oh, okay.
So.
do I want to get right?
And you're going to stay in this lane.
Okay.
And then when we get up to the light, we're going to U-turn. If you look over on the other side where it says Papa's Seafood House, I think y'all will like that.
Okay.
It's pretty tame in terms of spiciness because a lot of our seafood restaurants down here have a lot of Louisiana Cajun influence, and quite frankly, the food's hot. A lot of red pepper, so I don't want to give you indigestion all your way home, so work over at Papa's.
Should we take name tags off before walking in there?
I understood. I would get that up. And then I want to be in the right-hand lane.
You can actually, it's not protected, so you'll need to yield, but
Okay.
you'll want to jump over to the right-hand lane. Oh, look, you've got it. And then once we get over to Papa's, you can just so adipose tissue. What was the other thing you were talking about?
Adipose tissue, which we actually have we just got a contract with a researcher that's doing studies on regenerating the telomeres. Telomeres are basically the ends of your chromosomes, and the shorter those get, those degrade over time with aging, and that's what actually causes senescence after aging, is that the DNA just in the chromosomes degrades, and it has to do with the telomere length at the end of the chromosomes. And there's something about stem cells specifically that their telomeres don't degrade as quickly, or are more preserved, which is or are auto-regenerating, which is why there's such a regenerative capacity in stem cells. And so this project is looking at, don't crush my legs. This project is, so I don't know if,
Sorry.
that's okay, you get out first, then I'll get out first.
No, I don't. I just do that automatically.
Oh. So his
You're
project
sitting
is,
behind me.
looking at adipose stem cells from older populations. So the inclusion criteria is, where did I put it?
No, right here.
It's in there.
Oh, go ahead. I was going to put my foot up here and check.
Did I lock it?
It's locked, yeah.
Go ahead.
So the inclusion criteria is like age 55 and up. So it's kind of interesting coordinating with the different centers when they have those patients. But so it's their adipose tissue specifically that we're collecting and sending to that study. And we've done some cancer biopsies before. There was an oncology clinic, maybe about 20 miles away from our office.
And I like to, I'm very chatty. Every once in a while, just throw an elbow and say, check your email.
Oh.
So I can keep I told her to text me, but depending on what she's doing, she may just reply to
sorry, I
it.
should have.
Last time, I tore that and stuff, lost 47 bucks. He was bored and he woke up about 4.
This looks good. Oh, sorry. Oh, that Texas redfish, that looks good.
You don't have as much problem right our house.
Enjoy your meal.
Over there.
I should have asked first, do either of you have seafood allergies or anything?
No, I haven't sensitive. So what do you like here?
It'd probably be easier to say what I don't like. Because I love seafood, I love to fish.
Do you?
I do love to fish. Mainly saltwater fishing. Flounder, redfish is another type of fish that's pretty common. It's called speckled trout. I have a little small cabin in far northeast Texas, and we have
a little boat?
A little catfish pond.
Yeah, do you have a boat?
I don't have a boat at the moment.
So how do you go out?
My uncle has a boat. My uncle from California. That's
Okay.
he's the one that would go out and fish. So, how was that light reflecting on your face like that? Must be the little spotlight thing.
Is it on my face?
Yeah, it's moved now. But yeah, there was a real.
Is it this?
There was something that was reflecting, and I was like, "How's that happening?"
Thank you, gentlemen. Have a great day.
Now I don't feel bad. I felt bad about leaving my staff because we usually all do lunch together, and they're having an email discussion about what's for lunch and what are we going to do, and like apparently no one's having lunch today, so I don't feel bad now. Did you get your text about the?
Yeah, no, they pushed it back to 3, so we're good.
Oh, okay. And feel free. I mean, if you need to group and want to meet in our conference room, you're more than welcome to.
Excellent.
'Cause I don't know, depending on when we wrap up and with traffic and everything, and I don't know if you would be able to make it back to the hotel in time for 30.
Yeah. think I did. Yeah, I think I'm gonna get the
You saw the.
not exactly no, but I think I'm gonna get the rainbow trout that they do over here.
Sounds like a good choice. Rainbow trout and shrimp. Where are you seeing them?
It's over here on the naked fish.
Hi, how are you? Happy. My name's Rachel. Can I serve you? I just want water, no lemon. Water, no lemon? Just water. Thank you. Water, no lemon? Lemon's good. Okay. Water with lemon? Okay. Someone to begin with an appetizer today? Or
Probably, yeah. I just want to.
someone want to order? Do you need a couple more minutes? Do you want an appetizer?
I think I'm good just to start the main course.
The bread was, yeah, but I think we may know what we want. Did you?
Rainbow trout. That looks
Okay.
good.
Okay.
Okay, so rainbow trout for both of us. Yeah. So.
Okay, do you want it with the shrimp or just the naked one?
Just
You have it with charcoal shrimp or just no meat? It's just the trout.
I wanted the naked
Just
trout.
the
Yeah,
trout?
both of them.
And what did you want?
The same thing. I don't know why we're in sync so much today.
Just the trout?
The naked trout, yeah, with the herb olive oil and all that. Yeah.
And for me, the black and catfish. Yes. That was easy.
Yes, so tell me about your fishing. Did you order from a little girl or?
Yeah. I was supposed to be Brian. So my dad, I was supposed to be Brian. The doctor told my dad, hey, you're going to have a little boy. Now, this is back before ultrasounds were really good, and my mom never had one, so I don't know how he knew that. But my dad always liked to fish, and I was always eager to go out and do things outdoors, and my dad fished, so I kind of just went with him.
And you don't have brothers?
I'm the oldest of three girls.
Okay.
Yep, no brothers. So.
You know what? I think that's great. A dad and a daughter having that, and a dad being able to do something he enjoys, and that he
With his
goes
daughter.
to it.
I enjoy being outdoors, and it's unfortunate that I've got my dad's Irish freckly skin because I have to just bathe in sunscreen when I'm outside because I burn real easily. So yeah, I love being outdoors. Little place that we've got in East Texas is on 36 acres, so I'm constantly doing things outside and hiking. We've just recently cut through some additional trails, so we've got a little more than 2 miles worth of trails out there. So very nice. Lots of pine trees, lots of other trees. You know, the area has some timber come in and cut. The previous owners were my brother-in-law's grandparents. Okay, yeah, they just turned 89, and we bought the property from them last year, but they just couldn't really maintain it anymore. So it worked out real well. They never did the whole timber and wooded part. I mean, it just maintained 36 acres with a tractor. With a tractor. Okay. I've had to learn how to drive a tractor.
That sounds fun.
It's fun.
And so they couldn't do that. Okay.
And they had about 10 acres of it that was partially cleared. They had cattle on the pastures, you know, so part of it is cleared on pasture. We don't have cattle. I know it kind of goes against the grain of a lot of Texas stereotypes, but not everybody has cattle. I have no cattle. I have no intention of having cattle.
So what would happen to it if it's not maintained? Why can't we just let it be wild?
Most of it is, yeah, just the pasture areas we cut back because otherwise, I mean, the needles and everything gets so tall. But the areas that are the wooded areas, which is about 20-something acres, we leave that. I mean, when we cut through trails, we find areas where there's not a lot of trees, so we clear mainly just weeds and brush that obscure us from walking. But yeah, we try to cut back as few trees as possible.
Okay,
The drought knows.
a that the girl at the front desk said, "Oh, I don't have that."
Really don't want it.
See, I told you.
Not here in the Houston area.
Why not Houston?
You know, I don't know why, but for whatever, this is not part of their area. We just don't have a sport.
Austin?
Austin, yes.
Okay.
Definitely in Austin. Central Texas, yes. Up in my area, in the Piney Woods, Northeast, I haven't seen them. Doesn't mean they're not there. I haven't seen them. Thank you.
So,
You have a thing about scorpions?
No, I have to think about earthquakes. Oh, I think Texas is really nice.
I think that's a seed in your,
There's scorpion in it.
hopefully not. I think it's a seed, but I'm gonna check it out.
You're gonna change it? Okay.
I better say I'm sorry. So scorpions and earthquakes, are they related?
No, not at all. Just things that you want to avoid or not have
They
around.
do have earthquakes, small ones. And of course, you know, there's rumors that it's tied to fracking, you know, the drilling process in North Texas. They have several over the past couple of years. Small ones, you know, not even number 3 on the Richter scale. But nothing like...
So that's not even, we don't even talk about
No,
that.
no, that's just a rumbly stomach in some cases.
Yes, yes.
Yeah.
When it gets up to, let's see, 6, 9, and actually that was
Have you
7.
been through earthquakes? I never have. Never have.
Right. Well, maybe. It's just funny to read on the news when a place like Arkansas has an earthquake, and then you read the numbers.
It's not even an earthquake. So can I talk more business? Tell me about more specimens. I'm very curious what people are doing. Sorry. I love my personal stuff and talking about fishing, but I really can't.
Do you ever go to regenerative medicine conferences? Or I think you would find that fascinating, because that's where, you know, they just have, you know, it's like any kind of industry conference, but it's all about stem cell work. So there's World Stem Cell Summit. I think it's every December. There's several meetings per year in California, because we really are kind of a leader in that industry. It's really California, Wisconsin, and then North Carolina, and some places in Texas too, depending on, just because there's kind of a little bit of everything in Texas. I feel like it's a big state with lots of stuff.
As far as stem cells, I had heard about adipose tissue. I've heard, obviously, marrow generating areas. Where else are stem cells prolific? Where you can easily acquire tissue.
Yeah, adipose is like the major site for mesenchymal stem cells, which give rise to a lot of your internal organs. The hematopoietic system, which is the blood-producing system. So, prenatal, that's the liver, and postnatal, it's the bone marrow.
Before I started into research, so at the time, there was a big movement for people to preserve the placenta and cord blood for stem cells. Just banking protocols.
That's
still popular.
Oh yeah, that's big in California. Many hospitals are trying to implement standard protocols for cord blood banking and placenta banking and all of that. What is still difficult is neural progenitors and neural stem cells. It's hard to get a good source of that apart from fetal tissue, but even that is difficult, because getting a calvaria out intact is kind of tricky. And even then, it's not necessarily matched for transplantation purposes. That's just a whole nother ballgame. There is some really interesting work being done, and this sounds like science fiction, but it's real. It's called direct lineage reprogramming, where they can actually take say cord blood or peripheral blood even, or bone marrow stem cells, and they apply a certain antibody or factor to that culture, and it will actually change the cell lineage of the stem cells from hematopoietic to neural. I know, it sounds like science fiction. It's been done, the studies have been published.
There's stem cells.
Right, in a certain lineage that they go into, they can actually, that's why it's called direct lineage reprogramming, where they actually change the lineage that the progenitor cells are in. It sounds like magic, like it's incredible. Which, I mean, people thought, 10 years ago when the iPS cells, or the induced pluripotent stem cells, first came on the scene, people thought that was like science fiction as well. But it's a big thing now. IPS has largely replaced embryonic stem cells in terms of what investigators are looking at. IPS has largely replaced that, but the production of IPS is still very difficult. And personally, I don't think that is where the future is in terms of clinical applications. I think that for translational research, I think we're looking at fetal stem cells and autologous, bone marrow adipose tissue stem cells. I think that's what holds the most translational potential for going from the clinic, or for going from the laboratory to the clinic.
So how did you start process?
Your story is longer than mine.
Yeah. Oh, it's okay.
So many years ago, when I was in Southern California, I was actually working in clinics, and I was working with, go ahead.
I think that's one number. I don't recognize the area code or anything, and it's just right now. So go ahead.
Okay. So working in clinics and working with women that were struggling emotionally, and that was really my connection to helping those women. It got a little scary in California, so I moved out of that, but that always stayed with me, wanting to help those women and the stigma, whatever they were struggling with. So fast forward, my niece was in college and telling me about this need for fetal tissue. So just listening to her talk about it, she introduced me to Robert, and then I just brainstormed that. What a way to come in and work with the women that I still work with. Give them exactly what you were saying, that your staff. Where is this going? What's the positive outcome of this? And then knowing that there's this huge need, there's waste just as being thrown down. What a waste. What a gold mine. Yeah. What a gold mine for not only financially, but for stigma that women feel. Right. The staff. You could probably talk to me about staff. What it's like when they're just going through this and hearing everything and having to drive in and all the hand-tied and all of that. Just there's a way to show them the positive. Right. So with my niece, just talking about it, and then I knew I needed science. That's not my field, and to understand it, how do we bring this to research that the demand is there, right? The people that have it, right? And how do we bring this together? Just trying to understand that. So that's where Robert came in, and I was fortunate enough to steal him as you stole. So that's a little bit of the history.
Okay. Yeah, there's definitely opportunity. I don't know about the other Texas affiliates, but at our affiliate, because we don't have any ongoing fetal tissue donation, and the only potential competing project was a project from a Rice University physician, and I think totally he needed 15 specimens. Very small project, and went through all the hoops of getting it approved through his IRB and everything, and
along the way, and this is something I encounter a lot, which is why early on I said we don't get involved in grants. A lot of academic studies. Unfortunately, the physician or researcher writes a grant, and then it's an afterthought. Where am I going to go get this? They know that they would want to come to Planned Parenthood and get it, but they don't bring us in on the front end. And then there's that mentality where you're nonprofit, you'll just give us this.
Yes.
I wasn't joking when I said insulting budgets. I mean, they're wanting us to do all of these things, consent the patient, collect these specimens, and do this and do that, and for nothing, literally zero.
Do they not understand the process? I mean, how could they expect you to do that for zero? I mean, financially, that just wouldn't be. How could you do that? Do they not understand, or what?
I don't know what they don't understand. That you're doing this anyway. You add these few little extra things, and it's not a big deal. There's just a lack of connecting to. You're asking us to do more than what we are, and we have to because of what it is. So we had the one physician I was talking about that I've been working with him for about a year to get his protocol approved through his academic IRB. And I told him the whole way, we have to set up a contract for this afterwards, we have to have a budget, with this and that. I sent him a contract from another academic study that we did with a physician who used to work here, UT. I redacted everything. I said, I'm going to leave the numbers, the budget numbers in here, just as a reference. Obviously we will need to discuss it. I haven't heard back from him. And I'm like, we went through all that work to get your protocol approved for the ethics board, and
This is a provider.
this is a student, doctor, MD, PhD at an academic institution here in town. Not unusual. In terms of workload, doing anything with academia makes my hair gray. Because there's just, I don't know what it is.
Is it an attitude? Is it a disconnect?
It's disconnect. I think they live in an academia bubble, and then when we get out into real world, corporate world, real clinical world, not academia clinics, it's very different.
It kind of mirrors the split between academics and applied science.
Exactly.
Yeah.
Exactly. Just because this works in academia doesn't necessarily mean it has applicability or use out in anywhere else outside of it.
So I think that what you're saying about they feel like just because you're a nonprofit, I know that, okay, maybe your costs are going to be extremely high, but how do we help you maintain and financially grow and oh my goodness, show a little profit here or there? What's wrong with that?
I don't know what the issue was, and quite frankly, because it's an academic project, I'm not real aggressive about trying to get back in touch and figure it out, because I'm not looking forward to working with it anyway. We take on very, very few academic projects, and I know we have patients who come in all the time asking about donating fetal tissue. So anytime I have one, even if there is some cost deficit in terms of my time getting them started or whatever, I do it because I know it benefits our patients. They really, really enjoy that. I make a point to have very, very healthy budgets on all of our industry-sponsored studies, so there is room in my day for me to underwrite some projects for local academic facilities, especially for the fetal tissue donation, because we just don't have that much of it that comes along, because we're in Texas. So, I'm sorry.
Do you find that if you can tell a patient about what we're doing, would that help her in her decision?
I think for the most part, when patients come in, they've made their decision.
Yeah, you've said that. I just wonder if there is a percentage there that would help.
Maybe some, not so much with the decision itself, but with
stages. What was that? Oh, catfish here. Oh, that was quick.
Yeah, exactly what I'm talking about, what I used to work with in the clinics, that there wasn't any.
Oh, wow. Thank you. I think it's the stages of grief and acceptance and what have you. That's beautiful. I think even though the decision is made, just the next steps usually in moving forward and making that part of who you are without rejecting it. Because we've had some contraception studies that, for whatever reason, the patient got pregnant, and then it was part of the study, that she was able to have termination and she chose. And I had my staff schedule the appointment, babysat the older child.
Hi, everything
Looks great, thank you. While she was having her procedure. And then later, as she enrolled in another study and we were asking about pregnancy history, she didn't even talk about it. She didn't even acknowledge it. It was gone, erased from her mind.
Wow.
So there was a period of time I thought I was pregnant, but I didn't. And my nurse was like, I scheduled the procedure. I had your appointment, but because of the stigma.
Right.
Just had completely blocked it from her mind.
That saddens me that is still there.
Oh yes, still here.
What kind of samples was that the academic researcher requesting that you mentioned? Do you remember? It was
He needed fetal tissue, but I don't remember what it was. What specifically it was for. I have to look at the protocol.
Because it sounds like you haven't provided things for humanized mouse models before. Is that?
At Baylor, I worked with a doctor who did, but his I forgot where his work is from, because the department I worked for, we didn't perform abortion. No, we did perform. I worked in the IVF department. We did reductions. So
Okay.
There were standards on how many. Despite optimum, there are standards on how many you're recommended, but they have to agree to that.
They what?
They have to agree to reductions.
Okay.
Some people say no.
What happens if they say no? They already agreed to it, right? So.
Well, they can. They can agree not to, but you don't know until you actually become pregnant, however many. So they'll say at the beginning, well, no, I don't think so, and then when it actually happens, the doctors counsel them and talk to them about it. And a lot of them pay thousands of dollars for IVF and then end up losing every one of the fetuses
Because they don't do a reduction.
Let me say that. Because the body's not meant to have a litter.
Right.
So is that, again, they're not understanding, they just need to be educated?
Well, we try. But, whatever their religious beliefs are, that, it's okay to have IVF, and everything that's involved with the invasiveness of that. But when it comes to preserving the lives you've just created,
They're not willing to eliminate in order to save.
So I'm really not familiar with that patient population, but from your experience with them, if they knew that an excess fetus could be donated to research, would that make those conversations easier, or?
Usually the mindset of the folks who are adamantly opposed to it is for any reason. It will not be removed for any reason, scientific, genetic, nothing. Nothing. It doesn't matter. You can say all 6 fetuses definitely have, trisomy issues where they're going to all be down as babies. Then they're with the mentality. That is the mindset. That's the mindset. Okay.
How's the fish? That's excellent.
delicious.
Very good. So I'm very impressed with the facility,
Oh, thank you.
and I've heard that the Gulf Coast affiliate is one of the largest in the country. And very
Behind Marmonte, yeah.
And it's the project of, or the product of many mergers or acquisitions over the past several years. Or how is
Oddly enough, no, it's not.
No.
The only merger that we've had recently was a Louisiana affiliate that we merged with, and therefore the two Louisiana clinics. But that's small in terms of mergers. Which is unusual because there have been a lot of mergers nationwide among the different plants.
What seems interesting about just the, I don't know if you'd call it the administrative structure of Planned Parenthood, is that it puts you guys in a much better position compared to, say, a lot of the independent providers as these different laws roll out.
Yes. Another part of it is it's actually, every time it happens, I get calls from my friends or family or whatever. Oh, what do you think about this law? What do you think about this in the media? And I'm like, I love it. And they're like, what are you talking about? So much of what we do is has an impact. So much of what happens impacts our donors. So any of this pushes our donors to write that check. So the whole big blow up a couple of years ago about the Susan G. Komen thing, Planned Parenthood's only received $300,000 total COVID funds for breast cancer screening, and $300,000. And I'm not meaning to trivialize it, but in the grand scheme of things, that's a lot of money coming from home. It's huge. So when that happened, we got multiple times that back in donations, specifically for breast cancer screenings. So it's every time there's this craziness that comes out, there is donations going.
Yeah.
So there is a benefit to it. Sad as it is.
Yeah. I wonder why do the providers seem so stressed out? Because it's kind of a different story. Like when we meet them at some of the different conferences, and NAF, I mean, the camaraderie and the esprit de corps is wonderful, but it's difficult. For example, one of the providers in Texas, several of the providers in Texas were telling us not too long ago, we didn't hear from them for several weeks, and I was trying to what's going on. Like I thought we had something going on here. And finally, I hear from one of them, the reason you haven't heard from any of us is because we've all been hit with surprise inspections from the health department, just on a rolling basis. You guys have them too in Texas.
Oh yeah, we had them.
Just surprise, unannounced inspections. They just drop by because they're looking for something to do.
Audited organization in the whole United States. Financials every year we get audits. All of our family planning clinics get audits. Pharmacy audits. We were involved in the clinical trials to get Plan B over the counter. We got an audit at it. That's okay. It's a badge of honor because when you come out of a big FDA audit with no findings, that shows you know your stuff. So, but yeah, that's the thing. We have all these audits, yet there's never any findings.
It really is just a fishing expedition. Pardon the pun.
But unfortunately, with the number of providers about to drop, hospital 2 is upheld by the Supreme Court. Then that's going to make auditing a lot easier because it's 6 fish in a bucket. They'll be able to hit us all.
Shooting fish in a barrel.
So it's just being ready for it, being proactive about it, and having your nose clean at all times.
Who helps you just to be proactive? Who do you depend upon to help you kind of see what's going on? know how
In terms of audits coming or
anything.
any internally, having our own people, we have our own attorneys and everything. And I mean, as far as having a heads up on an audit, we don't get it. Yeah, I just heard about that last week. I wasn't even aware that we had auditors in the building.
Wow.
They just show up, because it's not like they go over to the whole facility. They're there for surgical services. They go there. They're not there. They could, but they don't expand the scope of the audit to include other areas.
Yeah, I was talking about that with Deb Nucatola not too long ago, and she said that it was at the conference that we were both at, and she says, she says before I came down here, she says in my hotel room, she says I was on the phone with someone while the inspector was in the room with them.
Yep.
And just, talking about triage, not just from a
nature of the beast. It's pretty sad that you work to provide services for the underserved in the community and have to be subject to that.
Yep.
That's what it is.
How long have you been with him?
Since October 2006. So this year will be 9 years.
Okay. So, and you knew the atmosphere you were going into.
Yeah.
It didn't deter you, or
Tend to be a little bit stubborn and confrontational anyway. So.
You've seen After Tiller. Oh, you've seen the movie After Tiller, probably.
No, I haven't.
Oh, you
seen
haven't.
I've
But
heard of it, but
you know
I haven't
Susan
seen it.
Robinson, or you've heard of her? Dr. Susan Robinson was one of the physicians who worked with him in Kansas,
Thank you. How's that movie?
and is now working with Curtis Boyd out in Albuquerque, and still does some contract services for Planned Parenthood in California. And one of her little on-camera interviews during that documentary, she talks about how she wasn't doing abortion care until the Brookline shootings in Massachusetts. And she says, you can have two responses to a bully. You either kind of cower and you try and pull back and try and get away from the bully, or you can go, oh yeah? And that was her reaction, oh yeah?
I have a little bit of a different, same general thought about it, but a little bit different approach. I kind of have a unique background. I worked in accounting for many years. My mom was an accounting clerk. I used to do people's taxes, tax season for extra money. And when I was assigned chores by my mom, there'd be a stack of checks, give her checkbook, had to reconcile her checks. So I got a money budgeting awareness very young. For many years, I worked in Enron before Enron went under. Not that I'm saying that's a great model for a lot of things, but some exposure to financials. I went into nursing and went into reproductive health care, and then stumbled into clinical research. So, in terms of areas that I can contribute to the organization, both locally and nationally, is diversification of the revenue stream, so we can continue to do what we do. Because, as you said, we have a tremendous opportunity there, and knowing that our operations make us unique in terms of clinical research, sample acquisition, specimen procurement, those other areas too, that you just have to have people that walk into your door that have these diverse backgrounds that can actually analyze what they do and say, we can do this, we can do this, and think outside the box. I mean, that's such a common term, but looking inside the box outside the box. So give you all options. I think I want your fish. This fillet is huge. It's like a stick. And this part is tiny.
You still working on yours as well?
I'm
You're done?
I'm talking too much, obviously. I might not eat this piece because I got 3 huge bones out of this. And because I fish and I clean my own fish, I get very perturbed when I find bones in it because I'm very careful to fillet them out before I cook it. Well, that your financial background, really, I think that's what you can see the benefit of this financially. Just having that background and seeing that there is it's gold out there. And it can be so beneficial. So I'm glad that you had that background so that you see the financial benefits of getting the right specimen and getting it intact. And if you have to change the procedure just a little bit within the framework that keeps it, we're all talking about it the same way in the right way. But that financial gain and the to your staff just knowing this is the end. I think everyone realizes, especially because my department contributes so much to the bottom line of our organization here, even though we're one of the largest affiliates. Our research department is the largest in the United States, larger than any of the other affiliates combined.
Wow.
So, but it's not, part of it is infrastructure. We've got the building, we've got the space, we've got the lab, we've got EMR. Part of it is that, but part of it is also the attitude that I was telling you about of taking this project and figuring how we're going to integrate it for efficiency instead of trying to hire a bunch of people and running up costs. You can do it with people that you have. And working on models of efficiency instead of hiring more, which is not always more efficient. Having more cooks in the kitchen doesn't make for a better meal.
Sometimes it's worse.
Yes.
The chaos that's created.
Yes, for new people that don't understand, people in the way or whatever, like we were talking about. So I feel like I want to eat more of that. It's delicious, but it's a lot. I didn't realize it was such a big plate. But yeah, that's. I think that model is what makes it unique, and sometimes it's hard to keep focus there in terms of management. And we do this research stuff, we integrate it, and this is how we do it. And that's part of the reason why we baked it into job descriptions and bonuses and everything, because we do it so much and we've done it for so many years. We want people to think this is routine. We don't want them to see this extra work, feel impressed by it, that kind of thing. So it's been very successful. It's been very, very successful. So we want to keep going and have more opportunities for projects that come up and check the phone. Thank you for reminding me.
Just a subtle reminder.
A reminder. I think is it one? It's now one. So. But yeah, I think that's where we have a lot of opportunity. I'm just excited that everyone else must have other commitments already, and we don't in terms of our tissue. So
There's a lot of commitments in California. It's because STEM Express has like all the north with Marmonte and the new Northern California NorCal affiliate, and Novogenics has Los Angeles with Deb.
I guess because there's so much research and stem cells out there, they got the low-hanging fruit.
Yeah. Well, and ABR, you must have heard of ABR before, Advanced Bioscience Resources, with Linda Tracy and Perrin Larton, and they've been doing it longer than anybody for 25 years or something. They're kind of a creature of the 1980s at this point, though. Just they're still like using faxes for everything, and they don't even have a website. It's and granted, you want to be careful what you put on your website, but you do need to have a web presence. Yeah. And so I think they have San Diego and maybe some other places scattered around, like independent clinics. But STEM Express split off from them, and Novogenics was kind of inspired by that. So that presence and that market has kind of been in California for a long, long time. So it's kind of saturated at this point.
Oh well, good for you then.
No, I know. And then it's kind of a mystery throughout the rest of the country exactly who is doing what, and if it's because allegedly CAPS doesn't have the information, and it's not like it's something that affiliates necessarily advertise, So.
Well, if we can get Trom's ear for a few minutes. Luckily, she's like me. She talks real quick.
Yeah.
But maybe we can find out from her. Because I have a hard time believing that we capture all of our information and it doesn't go somewhere. There's not a repository. Frustrating, isn't it? Spend the time collecting information and then nobody does anything.
Yeah, nobody does it.
That's the frustration.
Yeah, just busy work.
How much time is taken to collect that, and then to think that it's for what?
Yeah, I mean, it just goes out there into Never Land, and no one's doing anything with it to further the organization, right, for business opportunities like this. So, even if we don't have it on a national level, I can get it for you for what we do here.
This was a good suggestion.
I'm glad you liked it. I'm just going to warn you, they're going to bring the big obnoxious dessert tray over here. We have very good desserts if you're a sweets person.
I'm weird. No, I'm not. I like salty and savory.
I'm not prejudiced. I like most all different types of food. I get in my moods where sweets, sweets during the winter time when it's cooler. It doesn't raise the temperature in my house too much. My daughter and I do a lot of baking, so I love to bake. Holidays especially.
Fish taste mesmerizing.
I know, they always are.
We used to have different types of fish in there. Now they've just gone to a whole cichlid tank. At one point we had a smaller tank that was saltwater. It was beautiful saltwater. So it's big as a dinner. It's fresh water. Type of fish called cichlids. They're originally from Africa. They're pretty easy to maintain in house. And pretty cheap. Saltwater tanks are very expensive, and the fish are harder to maintain. You have to have the right temperature, right salinity, right amount of lighting. I had a saltwater tank once. Never again. It's a lot of work.
And if you're not right on it, you lose those fish.
They're very expensive.
Yeah.
Yes.
It's not fishes that have or not quite.
Yeah, you have to do your research on the fish too, because there's a lot of fish that they get along with this group but not this group, and you
have the environment. So if you're going to have this kind of lighting and everything, these are the only fish that go together, and they may not even be fish you're interested in. So yeah, it's a lot more challenging. It's not John, it's my sister. She's trying to get a job at NASA, and apparently they're calling her references. She says, "What do you think?" And I'm going to answer her, "Duh." What do you think? It's a good sign.
So science kind of runs in the family. I didn't mean to interrupt. No.
Very not scientific. Oh my God, no.
What's she gonna do at NASA?
She's administrative, computers, support, that kind of thing. My husband works at NASA too, but he's into networking and wiring, and he works. I don't remember the division he works for with the International Space Station. A lot of the communications department. He was in the Air Force with communications. And my other sister's a teacher. This one, my baby sister, she doesn't like being outside, animals, very much not an outdoorsy person. Her husband fishes, we go fishing. So, but no, not outdoorsy at all. And I can lose her in a conversation if I'm not careful. If I start talking too much medicine or science or there she goes.
And what about the teacher? Where does she teach?
She teaches high school down in the NASA area in what's called Clear Lake.
And what subjects? All subjects?
English literature. It's funny to me now considering how she was when we were growing up. Didn't like to read a whole lot, wasn't into, she was kind of into drama and stuff, but never pegged her as a teacher, never pegged her as she was working high school student. So it's one of those things that people evolve into an area that you're like, this is totally different than what you were as a kid.
It might be. I thought that might be the dessert plate, and I was like, oh,
Haven't heard back from Tom. So I'm very sorry that I didn't click to schedule time up there with her.
No, I'm happy to hear it. This means busy day.
I just need to get information for you guys. Numbers, what days, feasibility, of the actual sample collection. It's not hard to do. So Tom walks right by my office every morning. I've been known to physically, hey, come here, I need to talk to you for a minute. Hallway meetings work sometimes. So.
And I want to underscore it again since I think actually seeing it, being able to talk about it after we it looks like we might not be able to do it, but double back if you need to financially. I want it to be profitable for you. And yes, you've got a good sense of what you need and you know how to frame it so that it all works out.
And let me know also if you need help contacting and working with other affiliates. Because if we get everything in place, we have a protocol, we have forms, we have budget, we have contract. One of the things that I do to support research on a national level is share. So when I've done the work, I give it away. And here you go. And just let them take it. So you can take this and say, this is what we developed with PPGs. So that should help. Just one check.
Yeah, that's one. I think, did I give you Brianna's company card? Or?
Yeah, give it to me and I'll.
you guys.
Yeah, that was perfect amount, wonderful.
What would you say are maybe like the 5 affiliates with the biggest research departments?
Ours would be first, Planned Parenthood, Southeastern Pennsylvania,
Okay.
Southern New England would be the next, Rocky Mountains would be next. Yeah, that's about it.
That's about it.
Everyone else is pretty small. I mean, there's a lot of affiliates that are engaged in research, but they're all pretty small.
Yeah. It sounds like otherwise it's a much more ad hoc kind of thing for this particular study.
You may have a medical director that is also faculty at a local university, which is typical. And you do a lot of academic studies. So not as much industry-sponsored research.
Yeah.
So that would probably, there was another one in Florida, but turnover rate in the industry, research industries, coordinator stays there for 2 years and I think they had a program for about 2 years and that's it. So I'm trying to think, the other Texas affiliates, one in the Austin area, I know they've done some research, but I don't know what else they've done in terms, structure-wise, there's nothing like that.
Yeah, so great, because that's Greater Texas, right? Which is, that's where Amna Dermish is. I know she's a provider, and she and I got to know each other at a meeting in October back in Miami, and we had a really good conversation about all these different things. And she said that she wasn't aware that they were doing any tissue collection there. Thought it was fascinating, wanted to help. Was trained by Deb Nuka-Tola, does the whole convert to breech thing anyway, like it's easier. And it sounded great, although I guess her CEO is like terrified of the idea, like thinks that that CEO and also Amy Miller from there's the independent group of clinics in Texas, Whole Women's Health. Apparently, they're both under the impression that you can't do tissue collection at all. No fetal stuff in Texas. Yeah, and I said, wait a sec. I said, I know for a fact that there are many researchers with published researchers in Texas. And so I don't know.
Okay. So you're going to send me back to the regulations. Fine. I'll have to check, make sure that nothing has happened with these recent changes. But
I asked them to tell me what it was. Yeah, and because I had our attorney take a look, and we just found the standard anatomic gift, language, which is standard, which is everywhere. And
I'll get with our general counsel too and see if there's anything that has come up on her radar. Because she's involved with all of the challenges and everything. Of course, the laws have been challenged, and they've been back and forth between Texas and the district courts and now the Supreme Court. So she's aware. If there was any language in any of the new laws, back to the research, we'll know about it. Sure, but I'll double check. So.
Sometimes I wonder if it's just a personal decision that maybe they can, maybe they just don't want to get involved, maybe they can't.
There's a I do think that there is a lot of
I think you probably have to sign for it.
opposition fatigue. You have to do opposition fatigue. You get tired of dealing with it all the time, and you don't want to take on anything else.
Like, I'm just fine right now, just leave me alone.
Pretty much.
Yeah.
And I find that some of our leaders who are closer to retirement have more opposition fatigue.
I'm sorry, who?
Our leaders that are close to retirement have opposition fatigue. They've dealt with it for so long, and they don't want to have to deal with something new or have to decide if this is the right thing to do.
They're kind of done.
Yeah. I read the regulations when I first started here, we had that project with Amphioxus, and we had one ongoing, right? And we've had projects since then that make it through local academic IRBs that, usually there's some component of a lawyer on that IRB.
I'm pretty sure the IRBs in Texas are still here.
Pretty sure. And if there were laws, I would have heard about it from him. So I think it's probably just a lack of understanding about it. And if they don't have a strong research department and know how to do it under the scope of research, then they may not want to go there. I think it's more they don't want to go there. That's why I said I'm happy to get the contracts, the protocols. I will even submit it to a central IRB that if they want to go in and apply under that later, they could make it easy for them. I mean, we can do everything to make it easier for the other Planned Parenthoods that want to use the project. So.
Does PPGC have your own IRB?
We use pretty much, our industry sponsors will tell us we're using so-and-so, or if they ask me, I have a central, it's called a central IRB. It's an IRB that is a business, it's a company.
Right, like Quorum or something like that.
Yeah. I use one that's called Chesapeake IRB. They're amazing. They get it. They get the types of studies we do in terms of additional samples, IVD, drug studies. It's completely different ball of wax. They go through a but Chesapeake IRB is the best for the types of studies. We've got a real good customer service. They're completely electronic. They don't meet virtually and everything. They don't have big, huge offices. It's so amazing. But they've got such great customer service, and they don't even have this big central building. They all work remotely. So, very 21st century.
That's good.
Yes.
That's good.
So, even having an IRB in mind and everything is just that's great. That's great.
Excellent. Well, shall we head back and see if we can...
Hopefully Tom will be unburied.
I'll follow you.
All right.
Up and running, operationally work it out where we get all of the bugs worked out here in our facility. I can help you with the other affiliates in Texas.
Yeah. That would be
because it makes the most sense.
Right. I mean, it's
we have it worked out that we can use it as our template.
Yeah. I mean, and I hate to say it, but if it goes down to 6 or 8 centers, it'll be a central hub for a lot of things.
Yeah, we're the new facility that we're building over in Louisiana. We have a clinic there already. Oh, and it's terrible. It's old, and it's in an old shotgun-style house.
Oh dear.
It is, in terms of portraying a professional type of image.
Robert, can I hand you this?
It is not.
So the image is not there?
Oh no. So, we already have had a capital campaign and raised the funds, and there's tremendous local opposition. The Catholic Church is on the warpath about making sure that, Planned Parenthood doesn't expand there. And, I love our organization, but you know what? Sometimes it'd be nice if we could do things in secret behind like 3 layers of fake corporate names.
You would think,
just
right?
Roll it out without making a big public thing about it, because it's
And that wasn't done this time?
No. There's a whole different.
Who dropped the ball?
No, that's our MO.
Oh.
dropping balls or just not seeing?
Just being very public about it instead of trying to be more discreet. And more in your face, especially in the South.
Yeah.
Oh, that's another topic. One of these days, the president of PPFA is Cecile Richards, and she's from Texas. Her mother was our governor back in the 80s. And so sometimes I just feel like, just 5 minutes with her. Just give me 5 minutes. I just want to say one or two things.
Is her mother still alive?
No.
No.
She passed away right before I started here, about 2005. Yes. And it's funny because Cecile's like 6'4". She's really tall.
We met her. I met her at the national meeting just briefly at the CAPS reception.
And her mother was about my height and about my build. And Cecile is very tall and very lanky. She apparently takes after her father.
So am I going to stay on this?
Yeah, there will be an entrance to the freeway after this light. You'll want to get over to the left lane.
Okay.
Yeah, Cecile's, it's very strange to me that Texas has gone so far to the right, because growing up we had Cecile, we had another, what's his name, David White, I think was his name, another governor who was Democratic, and I'm really, it's just amazing to me that,
It's a puzzle.
boomerang of how things have happened. I do think a lot of it is based on, the predominance of the religious dominance here in Texas. But it's funny because when I grew up Catholic, and occasionally you would hear, okay, you're not supposed to use birth control, okay, you're not supposed to get divorced. But it wasn't something that you were beat over the head with, because the message then was love thy neighbor and do things to care for people, serve the poor, raise money, for people who had less than you did, blah, blah, blah. It's not like that anymore. It's turned into, religious warfare. It's, I'm going to impose these things I think about you and you need to do with your life because I believe God wants you to do that. It's really strange for me hearing how, seeing how religion has changed.
Becoming more tribal and primitive, almost. I grew up.
This entrance, yes.
I grew up Catholic as well, but so you might say regular Catholic is bad enough. Lebanese Catholic is a whole nother ball game from the Middle East, right? So Sarkis is Lebanese, and they are very. I mean, there's a lot of mixture in that area, the Mediterranean, but they are very. It's very primitive, very tribal, very like medieval.
What I think too, though, and what we all need to face is they've been around for over 2,000 years. They're hated. They're not going away. That's just. I think that's just a fact. They are not going away, and we need to realize that.
So not this exit, but the exit after Elgin, Lockwood, Cullen, all of them.
Okay.
Yeah, just stand this lane.
Okay.
I don't think going away is the option. I think, where we were in the 70s and 80s, where we're looking to coexist and,
once you know where you are, the drive, it's not at all like LA. It's just the new car, block space.
You know where I hate driving and I just refuse? Is DC. Have you ever had to drive in DC?
No.
I wish that you never do. I wouldn't wish that on my worst enemy. Oh, it's terrible. Dallas is pretty bad too. Okay, so you're gonna keep going straight. See this little red car? He's going one route. That he's gonna have to jump across a bunch of traffic, and I don't want you in this little car to have to do that, because then we may have to loop around a couple of times.
Okay.
I have to tell you, I've never been so excited to hear from Trump. I've been working here because I so want to just have Trump. Okay, I need to know this, and this. And Trump is like me. She's very. So you want to do a U-turn? Okay. She's very high energy, kind of hyper. Is the term I was told I was when I was a child, back before ADD was the diagnosis. She's a hyper child. Stay in one of these two lanes.
What, this one?
Because this is where people see the Planned Parenthood building, they see that and they go that direction, and that takes them completely into the U of H campus. You may want to stay under 40.
Oh, okay.
Yes. Because it looks like a freeway. It is not. It's actually the access road, and it's 40 miles an hour, and cops hang out over this hill.
Oh.
I don't know if I put that discreetly in the form that I sent you or not. And okay, so you'll want to get over into the right lane because we're going to be turning right. There must be a meeting in the building today because there's a ton of cars here. Oh, I know what it is. Never mind. Do you ever have a duh moment where you ask yourself a question and then you realize you knew the answer? So when you go to other Planned Parenthoods, do they have quite a bit of protester presence?
Yeah.
Yesterday was a little, or was it the day before? That was a little gruesome.
It's it's interesting. It's actually, I think it has less to do with the numbers and more to do with the individuals. How vocal or aggressive they were.
Yeah, definitely an individual thing. So what do you think of the bus?
I'm confused. What is the bus?
The bus is a ultrasound bus. They provide free ultrasound. So we show you what your baby looks like and tell you a bunch of non-medically accurate or medically inaccurate information in an effort to convince you not to have an abortion.
Wow.
And the sick and sad and
do people buy
indigestion causing thing is that is funded by tax dollars.
Seriously?
I know. I kid you not. Funded by tax dollars. Not entirely.
What a madhouse.
Yes. Right? Isn't yeah, a lot of the what is it? Not what do they call those centers? The centers where they pose as like an abortion center or whatever, and they are there for the sole purpose of dissuading women from having abortions or getting birth control. There's a lot of them in Texas. They're funded by the state as well.
Wow.
If you look, some of them have license plates, personalized license plates that say choose life. And when you go online to the state of Texas to order your license plates for your vehicles, you can buy those license plates, but there's no license plates that are pro-choice.
Pro-choice.
And those license plates, part of the funds go to pro-life organizations. That is done in Texas. Can you believe that?
No, that's a little...
Wow.
Well, all the more incentive for me to fund you. How's that? That sounds great.
That makes it so incredible that you can have such a state-of-the-art, high-level.
I say, stand here and look at this.
Mm-hmm.
80,000 square foot state-of-the-art medical facility. Do you want to come here to get your care, or beat up raggedy ass bus?
Yeah.
Yeah, it's got a nice wrap on it, but really?
Yeah.
And yet people are doing it, or you?
I don't know how much volume they get. I know that sometimes some of my study subjects that come in to see us, and they like to mess with the bus, like those commercials, messing with Sasquatch. They like to go out and mess with the bus. I'm not going to repeat too much of what they do. They're all with me. They're all with me. We probably need to go.
I have mine.
Do you have yours?
Yeah.
Did you chunk yours? You're so
I threw it, yes.
You're good.
Very good.
Am I good?
Okay.
You just have to remind me when we see Tron to actually not say, obviously this is Susan pointing at your badge.
I think it's back this way, isn't it?
There's one that's right here behind this wall, so if you kind of loop around, and then there's one here and one there.
Okay, I'll use this one as well. So I can go
Did I leave my notepad? Did you leave it in the car?
Yeah, it's okay.
I think I've got. Well, I was thinking we need to keep in mind that the state is funding other things, and if we can go in and make the financial incentives, I'd really like to put our money there.
Yeah. Yeah, it's kind of it's almost like, vote with your feet and vote with your
Exactly.
wallet.
I was just telling Robert, I'm glad to know about the state taxes going for that bus out there. It gives me more incentive to make sure that our financial dealings with you are profitable and that we're funding. I mean, I know that's a funny way to say it, but we're funding you.
I like to point that out to our sponsors sometimes, that, we in addition to the political attacks, our state tax dollars go to fund the opposition.
Attacks.
Yes.
Yeah.
It just
So,
blows my mind. Totally blows my mind. And when I tell my friends and family that come visit, your tax dollars pay for that. What? It motivates them as voters.
well,
Your tax dollars are paying for that. Your tax dollars will not pay for you to get a PAP, but they will pay for this.
so I can't vote, but I can certainly vote financially to our arrangement.
Until she buys her ranch in East Texas.
Ranch.
Or your boat. Your boat. We got to get you a boat, fishing boat.
I think I would like to have a boat, but again, I've had a boat. Boats are a lot of maintenance. There's a lot involved with boats, and my husband and I have talked about it. It's like, we can charter from time to time, and yeah, it's really expensive for a one-time thing. But then there's the maintenance and storage and registration and all that we can avoid. It's kind of like having a saltwater tank. You have it once, and you realize that it's beautiful. It's a lot of work. You go look at it in an aquarium. Yes. So I still haven't heard from Trump. I'm gonna shoot her another email and see. And I did follow up, if you need the information. on fetal tissue shipping, it's shipped as category B, which a minute ago I was telling you about the other category for flammables. And then we have the shipping requirements. Our inner receptacle cannot exceed 1 liter of fluid. So if there's any fluid. So did y'all say frozen? Or it depends?
The tissue sample itself should not be frozen.
Okay.
But it gets shipped on either wet or dry ice typically.
Okay. Okay, so we'll need the spacer then between
Right.
the tissue itself and the dry ice. Okay, cool. Sufficient that inner receptacles do not touch the water and cannot exceed 4 volumes. Okay, 4 liters per shipment. Okay, cool. So yeah, we looked that up. So that just helps me to know about how many we could put in a box. And do you require that the specimens be dropped down to a certain temperature first?
It's all going to depend on the researcher and their protocols. It's going to change from
project to project.
yeah.
Okay. I'm just thinking of these two in particular right off the bat because those two sound like your ones. The one for the liver and thymus, and then the other one for sickle cell. Those sound like the ones that you have the most immediate need for. So I really, really think the more that I'm thinking about it is that general sample acquisition where we have an overarching protocol for any type of tissue, gestational age tissue, and then as we have need, you guys send me a work order. And we have this with other types of tissue, so this isn't something that's unusual. Send me a work order that says, Missy, I need these many specimens during this period of time at this gestational age, and these are the unique features about it that we need. Intact specimen or, what have you.
Did I understand you correctly that you have changed how you define or calculate that gestational age? So what we consider 16 might be really, you might call it 14?
Yes.
Is that right?
Yeah,
Okay.
and Tron is definitely going to have to explain that because when she first, when the House Bill 2 first was enacted, certain parts of it were effective immediately, and we have started using it. That's one of them. Other parts of it are being challenged in court, and they have a stay on it, so we're not doing it immediately. So like the ambulatory surgical centers requirement throughout the Texas, a lot of organizations have just said, hey, we're throwing in the towel. We know that we're not going to be able to go anywhere with this. The Supreme Court's not going to rule in our favor. And others have said, we're just going to keep doing business as is, under the old rules. So in terms of how it's defined in terms of weeks from conception versus gestational age, I don't know the exact time difference. In my head, I'm thinking 2 weeks, like it's about 2 weeks from LMP to estimated date of conception, EDC, which is what is referenced in all of the legalese. So,
so
I just need to get the
right. What's the change?
Yeah,
2 weeks, and then is there room to? Well, we didn't know, or we weren't told the correct information from the patient, so we could stretch it to about 3 weeks. Is that any wiggle room there?
I think the everything, the gestational age, estimated date of conception, everything is verified by ultrasound. So it's
so it's really how you have to define. You get to create your definition of that date.
Yeah,
and
I mean,
speak to it that way.
It's still, so basically what it ended up doing is, I think, technically knocking 2 weeks off. So instead of going up to 22 weeks, we can go up to 20 weeks because it impacts it that direction.
So for us, that would be, we could ask you for a 22. In your language, that would be a 20, and that would be...
I think so.
Okay.
Yeah.
That's good. That
Yeah, I
would
have
be
to get her to
excellent.
confirm that, but that's just based on the little bit of information I got at one of our meetings about a year and a half ago when all of this first started coming down.
And then I'm going to assume, unless, and again, I don't understand this, but I'm going to assume that if I'm asking for 22, you're calling it 20, my compensation, I will just automatically know this has got to be at a higher rate. Okay, good.
Yeah.
Okay. And we'll work all that out, however.
Details.
Right.
Yeah.
Okay.
And that's the part where I want to sit with Trom and go over what's involved in the second trimester ABs that makes them different, unique, more complex, asking about the breech.
Yeah, converting the fetus to a breech position.
Yeah, so
beforehand, so that you can.
What does that end up doing functionally in terms of preserving?
Well, so what? Yeah, so what that means is if you can, under ultrasound guidance, convert to breech, but at the start of the procedure, then there's dilation that happens as the case goes on because you're bringing the lower extremities out first, and then the trunk, and then the cowl at the last step. And so it's a way of you kind of being a little more gradual about the way you're doing it, so you're more likely to have intact structures coming out rather than right at the start trying to bring like the whole trunk through or the whole abdomen or the whole cowl or something.
I
difficult.
guess because I come from a labor and delivery background and the head comes out first because
Right.
functionally the body fits like that in the fetal position, more of a bullet shape.
Right.
But that's why when you were saying this, I'm like, how in the world is that better?
So, no, yeah, it's because just you have whatever amount of dilation you have from the cervical prep, and then instead of trying to fit the whole cowl through there right at the start, you just do 2 lower extremities and then the trunk, and it's a way of you keep that all kind of in line. And Amna and I had a long discussion about this at the family planning forum in October about how and then she said that you can even that you grasp the spine is another helpful way that you and it just lets you kind of keep everything in line that way, and the whole thing comes out in one piece. And then that way, when it's the tech's job to go and find, they need liver and thymus and pancreas and cardia and all these different things, it's just one, dissection as opposed to, going fishing.
So is that something else that you guys need us to actually dissect that out, or do you want the entire specimen?
It was to depend on what a researcher is asking for. If a researcher is just requesting a liver and thymus pair, that's just dissecting out that pair of tissues. Some researchers, might request to have a larger portion of specimen, and especially I think we will probably see that with intact brain tissues, because the brain is a pretty fragile organ, but if you can ship it, mostly or partially or completely, and you can ship it as a calvarium, you've already got that protection built in for that tissue, and some researchers are happy to just do their own extraction anyway because they feel like it's an intricate, delicate enough thing that they know exactly what they want.
Because I was thinking in terms of integrating the process into the facility. Shonda's a nurse practitioner. I'm a registered nurse. In the event that we had to have someone else do this, we could be the ones that could do this to alleviate that additional step for the health center upstairs. So
you mean who would be the one?
dissection.
Doing the dissection. Yeah.
Yes. And again, I need to talk with Trom and see how many procedures we're talking about, what days are the second, because I know second trimester is done on specific days, so that's going to be great, because then we can funnel resources to those specific days and see if it's something that she would want her staff to do because of their workflow, because if they're already busy with a lot of other, that's where having the research department with dedicated, trained, credentialed staff, we could step in and do that.
Right.
So that would be awesome.
Yeah. Yeah, I wasn't clear when she and I spoke in DC whether mainly what she's because from what she told me, she said oftentimes they're getting pretty intact specimens, the whole of a pretty intact fetal cadaver coming out. And so I was under the impression that she was dissecting most of the stuff out, that it wasn't hunting around in the pie dish for everything. I don't know. She'd have
Yeah,
to
I mean, if
explain it more in
if you
detail.
need the dissection, we would obviously need instructions.
Right.
Visual, a little video snippet or something on the DVD would be awesome.
Right.
On how to do it,
Right.
look for these
Yeah,
landmarks,
yeah.
do this, this is what it will
Yeah.
look like in a gestational
Right.
age of 14, 16, 18, because it's going to change.
Right.
So, and then we could totally do that
Yeah,
part.
I mean, because it's just so much easier if you're, and we've been experiencing this pretty, some of the other site visits we've been doing and examining their POCs. It's so much easier if you just know anatomically you're looking here, here, or here for whatever it is, versus you've got everything floating around, and you're having to search through it amongst all the other, pieces and endometrial tissues. It's a lot easier if you've just got. Already the container already
Yes.
there. So.
I mean, speaking about it now, it sounds. I can see why you would want everything intact. From the entire
Right.
perspective.
Well, and also, and again, for just cell viability, the longer that you've got a certain amount of circulation in those pieces and everything, rather than if it's all traumatized coming out and half of the liver is missing, it's bleeding out, and it's just It's freshness, intactness, and there's just a lot of scientific and just practical reasons about doing it.
So the one that you're supplying the liver and thymus to, you don't know if they need it dissected out or if they need the whole.
I doubt that they would. I doubt that they would request the whole cadaver.
Okay.
I think that just the intact organs specifically are going to suffice for that.
So, just again thinking inside the box, outside the box. If you have a researcher who needs neural, and we have another researcher that needs liver thymus, we could have one donated specimen for both.
Exactly. That's the other thing. Yeah.
Okay.
And that even starts to maximize volume in a pretty effective way.
Yeah. Okay. Right. I'm just making sure that unless
this is true. However, if that provider is needing to change the technique a little bit, and I know I'm going against my side of this, but I'm okay with, no, I want you to be paid per specimen, and rather than, oh, here, just ship this off. No, this is what we're looking for, and if you can do that and it compensates you and financially that's helping you to grow your clinic, I'm willing to do that.
And so if we alter our process and we are able to obtain intact fetal cadavers, then we can make it part of the budget that any dissections are this, and splitting the specimens into different shipments is this. I mean, it's all just a matter of line items. Knowing that this is what we plan to do, because it almost seems wasteful at that point that if we've gone through the work and we've got, and we're going to be sending away in liver and thymus, and we've got other parts that can be utilized.
Well, and that's the thing, is because if for and that's where we're really starting to this really becomes much more scalable, because once, if you get to the point where you can rely on having each case is going to supply multiple samples, multiple projects, then then the amount of researcher volume that we can all process together is much bigger. No, well, I mean the number of research clients, and the number of research clients that we can accept requests from is starts to go up by a lot. Yeah.
Have you considered, I don't know if you guys would, it's just a thought, I guess because everyone's turnaround is so short, it would probably be challenging. We'll probably just have to wait and see. Sorry, I'm just kind of thinking out loud here. That depending on the volume, and especially considering if House Bill 2 goes through, our volume is going to be
astronomical.
Well, we had a glimpse of it because there was about a 2-week period of time before the district 5th Circuit Court of Appeals. So the law went into effect, then the law got stayed. So there's a 2-week period of time it went into effect. You couldn't find a parking space outside. There was standing room only out here in this lobby. What had happened is people who had started to have procedures throughout Texas, suddenly they went to the clinic and the doors were closed. So they were here midway through. They had already had ultrasounds. They had already paid for their ultrasounds. They were expected to have a procedure, and yeah. So the volume is going to be very high. But my point was that under a sample acquisition protocol, where anyone that's coming in gets approached, not just African American or people with whatever, everyone gets approached about donating fetal tissue. Maybe we can even think, I recognize that a lot of this has to be fresh, but maybe even banking, a tissue banking part that, you know, we have it built into the consent form that in the event, in the protocol or project, that in the event that we don't have a use, let's say first trimester, you don't have a use for it currently. You saw the refrigerator and freezer space we have. We have plenty of space. We can store it, and then if you have a need, because some researchers start with frozen specimens or preserved specimens first, we could look at doing that as well.
And for and obviously for some things like the engraftment, like xenografts, like to mouse models. It's not good for that because because you do lose a certain percentage of cell viability every time you freeze and thaw. But there are some actually more like private biotech companies that specialize in cell extraction from primary tissues, and they have to varying degrees have optimized their processes so they think that even if your typical academic lab can only get 25% of the cells out, we can get 50 or we can get 75, and so they're potentially willing to purchase as much probably not as high of a price as fresh, but they're still willing to take leftovers, so to speak, if it's been properly preserved, and they can pull what they can out of it, and it's worth it for them. So I think it's always worth
storing
it.
Or would you be able to store
that's
those
my point.
specimens?
Yeah, because we have the capacity.
Oh, okay.
So, I mean, because any of my IVD studies, my in vitro diagnostics, where we collect the specimen, we keep it, the most we're banking it for is a week, maybe a month in some cases. So that freezer and refrigerator space, it's to handle lots and lots of volume that is sporadic, and then it goes away. And then, so we can have ongoing storage as well. So, and in the grand scheme of things, refrigerators and freezers are cheaper. So, and they're all on emergency power. I didn't point that out, and I didn't point out the backup generators over here. So, so your specimens will be secure. So the whole lab is on emergency power. So, that's because that, in terms of feasibility, in terms of, remember how earlier I was saying making it integrated into the facility? If everyone is approached and everyone collects samples, if the patient gives consent, and we have just all of these to choose from, it's easier. It's
the natural flow of your
it's
operation, and then
everyone. It's not just pick and choose and have to filter. That's a lot
and
easier.
store for a while, and if it's not used, and then
we can even have that baked in too, that if we don't, we collect it, store it, we communicate about the inventory. If there is a certain amount that we have after a certain time, then we follow our site's procedure in destroying it, because our site's procedure is to freeze it anyway. So freeze it, and if you don't need it, then we destroy it under the same process. So
then having that, as you say, integrated into your system, then really your profits can even be better, because you're not wasting any funds. Your cost is so low, so you can show a profit. That's excellent.
I had we were designing the space here, and I wanted that whole back corner for refrigerators, freezers, and I insisted on being in emergency power on the grid. So, well, why? I mean, you guys don't need this, and you ship everything. And I'm like, banking, tissue banking is going to be something that is going to hit us at some point, some sort of tissue.
And here it is.
And it's perfect use for it. I mean, we have that many because we have spikes in the volume that's unbelievable. We enroll 500 to 800 patients a month. And we have at least 2 specimens from every single patient, and they got to go in one of those refrigerators or freezers. So when it's that busy, that we have to have the capacity. So, but we could easily use the capacity for a medium-term storage.
Mhm.
So I can't even think of anything that would make sense in terms of the storage. I'll leave that to y'all.
Okay.
So let me shoot her an email real quick. Oh, I started to. Sorry, I started talking again.
No, that's okay.
Yes, that's very exciting. It always seems, that's one of the things that when we get together with the staff upstairs, you know, a lot of them on their way up, they'll swing by. You have any projects? It seems like such a waste to have to throw away this tissue.
Mm-hmm.
I know.
I mean,
Everyone asks
It's a
about
natural
it.
fit, right?
Yeah, everyone asks about it.
Mm-hmm.
So,
Mm-hmm.
that's very exciting. It would be very exciting too if you needed it dissected. Because LaShonda and I are probably the most curious George out of the whole
Okay.
group, and that would be.
Mhm.
So I know it's sick in one level, but that would be fun.
No, what's sick about it?
No, it's just those of us that are in medicine and nursing, things that other people find gross, we enjoy,
Uh-huh.
obviously. So, yes.
Yeah.
Except for snot. There's my. Can't do it. I could never be a respiratory therapist. I could never. That's why I have one child. No, can't do anything that comes out of the body from here down. I'm fine. I can hold a bucket if you're throwing it, but don't sneeze on me, please. Just one of those things. Everybody's got their little.
Everybody's got their little
something. But that would be something that would be great. That we have this tissue and we have this, you know, these companies that need this, and you know, working that out, and yeah. Oh my gosh, she would just flip if I asked her to do that. She's, yeah, that would be right up her alley. Oh my God, that'd be awesome. Supplies, we would probably have to bake that in the budget too. If there's any, if we needed sterile supplies, or if we could just procure, there's that word, procure disposable, whatever instruments we would need to be able to do that. Because obviously, even though the procedure's not sterile, if we are dissecting and, you know, doing anything to the tissues, we would want to be able to use sterile equipment.
Yeah.
So.
Yeah, it's not, unless someone, like I said, by email, unless someone's really doing like a DNA typing, you know, genome study, it's not as much of a concern, you know, just so long as there's nothing on there that's gonna, you know, kill the tissue and kill the cells before they engraft it wherever. And even if you were doing a genome study, I mean, if you get a clean sample from like the core of the tissue, if contamination's on the outside, it's not gonna be on the inside, first of all. And second of all, even if you did take it from the outside, a good forensic geneticist knows how to, you know, that eventually when you're doing like your PCR reaction, eventually the copy number of the original sample is going to overwhelm the contamination copies, because just the ratios are so, yeah. So, but that's one of the differences between, you know, the applied sciences and the academic. The academics aren't actually so good at that and are kind of, you know, behind. But the applied sciences really know how to maximize, you know, what they get from just a little bit of. So, anyway.
Yes, you said PCR. It made me
I
sick.
know.
We do a lot of business with people working in PCR. Because it's finally there in terms of diagnostics, where it's going past DNA and RNA amplification, which is lots of room for contamination, to PCR, real-time PCR. So, yes.
You can get a whole genome for $1,000 now. Just a couple years ago, it was 20,000, and now you get the whole thing for about 1,000 with the next-gen sequencers.
Yep.
Unfortunately, there really aren't very many people who can actually process that volume of data and actually interpret it for you. That's where the the cost comes in now. Is hiring a bioinformaticist to to actually analyze the genome that you've produced so cheaply now. So
yeah, it's amazing.
It is incredible.
Reply. I'd have to send you all to the conference room for your conference call.
Yeah, can somebody go up and just see what she's up to? Or? Not to be intrusive.
Yeah, I need to see if my best person will go up there for me. My best person for the job, I should say. Oh, you're still here. I thought you would have had herpes today too. Oh, are they both? I noticed. I know Southwest is here. Is Stafford here too? All the cars out in the parking lot? Yeah, well, that's Maryland. All the cars in the parking lot, I'm assuming that there's more than one. And plus they had the classes were up to 30 people. So, hey, do you want to do a little Mission Impossible work for me? Start playing the music in your head and pop over. Okay, bye.
And bring your phone.
Bring your phone. Well, she worked up there, so it's different when it's one of your own coming in. It doesn't feel so intrusive.
Yeah.
You got to be aware of those group and interpersonal dynamics.
And for a really large facility and office like this, like it really is a thing because there's multiple teams, there's multiple levels.
Hi. So I sent Trom an email a while back, and I dropped the ball because when our guests were coming to visit, I didn't put it together that I needed to probably schedule tour time with them upstairs. And so I emailed Trom a while back, and they are having concurrent clinic today. They're having procedures and ultrasounds at the same time. And so I emailed her to ask, because she had said we could go up and see the front at 1, but we actually need to see the POC facility.
Okay.
Yeah, back in the procedure rooms where they handle the POC and the little dishes. I just want to get a sense of where they are. I wonder who's working up at the front. I wonder if Jesus is working. You can peck at him and say, how's it going? How's it looking? Is it slowing down? I can't see their clinic in ECW.
Yeah, you wouldn't be able to. I could go up there and see.
Yeah,
Ask
just do a recon and see what's going on. And
yeah. They have.
big, bright JP smile.
Hello! I'm
And
pretty
that-
sure around this time. Because they're close. They kind of finish kind of early.
Yes. But Trump said they're running late. So, and worst case scenario, if they can't go see that area, then I was thinking maybe we could take some pictures. I'm not sure. I'm gonna check. I know. Yeah. I'll ask Trump. I'll do it.
Okay.
No, I'm not gonna ask you to take pictures. We have a policy about pictures in the building.
Yes.
So, yeah.
I'll go up
See,
there
see if you, do some recon, see what's going on,
Okay.
because we're having a good time. We can continue to visit.
All
So,
right.
plus I did my IRB submissions this morning.
Mm.
Yes.
All
For
right.
now.
Well, let me go up there and
Okay.
check it out.
So pretty strict policy of no photos.
Yeah. But I think there's been times like.
Everybody takes a selfie once in a while.
Oh, it's funny you should mention that. I had an intern that got fired on his first day for doing that.
No, really?
I am so serious.
Wow.
Yeah, it was not good. It was the context of the selfie,
In
so.
POC lab?
No, it was in my lab, but yeah, it was just not very poor
boy.
judgment, so it
Boy.
didn't go over well. But for business purposes, I've taken pictures of my lab because sponsors that
Right.
send investigational instruments here, where we're going to be using the instrument, and giving me the measurements work. But look, this is the space where it's going to be. There's this, and this, and some pictures is helpful. So, yeah. And I think, again, Trom's got to give it her little blessing so we can, so we can move along with it. Or even if she'll let me do it after the fact. That might not be a bad thing.
Now, have you been to NAF ever before? Do you ever go, or it's not really?
No, never been invited. I've gone to other Planned Parenthood conferences and spoken about the research piece, and I'm on a national advisory committee for the research piece, but I've never been to NAF. It's kind of Trom and her boss and a few people in that group get to go. I don't we're good to go. Dr. Fine. Did you
Yeah.
get to meet Dr.
Yeah, I
Fine?
met Dr. Fine. Yeah, he was funny.
He's a hoot. He stole me from Baylor.
Oh.
Yes, he
okay.
is a professor over at Baylor.
Mhm.
So he's such a mess. He's great to work with, but like his filter needs some work.
Okay, so I can tell this story. I can tell this story.
Okay.
This is our first, well, not our first impression, not our first impression of Dr. The first impression of Dr. Fine was the reception evening in Orlando, and and then Deb Nucatola. It was funny. Deb Nucatola was like MC for that evening, so she's up at the microphone. And she's pretty short lady. And then she was giving some kind of congratulatory something to Paul Fine, who's standing next to her, 6'6" or whatever.
Yeah, he's really tall.
Towering over it, wearing his Hawaiian shirt with this bright, sparkly silver, what do you call it? Not shawl, but scarf.
Dr. Fine has a scarf on?
Huh?
Dr. Fine had a scarf on?
He had a scarf on in Orlando, of all places. Like, yeah, he had this. I mean, it was, I don't know.
Must have been a reference. Yeah,
Must have been
Hawaiian
for something,
shirt
yeah.
is classic
And a
Dr. Fine.
scarf.
He actually doesn't have one on in that picture.
No.
But,
And then, and then the next day, we're in the exhibit hall, where we have our exhibit booth, and next to us is I'm blanking on her name now. Your friend from Florida.
So the front is slowed down, but the back they have 34 patients checked in,
Okay.
but they have like a few patients that they're working on.
Okay.
Tron walked in when I was talking to the people in the front, but she said within an hour and a half-ish.
Okay. Would that be okay?
What time are we at right now? So she thinks they'll be done in an hour and a
Yeah,
half?
done.
Yeah, well, I mean, yeah. She said
She heard.
hopefully.
She did. Did she communicate that I meant the back? Because we had an exchange about the back.
Oh, yeah. Well,
Yeah.
I communicated that with her anyways.
Yeah. Okay.
Like, we kind of want to see the back, too. She's
Yeah.
like, within an hour and a half.
Okay. Okay. That's
Okay.
good.
Within an hour and a half, yeah. I mean, so we could,
What time
we could
is
do
your,
the
is
call.
your flight out? Oh wait, you're gonna be
No,
here
we're
tomorrow,
gonna
too.
be
Oh,
here
okay.
through, yeah.
Yeah, that's fine.
So yeah, we could do the call from either from the conference room or from the car. Like either way, I think would
Okay.
be fine. And then
Yeah. And if you
Yeah.
need more privacy, I can get you a conference room on another floor.
oh, okay.
Thank you
There
for
you
the
go.
recon. I appreciate it.
No problem.
So you haven't gotten a call. You won't be getting a call. Northwest. Hey JP, what about Northwest?
Chaz?
What was Northwest? Not
No, they're no
Oh.
HSV.
a. Okay.
But Brooke is there, so there should be.
Okay.
And Aliyah too, there should be.
Okay. Yeah, you don't have to ship.
Yeah, I know.
No driving for you. Okay.
I feel weird being here.
Yeah, me too.
Yeah.
Okay.
So we were with from Choice Pursuits, Ruth Eric. I don't know if you've ever met her. She's does like consulting for different providers. She's out in Florida, and they also have some kind of like side business that's just like supplying sort of like instrument procurement of just all kinds of like general clinical supplies.
Oh, okay.
And they also sell like diaphragms and iPass and things like that. And so her organization is next to ours, and Dr. Fine walks through, and I guess they know each other. She's, hello, Dr. Fine, how are you doing? I'm doing okay. And and she says, do you need a new diaphragm? He's looking at the stuff on the table, and he looks at her and he says, hell no, I'm 68 years old. It's like, I need a new penis.
Yep. It's fine. It's not fine. He's we had a this project that we used to have an event yearly called Staff Day, and it is what it is. And all the staff get together, and with all the funding cuts and everything that's happened, we no longer have Staff Day. But the very last Staff Day that we had, everyone was seated everywhere. And of course, I get stuck at the table with Dr. Fine. And so, everybody's doing these team building exercises, and, I get put at the table with him, and he goes, what are the odds? I get to sit with my research staff. And I'm like, oh, God. So one of the things that we had is we had these pipe cleaners, and we had to, as we were, again, some team building thing. I can't even remember what it was, but I just remember this part. We had to design things out of these pipe builders and wear it on our head. So I'm sitting here with these pipe cleaners. You know what I'm talking about?
Yes,
The
yes.
wire things with the fuzzy all the
Fuzzy,
way. Yeah. So he makes this thing and has it on his head, and I'm like, to me, it looked like, do you remember doctors used to have old time reflectors on their head? I said, are you going retro? Is that an old time reflector? And he goes, no, it's a uterus. This round, weird looking thing.
Me and one of my tech who was there with me we turned each other the first night at the reception was, he's a free spirit. We really admire that.
Oh yes, he is. Dr. Fine. He is a free spirit, and it's okay with him if I put him in check, because there are certain sponsors. Because with human subjects research, there's an industry requirement that there's active auditing and monitoring, where the sponsor auditors and monitors come in every 4 to 6 weeks during active enrollment, depending on how fast we're enrolling, to look at our consent forms to make sure we're following the protocol. So he's got to meet with these monitors all the time. And remember what I said about the filter? So I'm like, no jokes, because he loves to tell jokes, and none of his jokes are appropriate for the workplace. None of them. No jokes, Dr. Fine. Okay. Yeah, but he's great. He's the reason that this research department is here, because he is actually a uro guy. He's a OB-GYN, but he's a urogynecologist. He really specializes in bladder, bowel, prolapse issues. And back when he did surgeries, he was an excellent surgeon for those issues. And at Baylor, he worked in the urogynecology department. He started the first urogynecology fellowship in the United States. And he did a lot of incontinence drug studies. Well, as those big sponsors, Pfizer and Merck and all these companies did business with him, whenever there was other OB-GYN type studies that came up, they'd say, hey, we've got this contraceptive study. He goes, not for my population here. Let's see if we can do it over at Planned Parenthood, where I'm, at the time, associate medical director. So he basically had 2 research programs in progress at the same time. And this one, for a multitude of reasons, this research department generates more revenue than the entire OB-GYN research program at Baylor College of Medicine. Yes, multiple times more revenue. But it's academia. They're not. Research is just one of the tenets of things they have to do. They're not doing it based on efficiency, productivity, profitability. They're not looking at it like that. It's just one of these things we have to do. We do these studies because we have to, not because we necessarily want to. And they have their own labs and stuff for the research that they really want to do. So, but this one just has taken off, and we've been able to really grow it to be the biggest one out of all the affiliates. But he's a lot of fun to work with. I also like the model too that we have here. We've only got 1 or 2 doctors, physicians, staff that serve as PI. When I was at Baylor, I had 6 doctors I had to work for, and my protocols are the most important because I'm chair of the department. Mine are most important because they bring in the most money. Mine are more important, is like, tug of war all the time. And it was just one of me. So, that's typical in academia, though, is that you have 1 or 2 research coordinators or support among multiple doctors doing all of their research. That's why the turnover rate is so high. So it's just way too much work for 1 or 2 people. So, but he's very involved has been very involved in research on the national level too. Kind of like I am on the advisory committee. He's actually has been part of the accreditation team. So as he goes to other Planned Parenthoods, it's kind of like our own self-audit. They go in and they review the charts and review documentation and make sure that all the Planned Parenthoods are following the prescribed standards and guidelines, to receive accreditation for the next 2-year, 4-year cycle. So he's been part of that team as well. I have a hard time visualizing that, but supposedly he's been part of that team for a long time as well. Just his nature. I just don't see him being real serious, you know. So, but you know, like a lot of doctors, he gets cranky. You ever worked with cranky doctors? They're not fun. So, but yeah, he gets cranky too. You know, he gets upstairs, especially with that volume. I mean, there's 34 people up there right now. This facility's huge, but that's a lot of people all on the floor at the same time. So if it's the doctor doing the procedures and staff are on him to keep moving, he gets cranky. Yeah. So, but that's the pressure that you were asking about at lunch. Why does everyone feel stressed in Texas? Those of us that are still providing abortions, there's a lot of volume. And even though when we built this building, we moved in 2010. We bought the building, gutted it, took it down to girders and beams, and the edict that I got and all the other managers got was build out for 10 years worth of growth. Try to see out 10 years in the future. And that's where I said, I want refrigeration space, I want this in my lab, I need these rooms that are flex rooms. They can either be this or that, because that room that all the boxes are in, it's actually an exam room. We thought we needed 2 exam rooms. Little did I know the IVD world would just go crazy and we need a storage room for all the shipping boxes, because we ship everything day in and day out. So, but yeah, even though they built out for 10 years, there's no way they could have known that this was going to happen and we'd be one of 6 or 8 providers in the whole state, and to have that kind of volume baked in upstairs. So, yeah, it's interesting to see what they're going to be doing with that. So,
and how many years out are we now from that?
5 years.
5 years into that 10-year build out.
And they've left space. There's some of the areas where, like the hallways like this, they left them doubly wide where they could potentially go in and put like cubicles or enclose it and make, you know, smaller offices or whatever. They've left some flex space like that throughout the building. So there's room for growth, but in terms of boom, all of a sudden you double in volume, nobody prepares for that. You look for incremental growth. There's no way that you can prepare for research earthquake.
Yeah, I mean, the building can maybe handle it, but the personnel is just a completely different issue.
Yeah. Well, and that's the thing is, even bringing on all the personnel, people need time to learn and time to get into a routine and know what they're doing. And even if you bring on double your staff and you can do that, you're still not going to function at full capacity yet. Yet you're expected to perform at full capacity. So I think that might be where a lot of the angst that you got at the conference is coming from. So did you get to sit in on meetings, you know, provider meetings?
It always depends on the conference. NAF is much more open. It's the Family Planning Forum, Society for Family Planning, was pretty open. The Medical Directors Council, which were
Did you get to meet Mitch Crennan?
No, I think I know that I've seen his name on a couple different
he's not
things, but
he's not Planned Parenthood. He actually is Medical 60 and has been involved in their product, and he's very involved in Society for Family Planning. He's like, you know, their guru. So I was curious if you met him. Talk about personalities.
Really?
Oh my gosh, yes. I'm going to leave that as a surprise for you. Very interesting personality. So, yeah, that's interesting. And I've never been to Society for Family Planning. I was going to go to, there was a conference in August for Society of Family Planning in 2008, the year that, or September, the year that we got hit with Hurricane Ike here in Texas. And it was that week I actually had to cancel because there was no flights. I couldn't get out. So it was right after we got hit with the storm. So we don't have earthquakes, but we do have hurricanes. But you see those coming, and you can leave. Yeah, you know, approximately. So.
No warning with the earthquakes.
It sounds like you've been through a scary one. Were you there for
Mm-hmm.
the big one in
Mhm.
'89?
Mm-hmm.
Oh wow.
Mm-hmm. Just passing through. I'm usually in Southern California, but
Mm-hmm.
pass through just to feel that.
You can have that. I love going to California. I love going to Florida. I guess because I grew up on coastal area, I like both.
Mm-hmm.
I couldn't hang with the earthquakes. I think just that it would take one and I'd be back in Texas. That would just be too much.
Mm-hmm. Yes. And even growing up with it, I think, well, sometimes I actually enjoy just that power of,
Mm-hmm.
where does that power come from? To, just, it's outside of yourself and you really don't know what it's all about.
It's fascinating. I worked a little brief stint. I worked for Pennzoil. I worked for the geology department. And at the same time, I was taking classes at U of H and took geology and learned about the mechanisms behind earthquakes and what causes them. And it's fascinating, that this much power and these things happen on the earth all the time. And the structure of the earth changes. I mean, it's changed over the millions of years because of the earthquake type mechanisms, the plate tectonics.
And yet, with all of that knowledge, we still can't predict. That's what bothers me.
Yeah.
Can't really measure.
Same thing with the weather. We know so much about the weather, but we can't predict the weather. So
I guess some things just will remain a mystery.
yeah, surprise. Yeah, earthquake surprise, not so much fun, but oh, surprise! It's raining today, and it's not supposed to be. Y'all would appreciate some of that right now. Has the drought been as bad in your part of California?
Oh, it's the worst in Southern California.
Okay. We had 2010, 2011, 2012. We had a 3-year period of time there. 2011 was the worst, when we had a horrible drought here. I'm trying to remember rainfall totals. We had fires, and you probably saw it in the media where like the whole freaking state was on fire. Right before the election, because I know Governor Perry, he was campaigning to be president. He's going to do that again, by the way. He was talking about, Texas burning and on fires and everything because of the wildfires in the state because of the drought, and it was horrendous, absolutely horrendous. There's still, like even our property in East Texas that's in the area, that part of East Texas is called the Piney Woods. It's lots of pines. It's the most rainfall out of any area in Texas, even here at the Gulf Coast. And the drought was so bad. There's still areas of my property where there's just whole sections where trees have died. That was one of the first things that we had to do when we came in and bought the property, is there were dead trees everywhere. And they were so close to the house, we had to go take those trees down, and it was all because of the drought. So it's we still have there's a park that's here in Houston that they've got the park shut down because there's huge section of the park where the trees died during the drought. They're having to go in and cut them out because now it's a safety thing. The trees are really starting to fall near areas where bikers and hikers are. So we've got the park closed so they can take down the dead trees and replant.
What year did you get relief? Was it 12?
We didn't really start to get relief till 2013 when we started to get close to normal volumes, but they're still saying we're in drought conditions. So it's not anything like it used to be in terms of rainfall. Yeah, it's weird. It's really weird. I mean, I grew up here. We never had, ever since I was a child, we've never had a period of drought like this. So, but apparently it's something that happens cyclically everywhere. So,
just gotta make it through it.
Yeah. Pick out voices down the hall. Visitors, I can hear certain people walking up because I know their gait. hear their walk so often that I know their gait. So how many different sites do you need to visit while you're here besides us?
We have several researcher meeting scheduled tomorrow.
Researcher meetings.
Yeah, researcher meeting scheduled tomorrow. Yeah, actually, we're supposed to head to north, to like Dallas area tomorrow afternoon.
Oh, okay.
Yeah.
Might have to postpone that until Saturday though.
Am I forgetting something? Oh.
So kind of up in the air.
I'm not as confident as you are about it. But
I am looking. You asked me earlier for that academic study, what they were looking at. And let's put it under pending. Sorry, for the life of me, I have no idea. That's bad. I didn't have enough faith in it that I've just left it in email, didn't put it out there. And I'm curious too now that you asked about it, because I didn't even register it.
is that the same form that we saw earlier? That looked like a different title.
That was a newer one, yeah.
Oh, wow.
I was like, I look for one thing and I find something else.
What year is that from?
2011.
Oh.
Yep.
And that's PPFA or Gulf Coast?
Mm-mm. Programs for donation of blood and or aborted pregnancy tissue. So like I said, they changed the title of it. I just printed this out. It looks like it's not very different at all. Just renamed it.
That would be interesting to compare though, to see what did they change.
Mm-hmm.
Who's responsible for compiling those
My boss.
things?
My boss, yeah, she's the one that takes all of the standards and guidelines every year and goes about disseminating them to the various departments and reviewing them against the prior ones. And of course, they give us a form that says these have changed, these have been added, you know, but she goes through and reviews all of those.
And she's on this, at this site.
Yeah.
I guess I actually meant who writes them.
Oh. People at PPFA.
Yeah.
Don't know that one at all. Let's see. Where's your protocol? They're with the immunobiology group. Humanized mice.
Oh, that's what they were going to do. But they never got back with you. Interesting. And so what are they? Are they requesting just liver or liver thymus? Liver thymus long bone?
Let's see. Everything. CNS, brain, kidney, thymus, liver, spleen, femur, bone marrow, hematopoietic stem cells from 14 to 22 weeks of gestation.
They're going to engraft all of those or just the hematopoietic? Purpose and objectives.
Let's see.
And they wanted up to 22 weeks.
Yeah, including CNS, brain. Wow, they want everything. See, so that's the thing. So for a study like that, if we could provide, you know, just a whole cadaver, and then they can take exactly what they want with the full quality, you know, and everything, that is actually going to be ideal for them.
So the purpose of this is to obtain cadavers, fetal tissue, and generate humanized mice for the study of the innate and adaptive immune response to viral infection, cancer, and autoimmune disease, and to facilitate improvement options for deadly human disorders.
That sounds about right.
Well, it would make me very
What,
happy for us to finish up what we need to do, and I can put you in contact with
Yeah.
them.
Are they, what kind of media are they requesting, or do they get that specific
Not
or
any that's
anything?
specific.
No.
Mm-mm.
And their range ranges 14 to 22 weeks is what they're saying.
Yes.
Okay.
Oh, and I was wrong. They want 120.
120.
Uh-huh.
This is huge. This is the budget you said was in Sultan, or no, they never got back to you about the...
They never got back to me. Budget was not, I mean, we never got to budget. I sent him a contract that had some budget numbers in it, and I said, this is from my previous project. This will be similar. We'll need to negotiate it based on how you want us to collect,
Yeah.
what days, media, how we need to get it to you. You know, I mean, we need to work out those details. But he did this before. He fell off the face of the earth for about 9 months after the initial contact. So, again, my slightly derogatory comments about academia. So, interesting. Go grab that off of the printer real quick so we can look at it. Be right back. Oh, shoot. That is interesting. I don't remember reading anything about humanized mice. In case you're curious, because we didn't have a contract with him, we have no confidentiality in place. Not that I'm trying to be blatant about it, but this looks a little longer than the
Oh, this
other
is
one.
the PPFA one. Okay.
Yeah.
The font is nicer. It's more recent.
So we know what we need to do in terms of shipping. That's covered. We'll just need to look at specifics in terms of the sample itself.
Sorry, what about in terms of the...
And specific in terms of the samples themselves. If you need us to dissect them, you need them whole, shipped
Oh,
whole.
right.
I wonder, I'm just thinking out loud, I wonder if that was something he hadn't realized, because it was one of the last discussions that we had where I reiterated that, you know, these are samples from abortions that their second trimester, they typically aren't intact, you know, and...
Is that to the researcher who was...
Yeah, I wonder if he...
Was he requesting it? Did he say intact specifically in that protocol, or what was he? Oh.
Didn't. Yeah, but that's, again, a lot of times with academia or certain industry sponsors, they bake so much of their project based on assumption. They assume a clinical practice or a procedure is without really... Like, I have some of my sponsors that before they even write the protocol, they'll call me up and... Missy, how do you guys do this? How is this done? Do you know how the industry does it? You know, academia, how do they do it? And because we don't want to build this protocol based on these assumptions when we're finding that different people are saying it's different out there. It's what is a standard of care procedure isn't done in a standardized manner, which that happens all the time. that makes sense to actually call and get information from boots on the ground other than, well, I'm this doctor and I'm this researcher and I think I know, so I'm going to put it in here, and everyone needs to fall in line with what I think. So, which I've experienced that a couple of times. So do you see anything that's materially different?
Just a
It
cursory
just
look.
looks like a revised and slightly streamlined, updated form.
Do you have the other
nice.
form with you? I'm curious if this number is the thing that stays the same.
I
can look up the
left my
number.
notebook in the car.
Okay.
I had it in
I
here.
think it's the same
Is it?
number. You want to humor me while I search a little bit?
Mm-hmm.
And then we're going to be coming up on 3 o'clock in just a
Real
little bit
quick.
here, so
Yeah.
we should probably...
Yep, and
We can find a-
I can show you how to use the phone next door if you would like. I'm probably going to take the opportunity to visit with my staff and see how, just get a pulse on everything.
Yeah, and if we plan to check back in with Tram around 3:30 or 3:45 and
Yeah.
see
Yeah.
where that's at. And if it seems like it's going to be substantially longer, we may just have to
Yeah,
save
no, I
for
mean,
next time.
their clinic
That's
starts
all
very early. They're all here and working by 7:30.
Yeah.
So generally, unless there's lots of unexpected events, they're usually out of here. Everybody's out of here by 3 or 3:30. I mean, physically gone. They're done. So I think that time frame will probably work.
Did you say you were printing out the other researchers' protocol, or I forget?
No, I was just going to
that
print that one up. But once we get things moving along, I'll be happy to give him your name.
Yeah.
Give you his name.
Yeah.
I wonder. What's that called again? Programs for donation of blood. Very frustrating. Cannot find it. Used to be there was a table of contents where you can look up either the name or that number, and I'm not seeing that number or where I can get that number. Completely different group. B11-E. Really? I found it. It says donated fetal tissue, and when I open it, it says it cannot open specified file.
Maybe you can get the hyperlink from it just separately.
Yeah.
You have it.
It's under section 9F. Special medical needs? Okay. Medical policy procedures. Sorry, let me back up. Medical policy procedures. Oh, that's not very helpful at all. It's even older. It's 2005, and it's obviously being edited.
Oh. How recently was it edited?
2005. This is very annoying. I know that's probably kept somewhere else, and this is old, all old stuff. No, I'll probably just get LaShonda to help me look too while y'all are in your teleconference.
Oh, you need to have that?
Yeah.
Okay.
Don't need a blank one. I can give you a blank one.
I've got my
You're
notes.
supposed
Oh,
to-
previous
I
stuff,
know,
yeah,
I know.
actually.
I'm the same way with my notepad. I can't have a new one.
Yeah.
I need you in on that conversation. Do you want to come out
Yeah.
with me?
I'm
or
thinking
what?
it's almost 3, so maybe
Yeah.
do you want to go grab it and then we can figure out about where the room. That
Yeah,
we can
the
use it.
conference room that's right
Oh,
next
just one
door.
over there.
Yeah, I'm
Oh,
going
good, and
to
it's
be.
next to the restroom too,
Yeah.
so we'll be.
Yes.
that
And
for?
you just have to dial. Are you going to be dialing long
Well,
distance, or is it 1-800?
We'll probably just use my phone, yeah, because they'll be expecting a familiar number
Oh,
on
yes,
it.
yes.
Do I need to get another name tag coming back in?
No, I'll wait for you.
Okay, yeah.
Okay.
I'll hover.
You want me to go with these? Or?
Yeah, I think
Okay.
so I can ask you some questions about that.
Oh, she just went to use the restroom, yeah. So are we, so we're clear?
Good.
Or we're-
Yeah.
Awesome.
She said, come on up at 3:45. I said, okay, that'll be perfect. I'll be finishing up.
Yeah.
So, good.
Good.
So excited.
How's your staff? I have to
Everybody's
check
cool.
on them.
Yeah, everybody's
Everybody's
cool. I
cool.
just have to touch base and see what's going on.
Yeah.
We've got, things happening in studies in all of our clinics, so it's kind of hard to check out for a number of hours
Right.
without, touching base, seeing if anything's needed. So luckily, there's
Yeah.
nothing on fire.
Yeah.
Not
Have you-
literally, but
Yeah. Have you read the book, The Birth of the Pill? It just came out recently. They were advertising it
about
at the
it.
national meeting a couple
someone-
weeks ago.
Yeah, no, there was a newsletter that was circulated, and LaShonda and I were talking about it over lunch. We were both talking about getting the book because it sounds just fascinating.
Yeah, I read like the first half chapter or something, and it was really, really gripping. I was like, wow.
Yeah, the history of contraception. It's not a recent thing. I mean, there's always been attempts, and some of the things that they were talking about in their attempts to prevent conception is amazing. I'm like, oh my God,
Yeah.
the things they did probably
just
damaged their health in general.
Yeah. The coordination and the sort of coalition building that went into conceptualizing and initiating that scientific endeavor and actualizing it and completing it over just the span of 10 years for something that revolutionary is just incredible.
It was.
Yeah.
Some of the there's on the other side Margaret Sanger, who we attribute Margaret Sanger to being our founder of Planned Parenthood. Some of I'm trying to remember if it was actually somehow or another. I remember I was at a conference or something, and someone was reading letters from women who in that era were sending letters to her saying thank you so much for what you're doing.
Oh, wow.
And these women that had been able to get onto a form of birth control after that, women that had 4 kids, all of them were grossly anemic, grossly malnourished, and she was too, because she's had babies back to back to back. And her husband was a steel worker and had an injury and was out of work, and this is before unemployment or disability, and this is what these people had to face. And thank you for giving me this back, because I could see that if I kept on this path of having babies, it would be the end of me.
Yeah.
And it's like it's something so simple, and we take it for granted.
Yeah.
To the point where they're encroaching on our rights to have it again. So, yes. Now she's the one saying, "Are you still coming up?"
Ask her to save the biggest specimen.
Yeah, I'm very interested in getting that book. Okay, Are you ready? We're being reps now.
Oh, funny.
No, it's okay. You're good. What's my hands work? It was good. Good to see you.
This is where we need to get our scrubs.
We'll see. So we'll see what
Yeah, we'll see.
requires.
Yay, but it
Sorry.
worked out.
I know it worked out. No, this is great.
3. Sorry. Shouldn't be so obvious.
Mom's expecting me. Oopsie. Mommy's expecting me. Hello. I don't know where she's at. Let me try her office first.
I wonder if I can get her faster than you.
Look at the wind out there.
Oh, wow.
You know her.
You can charge me on download 2 weeks later. Look, are you talking about websites again? Trial to intake? Trial to intake? Yeah, it's really free. Look, you don't even have to put in your credit card information. That is funny. Credit card not really free.
Chocolate playlist. Oh, sorry.
In a good way, huh?
Did you text her?
Yeah.
Sorry, Hi, how are you? Nice to meet you.
Hey, good to see you
Good
again.
seeing you again. How are you?
Pretty good.
Susan Trump.
Nice.
We fit. So
Yes.
we just finished clinic. So.
Yes,
Sorry.
no, it's okay. That's totally my fault for not putting it together and putting time on your schedule.
It worked out. So.
Yes.
Okay. So come on back. It's your lab and we're just one big square. So this is where we do all of our preoperative ultrasounds here. Very good. All of our education offices, our pharmacy. Month 30. Like I said, we're done for the day. So,
Excellent.
so this is our preoperative area. I just get ready, get pre-medicated, everything else.
Good stuff.
Are we gonna need to get scrubbed up?
We're done.
Oh, okay.
We are
Cool.
done.
Oh, whoops. I should-
So it's not like a 24/7 thing that happens? Oh, awesome.
So our procedures pretty much mirror each other, and then our OR at the end. All procedures over 16 weeks have to be done in the OR. So this is our tissue lab where we float everything.
Is this the only tissue lab, or are there others? This is what we're most interested in. Can we?
Can we
Are-
step
are
in?
there-
Yes, 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 yes. We're
Don't have to be.
we're just sitting down now.
Are there any fresh specimens from today that we can still look at, or?
We had a
They're all
really
gone.
long day and they're all mixed up together in a bag. Yet if I would have known 10 minutes ago, I would have saved something.
Yeah,
You know what, though, if we could that doesn't, I mean, it's not like we need something today, but if we could get a visual today of it, that would be a good thing. Is that possible?
Yeah, let me see.
Mainly,
That one's probably frozen.
yeah. What we're looking for is like a visual baseline of like intactness and everything, and what's that, just so that we know like,
Intact they are.
Right. Yeah, they
so
all.
like on a typical day, like kind of what that looks like, and then
And it
what sort
varies
of.
like based on gestation. Sometimes they come out really intact. Do you want to do?
You're not gonna see nothing intact today. Because the way we collect the tissue, it
Yeah.
all gets collected into one container.
We either, you know what, is it cremation?
What was the latest case that you did today?
The latest case we did today was a 5 week and 3 days.
No.
Oh,
OR, the
20.
OR.
It was a 20. Oh, I know what you mean.
Right.
20 stationary. And that was one of the very first ones. So I'm assuming that one could almost be frozen. It's in here. So with this tissue, we don't float it, okay? So it comes straight out of the OR.
Oh, the second tries you don't float.
Yeah, just everything collects in the tray. Unless there's any questions or anything, then we'll like separate it out, and then we'll bring the fetus over.
Because
here.
these are from D&Es, and so
Yeah,
it's just in the tray.
Yeah.
Got it.
So they're
So this is what it's looking like right now at this point.
that one.
Because it's frozen.
Yeah.
And we collected
It's kind of
this
far
kind of early, yeah.
And then let me show you. I'm gonna. Let me see.
That is so much easy. That is so much easier than the first tries, though, because when we're looking for specific, organs and tissue, you can see lungs
Oh yeah, you
and liver and
definitely
everything.
see organs and tissue and
Which is
stuff like
exactly-
that here.
So it's not frozen yet?
That's sort of.
And how long is it?
No, it's really, it's cold. It's started to freeze. It's been in there since this morning.
Is that Cal right there?
That Calvarian, yes. Then you want to
This
see
one,
more
yeah, you can't
organs.
see this one. Because you just see the top of the calvarium on.
Oh, that's
on
really
this one.
frozen. Yeah.
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 Robert, I think this is a better visual as far as
Yeah.
not frozen.
Yeah.
Can you see like some of our.
How it is without them even considering keeping it intact.
Oh, Dr. B. She is one of our 2 physicians who do our D&Es. Yes, D&Es. So, fetal collection.
Robert Sarkis with Biomax Procurement Services. We do tissue collection
Okay.
for stem cell
Yes.
research. And
Okay.
Yes, so we're working with them and looking at setting up a contract for.
Want to see some more?
is
tissue collection.
Okay.
that's gauze
This
wrapped
is
up in
gauze, right, this is
I'm like,
gauze, yeah.
what organ is that? I think that's not an organ.
Like in
Yeah,
general,
okay,
so see what else we can do. Anybody this is for collecting samples and anything that we don't have an immediate need for.
That's just placenta.
That's just placenta, yeah.
And then I'll get back to that research.
So it all depends. Sometimes
So
like I
we're
say,
oftentimes looking for liver
Yeah.
and thymus are 2 of the most in demand.
Yes. That's what they wanted the visuals of the fetuses and after D&E. So.
Okay. Yeah, we've got to be able to.
Yeah.
Is that lung or liver, right? I think that's liver, right?
Really intense.
No, those
These
are
the
those are lungs.
The
Yeah, those
kidneys.
are.
Yeah,
Oh,
look, there's a sac too.
Oh, no.
I was thinking
No,
more
good
of
deed
a-
goes unpunished. So no Saturday. Okay. She found a private physician.
Missy,
Ma'am.
just, I know you want kidney. Look how intact, so.
The organs all come out well.
Yes.
Uh-huh.
Oh, and then you've got your thumb on a right there. I don't have gloves, but yeah, you had intestine and you had spine and you had. That's part of the liver, I believe.
We'll
that's
do
in your hand.
liver,
Yeah.
intestine. I mean, a lot of it. all
Liver
of
and
it.
thymus are huge. Like that's one of the biggest
Oh, yeah,
things for the
liver.
humanized mouse models.
Yeah, you can get that. The organs come out really well.
This
Like,
was
like Dr. Beasley said, we can never intend to complete the procedure intact.
You can't intend to.
You
but
can't
yeah,
intend
yeah.
to, but
Yeah.
if it happens,
you just have an intent statement, right?
that's correct. There's an intent statement that you have to
And-
document.
Right.
Correct.
You go with that? Or
Hmm?
you want to see some more? Or?
Is that?
Did you want me to rinse it for you
if-
and put it in a tray?
Do you mind? Do we have time, like
Listen, if
to?
you're okay with it, Lee, it's just because they just the reason we
yeah,
don't
I
have,
don't-
they just collected this morning, so that's why we don't have more samples.
Oh, got it.
So they.
Okay.
Thank
yeah,
you so
yeah.
much for
Well, but
that.
anything from older than anything that they collected this morning would have been totally frozen anyway, right? So we'd have to be like, but this is fresh from
Yes,
today.
from
Yeah.
this morning.
From this morning. Was this the only like late second try case
Yes,
that was entered? Okay,
yes.
got it. Yeah.
Most of our cases are going to be tomorrow.
Oh, okay.
If that was going to be a question, what originally I remember hearing about second trimesters occurring only on certain days. Now is it certain times of day? Is it every day?
So it's every every day, with the exception of when Dr. Fine is here, but all the other days, like our Thursday and Friday, this is a rare Thursday, but usually Thursdays and Fridays are stacked with DNAs. Like there's some days where we do maybe 8, 9 DNAs. The Thursdays and Fridays are usually stacked.
So when you're setting up the space, what's the flow? Because I see your little signage and everything,
So everything in here is technically dirty. So it just flows from each room, just puts in their samples. You know, she floats everything on that side. The little basin is for us to disinfect the collection bottles, so they get soaked in bleach. Instruments are on the left side of the sink. Tissue is the middle sink. She'll float everything on the tray, on the view box, and then all the other instruments that we usually let them dry, and then we'll move them to the utility room for processing. Bye, Dr. B.
Nancy, no, that's not fish.
I forgot that everything was all clean already, and now we're like...
It's okay, she'll give you the bottle of bleach.
We'll give you an
Services in kind, right?
Yeah, these are disposable, we'll give you one.
Yeah.
Tasty.
I did check with LaShonda on the dissection. If y'all need that, we're totally cool with doing that.
Excellent.
All right, here you go.
Am I going to get in trouble if I take a sort of for baseline?
Probably no. Probably can't do it.
Just gonna do it.
Yeah.
I was looking at
You
it.
have to use your memory.
Sorry.
You want a tweezer or something?
The great thing is this is big enough that you don't need tweezers.
Yeah, okay.
Yeah. See now this. Sean, can you help me out? I think this is lung, right? I don't
Yes,
think this is
that's correct.
kidney. Yeah, these are lungs because that's the trachea in the middle
Yes.
there. And liver. You see, liver and thymus are the other two things I'll be looking for. Yeah. Orbits, really good orbits.
Oh yeah, no. Very well. So here's the.
And that's the cow.
Yeah, it's the calvaria.
With is this brain? Is there neural stuff still in there?
Yeah, there's some.
Okay. You met Adrian in DC, right?
Yes,
He's the one who
yes.
should really be here because he's the tech, and I'm just taking over. This is liver, is it not?
Yes.
Or is it, yeah. There we go.
Yeah.
Piece of liver.
What's the?
Is this spinal cord?
No.
White matter or umbilical cord?
Like it depends on where it came from. It could be like part of the intestine, but part of the umbilical.
Oh.
As well, so it's a little different. So it's just a little bit different, but that's more just more umbilical.
These are.
So the intestine is right here. Right here. See?
Yeah.
This comes out, like I said, the organs come out really, really well because you can
Right.
see all the intestine
Right.
pretty much almost like
And this is a
intact.
big kind of placenta right here.
Yes.
Do you ever see thymus?
In this case is really important. Whenever we do like the 20, 22 weekers we do, you get a lot better.
But it's difficult to find thymus at this gestation.
Yeah.
What is that, Adrian?
This patient was like 18 weeks, I think. She was like 18 weeks or so. But this was also a minor.
So this wouldn't be for collection anyway, because
Yeah, it's a minor.
We're not going to go there.
Yeah, no.
That's complicated.
No minors, no incarcerated people. I got the idea.
Do you find, and this is going to be really hard, I think,
Because
so
the thymus is kind of, it's shaped like two little flasks, right?
Not necessarily.
No. Okay.
But you rarely see it
But I
at this.
wouldn't.
Yeah, it's
I think
harder.
there's a
Just-
percentage
yeah.
on it, but it's not definitely not one.
Because that's
Okay,
because
it doesn't
when there's
say
like
that in
request
your
for,
binder.
oftentimes you're getting a paired request for liver and thymus from the same
Okay.
donor. Because that's used for a lot of the immunology studies and the humanized mouse models. Is this? This is limb. Okay,
Yeah.
and this is like scapula
Yeah.
back there. Got it.
So like with her, like the reason she had to wait so long was because originally she didn't have parental consent. So she was
Oh,
going
wow.
through a judicial bypass process.
Oh my gosh.
And then after, somehow or another, after she got it, then her mom found out, and then her mom was like, then her mom came in
You're
to
going to do
consent.
it anyway, so I'll...
Yeah. So that's one of the reasons that.
That's cool.
Here we go. This is kidney right here.
Oh.
I don't know who told me. Oh, that was the yeah. Yeah,
the-
that's kidney with the renal.
That is.
And this. Oh, and then
That's
there's the other
lung.
one. Oh
Yeah.
no, this was the no. Yeah, this is the other.
That's the
kidney.
other. That's the other one. So
And wait, is this thymus right here?
you have to. It's kind of. It's easier when it's like flat out and like.
Yeah, you can see all
Yes,
the
you
pieces,
can
but that's
see all
kind
the-
of. Do you think am I right? Is this thymus?
I don't know. It's hard to. It could be though. It could be if it was. It could be.
So if the technique was a little better, would it be intact?
That would be easy. Well, so that's what we were
Yeah,
talking
and,
about.
know,
Is
the other thing that plays a tremendous part in this all is the dilation
exactly.
that you've obtained,
Exactly.
and also how, for lack of a better word, how cooperative the patient is during the procedure.
Oh, really? But are they under conscious sedation? Or
Yeah.
Okay.
There's conscious sedation, but there's also times where it's just not. You've pretty much maxed out, and that's their tolerance.
Oh.
Sometimes it's a little bit more difficult.
Mhm.
To completely relax. Sometimes it's a lot easier to not do so many passes for the forceps. So it just really varies. And like I said, a lot of it does depend on the dilation that was obtained overnight. And like all of our procedures over 20 weeks actually go through a 2-stage dilation process. So usually like the cervix is, like for this procedure, cervix easily like at 3 centimeters.
Was this lambs and miso, or is it Daleiden and miso? Or?
So we don't do a combination of miso with Daleidens or laminaries. So for any of our procedures over 20 weeks, they'll come in, they'll get Daleidens for 3 to 4 hours. We'll take them out, then we'll send them home with laminarias, and then they'll come back to follow.
So it is a 2-day procedure.
Yeah, it's not a 3-day. Like how some providers do 3 days. It's unnecessary.
Most people don't do that anymore. Yeah.
A lot of the other providers in town do.
Oh, in the independence. Yeah.
It depends on preference. Like there's a provider in town who will do 3 days if you're 15 weeks and 6 days.
Wow.
So yeah. So it really is, but it's usually that you'll usually find with more experienced providers who've been doing this for a long time.
Yeah.
That will typically do like a 3 days, like fairly second trimester.
Because this is a very, this is an excellent cardiac specimen, for example. But it's still, overall, it's still a very mangled case. Like we were talking about before, that at least for a procurement tech, it's a lot easier if you have, say, the body cavities in one piece than if you're looking for like thymus or liver or whatever. It's just a matter of locating it anatomically, rather than if you've got a whole thing like this, picking through and sorting through. And
A good chunk of the time, like I said, with the patients who are further along, what you'll find is usually it's like one limb that's been disarticulated and the calvarium. So a lot of times it'll come out in like 3 to 4 pieces. And usually when they come out, before we package up for incineration, what we do in the OR is that we lay them out to account for everything before it kind of gets put back in the basin and just like sealed up and packaged up. Because we actually do a lot of collections for sexual assault cases. Kind of, but with that it's different. It's like some placenta and a long bone, but it's still very, it's very cleaned up. So it's different than this as well. So.
These orbits are good too, and at this stage you start to get the retinal pigment epithelium, which is in the back, which is you've collected that before.
So all the orbits are so easy, like 95% of the
They're easy to find too, even in the early gestation, because you're just looking for
they come out like firmer and very.
This is where having a research department would come in handy because
other, oh crap.
And this
just
looks
something
like,
I forgot to do.
is this an orbit that was split
If
open
we
and you
needed
could really get the
step
retinal
in at
pigment?
certain places, like instead of the usual process of going straight to, you know, after it's checked, if we needed to come in and start this process and before it becomes frozen, we can step in and do that. Whereas other facilities, this would be a whole other step that would be added
Because
in.
we actually did one study with the university, and each time we had clinic, they just had to send somebody here, had to hang out, you know, all day. That's what they needed. So she didn't enjoy that too much, but
If we have a long-term
She didn't enjoy that too
ongoing-
much.
ongoing contract and we have certain things that we need, we can build that into it.
yeah. So as far as actual D&E cases, like I was telling you, in DC, like easily like 40, 60 in a month.
40 to 60 in a month.
You know, there's one month where it's pretty high.
Yeah.
Brain
It
matters
is,
really frowned
in
on.
terms of second trimesters, about how many are you doing per month, per week? If you are able to guess off the top of your head.
Oh, here we go. Here's the other
Probably
orbit.
30 second trial week. But as far as like, you know, further along, like the over 16s, because I really don't count anything between 14 and 16 weeks, since they're not really D&Es. That's when you get into like the 40 a month type deal, because it whittles down some.
Is that a viable number for you?
How many per month? Or the gestational age? 14 to 16? Or
No, 40 from like 16 to 22.
There's how many
like
per-
about
yeah.
40 to 50 easy.
per month?
Yeah.
Yeah. No, and those are all being done on the same day per week, you said? Or are they
Yes,
split?
it's typically Thursdays, Fridays, and Saturdays.
Okay.
Yes, those are the typical days where that volume is concentrated. Whereas like on Tuesday, we'll probably do 2 to 4 second trimester cases, sometimes like 8. But like I said, they're heavily stacked on Thursday, Friday, and Saturdays because those are my 2 providers that go up to the state limit, 22 weeks, and they're the ones that are also more. We do residency training with them and things like that. So,
Are they experienced enough that if they knew they were looking that they're looking for something for us or trying to that they could adjust a little bit, be a little.
Those 2 in particular, yes.
Yes, that they'd be able.
yeah, they're
Okay.
like one.
And that's a Thursday, Friday, Saturday.
Yes.
I'm sorry to interrupt. I'm gonna let one of the girls finish up, okay?
Okay.
So I gotta get out.
Okay. Yeah, the Thursdays and Fridays are the 2 that are who also
Experienced
come from,
enough.
Experienced enough, come from academic institutions who participated in research. One of them, gave a planning fellowship at Columbia, the active researcher. So she's very well versed in what she needs to do.
To just change up just a little bit. Okay.
It's the same thing, like we don't do evidence collection on second trimesters as frequently as we do first trimester. So it's always like a little adjustment here and there as far as, it was a learning process for us as well. When we started going up to this gestation and needing assault cases, at first we were like packaging everything and then like, we don't need all that. Okay, you tell us what you do need. And then, we sent placenta sometimes and the pathologist was like, that wasn't enough, and we're like, what do you mean? It's a 22-week placenta. What do you? So it's been a learning process for us as well, but we've gotten very, very good at it. So that's what we do.
Okay. Well, thank you.
Thank you for accommodating.
Thank you so much.
Can I help clean? I'm scrubs. I can put
No,
gloves
it's
on.
okay. It's okay. We'll get it taken care of.
Okay, well, very good.
We're okay.
I'll probably have some other questions that came up today.
Yeah.
And we'll shoot those to you.
Yeah, I wish I could see thymus. The thymus is always the tricky one that is really difficult to identify because it's just smaller and fragile. And, as far as like hand washing sinks, where can I?
Hand washing sink over here?
Yeah. How protective they are.
Oh yes, yeah, we'll be there, and Adrian will be back there as well. And, yeah, Nathal, and yeah, I guess you'll be there as.
Yes.
Are you presenting anything at all, or no?
Not this.
They've already talked with PPFA, Deb Fetola, and the whole
Okay.
group up there, and because fetal tissue donation varies so much state by state, PPFA is moving away from a standardized policy.
Yeah, so because I attended the patient service day, and Kristen Flood did talk about fetal collection and stuff like that, so yeah.
Huh, very interesting. Remember when I first got here, and it was, you have to have this form, it has to be like this.
We had to have this particular consent form, very specific, but yeah, no, that's what Kristen was saying. Because they're encouraging more participation, but they don't want to get too, does that make sense?
Yeah. Interesting. Okay, cool. And any idea why the other affiliates in Texas think it's illegal?
Really?
I don't know.
Yeah, do you know Amna Dermish?
Who?
Amna Dermish. She's a provider with Greater Texas. I guess she was a fellow a couple years ago in the Family Planning Fellows program. And she and I met at the Society for Family Planning meeting back in October, and we had a great discussion about all her IUD studies and her second try cases and tissue procurement. She was really interested in the idea of tissue procurement. But then she went and talked to her CEO at the same meeting, and he was like, "Oh no, we can't do that. It's not allowed in Texas." And I know for a fact that there are multiple published researchers in Texas using fetal tissue.
Yeah, we have.
But I think it came down to what you and I said.
Yeah, I think you have to do it under a research umbrella, and you really have to know your regulations and keep up with them and follow that. I think if they don't have someone there who's able to do it, they just don't have
No interest.
no interest. Yeah. So
I'm puzzled by that.
I'm very puzzled by that too. I'm going to send Katie an email too. Say, did anything get worked into House Bill 2 that has anything with research?
Nope. I tore that thing apart.
I've read it.
down.
Yeah, I never trusted to, so I've read parts.
Because now they've introduced the Down syndrome bill and all this other. No, there's nothing. The stillborn stuff.
Yeah, I was going to ask you about, because you had said that you guys can still go up to 24 weeks for certain indications. How broad is that allowance?
It's actually very narrow. So in order to do that, it has to be considered a lethal anomaly. And the wording in the law is very specific. So we require documentation either from maternal fetal medicine doctor or a geneticist, and it has to specifically say in the notes or on the ultrasound report, lethal, will not survive,
incompatible with
chances
life,
of viability are 0, 5%.
Yeah.
And then that's when we'll do the cases over 22 weeks. So it has to be between 22 weeks and 23, 6 is the max. So those are typically the cases where we see, one of the more common ones is anencephaly that we see. So we actually see that pretty frequently. So we get a variety.
Yeah, but those aren't done for maternal indications, I guess. Obviously, no.
We don't do any that are maternal indications because even though it's not illegal, it's such a gray area that you have to be a little bit more conservative in. So that's why we don't go there.
Best case scenario, what would it take in order to document that or navigate that?
Maternal indication.
Yeah.
That is, if there's any type of documentation that would be done in the hospital where you're having multiple organ failures, and even in a hospital, in that case, it requires 2 physicians from 2 different departments confirming. So that's really the only case where.
We have the opposite here in Texas, so that they won't even, pardon my bluntness, they won't even pull the plug if the woman is pregnant because they want her to carry it as long as possible. Even if she has DNR orders, everything. I mean, it's really, really hard to do.
So, we're in Texas.
We're in Texas.
Yeah.
I told them about the bus.
You
got to see the bus.
The welcoming committee.
Our state-funded bus.
Yeah, state funded. That's where my tax dollars go.
And the license plates that say choose life, that goes,
Tax dollars.
tax dollars to work.
It's a beautiful thing. Yeah, very beautiful thing. I'm still stuck on Greater Texas and this whole like.
I know I am too.
Illegal thing.
We have to talk some more anyway, so we need to figure out how to ferret that out.
But we've also always kind of done other things that other people are just not necessarily comfortable with, just because it takes a little bit more work as well, and there is a little bit more risk involved, obviously, but it's like it's for a good cause.
Yeah.
Why the hell not?
Yeah.
You know, it seems so simple to me, but
When there's people who hate you for what you're doing anyway, it's like
so
whatever.
It's all the same.
Yeah.
But no, we're excited.
Cool. It's just other affiliates in California and what have you. They've had this type of tissue procurement program going on for years, and it's just ongoing. I know it is awesome. We've talked about this. This would be nice.
Because ever since the UTMB, we've been like, Missy, can I get anything?
Yes.
Anything?
I told you they ask me. And patients ask. They ask if they can donate. So.
Ever since what was the acronym you referred to?
A UT study, the last academic study that we did where we donated. Where did Dr. Tyler go?
Now she is at Dartmouth.
Oh, she's not at the Planned Parenthood anymore?
Not in Northern New England anymore.
Oh.
Now she's like chair or something like that.
Okay.
So that was the placenta study you were telling us about, and that was, how long ago was that?
2000, well, right before she left, so 2012?
3 years ago?
Yeah, I was thinking 2012.
So you haven't done any fetal tissue collection in 3 years?
No.
Wow.
Why do you think I keep doing this?
I
can't even contain myself. I'm so excited.
Yeah.
So I'm always bugging her about it. So
Yeah.
This is good.
Yeah.
I'm excited.
And because of their clinic flow and everything, and electronic medical record and stuff, our other studies aren't as compatible here, so they're left out of a lot of research stuff. So. Okay. Good. All right, we'll get you out of your hair. And I'll set something up where we can visit later and talk about some logistics of how I kind of see this, so then we can start putting some paper together.
Okay.
That's good. Sounds good. Thank you
Awesome.
so much for hanging out. And
Great. Thank you. Good to see you again. We'll see you at
I'll see you at NAF.
Yes.
All right. Bye.
All right. Thank you. No problem. Go the long way. That elevator actually goes to my office, the loading dock that you heard over and over. But it's for freight and patient transport only. So,
Even after hours.
You know what I
What's important here is what happened in the videotape, in the moment, and then
you crack me up. You're like a kid in the candy store with that dish.
Huh? There is a big difference between trying to find any of those pieces in even 12
They
weeks.
don't spray anything. They don't do anything. It just
Yeah, they
goes
just
in
pick
there.
it up and put. Yep.
So water is
Yep.
no.
Yep.
Did y'all just finish up?
I was at the cashier training.
Oh God, all this training in the building today.
So what are the other floors? Were we just on second floor, and then what are the
This
other?
is the third floor. And there are 6 floors in this building.
And what's on all the other ones? Just different.
There's one whole floor that's dedicated to meeting rooms and conference rooms. The other floor is admin. And then another floor is HR and fiscal. Accounting. Accounting and HR on one floor. And if you know, the building is kind of stair step. It gets
Right,
smaller
so
as
it's
you go up, and
smaller
then
as
the
you go
top
up.
floor is IT.
Okay. So the only floors where patients are seen are floor 1 and floor 3? Got it.
That was fun.
That was wonderful. Thank you for
Oh, no, that's okay.
sneak that in at the last minute.
I don't know if you guys noticed the staff that were coming in that were like very concerned. I'm like, it's okay, it's okay, it's okay.
What are these people doing?
Yeah, so
It certainly it hasn't happened in over 3 years. It sounds like so.
Yeah, I mean, and even then, it was either they would collect it and research would go up and just get this box full of containers, or Dr. Tyler would collect her own, take it home with her in her cooler. So, yeah, that's it.
So how do you think, were you able to put them at ease? And
Yeah, no, I kept you from being jumped on, yes. Dr. Beasley, the one who performed who's on today, she's like, and I was like, it's okay, got it. And she's like, she noticed it was me. She's like, oh, and so I told her, she's okay. Yeah, so the two doctors that Trauma's referencing that do the abortions at the later end of the second trimester, Dr. Beasley and Dr. Schutenay, and we are grooming them to become our next principal investigators of all of our studies, because Dr. Fine is nearing retirement. Yes. So, and then my boss, who is a PI of some of our other studies, is nearing retirement. So, yes. And both of them have expressed an interest in doing more fetal tissue, more stem cell type stuff.
Good.
So, yes, if we make this a protocol, a research protocol where it is a sample acquisition protocol, I will insist on one of the two of them being the principal investigator. So,
and I didn't overhear everything you guys were talking about, that they're very skilled with their technique and are able to.
yes, skilled enough that if they need to creatively change it, tweak it a little bit, that it would ensure intact specimen what we're looking for, because they would know what we're looking for. That would be coordinated. And
It's the thymus is right up here, and it's smaller, it's fragile, and unless you've got like integrity in that area, it's
well,
hard
she mentioned even when we do have the disarticulation, it's a limb,
right,
and you know the head. And so usually we have, if we're going to have things intact, it's going to be torso. It's really just going to be dependent on the disarticulation if it does involve this area pulling.
I mean, this one was very disarticulated. I don't know what happened. Maybe it was because the patient was a minor, and so the dilation wasn't
and they've
as
already
great.
done their, it's been handled.
Oh, yeah.
And
also
smushed up and
said
put in
about the patient not being cooperative affects it a lot too.
Right.
And the patient not being cooperative, I just think if women that I work with, and young women especially, if they know what this end of it, then that could not persuade, like you said, the decision's made. But so now I like knowing this, that yes, the decision's been made, but their cooperation is easier for us if we can get them to cooperate. Then, and with a doctor getting creative, then we're able to get what we want.
And some of it is, and I didn't want to go into detail, I've administered conscious sedation before. If you have anyone who has had any type of substance abuse, they have a higher tolerance, and the medication doesn't work as well, and you have limits as to how much you can give. So the cooperation may be something they don't even have control over, because the medication's not going to work as well on them, unfortunately. And we don't, where I've done conscious sedation before, I didn't have an upper limit. I kept pushing as long as the doctor said keep pushing, and had the Narcan right there ready to go. That's what we could do. But here we have limits, so they just, it's a little more restrictive. So, and we won't know that. I don't know if that form necessarily looked at any type of substance abuse. Or even asked about it, and probably wouldn't, because people would be resistant to answer that, not knowing that it impacts their
and are they
pain
going to tell
control
the
meds.
truth? So what's
Exactly.
the point in asking?
And from a medical legal perspective, we probably don't want to collect that information and have it documented anywhere. So, yeah, I'm very excited about that. I think it was a good experience up there. I could do that if y'all needed specifics.
You can see the future in it. You can see the financial benefit.
No,
that
I can personally go up and be available on those days. The biggest challenge will be Saturdays, because we can't do next day delivery anywhere.
Right.
Yeah, so we're going to be limited to maybe even only Thursdays, because if we ship Friday, do any of your labs have Saturday hours where they could even receive it on Saturday?
Yeah, actually, a lot of researchers, if they're requesting something very specific and it's very special to them, and they want it, they will make themselves available at 10 o'clock at night, at 6 in the morning.
Perfect. Okay.
Yeah.
Okay. Yep. So we would just really then need to question the Saturday ones, because if we can make arrangements for Saturday, the only delivery time would be Monday. You could have it sent out and delivered on Monday, ship dry ice. It's still would be viable, but it's just the time.
Some people will take that, but it's definitely not like first tier.
Oh yeah. So then we're looking at Thursday, Friday.
And also people within courier distance on a Saturday. So that's one kind of logistical thing as well, is if there are requests that are going. Local requests happen on Saturdays.
Sometimes the local requests, just like you said, they send their residents and med students here to sit and wait for the samples to be presented to them. So,
Very good.
Yeah, so that's good.
Excellent. So as far as action items for the near future, do we...
I need to send you, I've got my list. I'm going to meet with Trom to talk about some of the logistics, probably Trom and one of the two doctors. I'm going to send you just kind of the general protocol and consent form. She and I are going to get with the doctor, get with someone to figure out what's up with the other affiliate. It could just be that...
Set them straight.
No, I think really is just making it easy for them. If we can put all of this part in place, I think that will be half the battle. Is if you don't have anybody that's experienced in how to do this, you're not gonna. It's a bigger bite to take.
Right.
It's
but I know
scary.
that there are motivated providers at that affiliate.
Yes.
So.
Yes. So. We can look at that. I think we'll probably need to get a little further ahead here and establish some guidelines on what we're doing and how we're going to do this that can be replicated elsewhere, that the other affiliate in Texas can use. So and then I have my questions for her, and several of them we asked. She said 40 to 50 per month conservative. Second trimesters.
That's a good number, don't you? Okay.
Yeah, that's the second trimesters.
That's the late second tries that she was talking about, right? She said,
Yes. So that's a very good number.
And that's that 2-week wiggle room built in, right? How you determine the date versus what the actual date is. So that even gives us later age.
So, I don't need to look up Dr. Tyler now. So sending you that general protocol, and then we can just start working on a contract, budget. I need to meet with Trom first, though, to talk about what this is going to look like, where I kind of see it going in terms, do you guys have the volume, have the capacity for everything?
You're talking about like the client
ages?
volume of how. Immediately, it's something that's going to grow, but it's very, very scalable, because as soon as people start to find out that that you have that kind of capacity, and you have that product available, because what will happen is when let's say that there's an academic research client that's doing like, for example, the researcher who sent you that request for 120 fetal cadavers for skid mice studies, they probably sent that same request to STEM Express and ABR and several other, and especially the bigger private biotech companies will do this. If they have a big high volume study like that, they'll send the request out to multiple procurement agencies, and they'll just see who can either do it first, or if it's a really large number over a long period of time, like 120, they'll be continually getting 2 or 3 a week from one company, 2 or 3 a week from another company, from another one. And once people start seeing that you can deliver on your promises, then they'll be switching over. It's a very dynamic.
So we can start off. What I would like to do is to go ahead and have the protocol be general for any and all gestational ages within the state limits, and then start off with the most urgent ones that you need, and then as things start to bubble up, I really want to roll this out. I would like to make it, in terms of have staff just enroll everyone. If we have specific needs, we will sort those out, and everything else gets banked, and then we can work on disseminating the banked specimens. But I want to get to the point where you need it first, because I don't want to go through all the extra work and expense if you don't even have a need yet. So that would be like the long-term goal.
There's the tension there between us being able to promise it.
Yes.
And then do we disappoint our client? And then what do we?
Yes.
You know,
so we can work on these immediate ones first, because those sound like the ones, based on what you've said, that you have the most interest in immediately. So. Yeah, and the IRB that we work with, we've not done any fetal tissue projects with them, so I can't tell you how they will be. But everything else we've done, they're very fast, and they're very customer service oriented. So, you know, if there are questions, I get a phone call from my liaison that says, Missy, okay, in the protocol it says this, 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 and this. We have a question, this specific list. If you've worked with IRBs before, you know how challenging that is. It's not easy to do, because they don't often tell you what they need. They just say, you haven't discussed how you're going to de-identify the specimens correctly. And then you're like, what is it you want to hear? What do you want to know? So
we've all been there before.
Yes, so working with that particular IRB will be good, because especially if I use the specimen acquisition protocol that we've used for our IVD studies, and I use the consent form, I know that general language has already been approved. All I have to do is strip out all the references to the other specimen types and put in fetal tissue. So the general language is there, the consent process is there, everything is already in it.
Excellent.
It's already been approved by that IRB twice. They just don't realize they approved the same thing twice. So I can send you that, and then you can look at it and see if y'all are cool with it, and then we don't have to reinvent the wheel. It's already it already exists. And then just in terms of the contract, same thing. We've already got some contracts in place for this type of general specimen acquisition for other specimen types. We'll just have to make it specific to what we're doing. That's why I need to meet with Trom first, just to get logistics from her to tell me, okay, you've said, work this in, how does this look, and any more information you can provide in terms of timing of the specimens, whether or not I need to put them in the freezer immediately, or I can have them at room temperature for a while we're dissecting. Any information you can provide helps me work out logistics better with her, then I can develop a better plan and budget.
So when you're working with her, if you can just get an idea from her, how difficult is this? Where do we want to set our minimum compensation, and let her know that this is just a minimum bar. We can go up if we need to. Right. It can get higher compensation, but she's really the one to say, oh yeah, that's pretty difficult. We'll need to, the doctor would need to be creative in that, so let's ask a higher price for that specimen. So if you can give us kind of a baseline, knowing that that's not in concrete.
I mean, something to start with.
Right.
So and again, when we've had these types of protocols in the past, we have an a la carte budget, and the a la carte budget, so the specimens that are relatively easy to obtain, urine. I mean, we don't have to do anything but give them a cup and tell them what to do, either clean catch or first catch. Very low price. And the cervical samples, where you actually have to put a speculum in and visualize the cervix and collect it a certain way, that's more. So, obviously, and we do that accordingly. And then there's flexible budgeting in terms of like any data. And you haven't mentioned whether or not any of your clients are requesting data. So anything besides gestational age, or sickle cell status.
Disease, or like STD screening. You're mainly HIV, hepatitis B.
They do. They don't do HIV, and I don't think they do Hep B. They
meaning
do
like standard. Right, but you guys do have the capability of doing HIV testing, right? What about Hep?
Hep B, I don't. We can do it. We don't routinely do it upstairs.
But can it be done in-house, or it has to be?
It can be. It's a send out, but it can be.
Oh, it is a send out.
Yeah, it can be done. And that's something else that we could work into it. If disease status is required, then we put it in the consent form that, specimen collection and blood specimen, blah, blah, blah. We put everything in there. We put that into the IRB submission as well.
Yeah. I mean, that's kind of an a la carte service that is added to the tissue procurement for a researcher. So it's not everybody requests it, although many people do, depending on the study and what's going on.
And we just need to bake it in. We need to bake it in. So it gets a little touchy though in terms of the patient, because technically we can't reimburse the patient for donating the fetal tissue, but if we're collecting an additional specimen, like let's say Hep B, because we need to know that Hep B, and it's not something we would do clinically, that does fall under my research part where we reimburse the patient, but then it's challenging because she's coming in for an AB, but we're not paying her for that AB, we're paying her for this blood, and
how do you frame that? You have to think about how to frame it?
Okay. It could just be, we'll get the results of this test. It's a free test for you. Have it covered under the protocol.
And then
and
we
just not
can
have any compensation for the.
But we could absorb that, so that's not on you.
Yep.
That financial.
Yeah, because we have contracts with central labs for those tests anyway. It's just a matter of we have a special what we call fund code where it's not charged to the patient, not charged to her insurance. It comes to the research department specifically, so then we do like a pass-through or whatever.
Okay.
Yeah. Any of those logistics, we can work that out. We've had variations on this theme before, so yeah, I think that's it. I just need to get with Trom and sit down and put our heads together on what all is involved, and then probably tomorrow, Monday, I can send you a protocol and consent. Just some general stuff in it, the tissue, obviously. Let me grab this quick. Yes, ma'am. Hi. Oh, so I'm guessing you're not going to ship today. Yeah, I mean, if they haven't said yes, I wouldn't. Yeah, I mean, they're 2 hours behind us. They should have responded by now. Yeah. Okay, thanks. All right. Sorry. I knew what she was going to ask. So, yeah, and I can get you that tomorrow or Monday. I'll have to go in there and strip out all the references to all the other specimen types, and then we can put in there whatever. I mean, just you need to get real creative on things that your clients could ask for in addition to the tissue, in terms of data.
Right.
Yeah. Other data, other types of specimens. I don't know what else they would ask for, if they would ever ask for a urine or a blood sample. The one Dr. Tyler did, she got a tube of blood while she was doing hers. Yeah. I don't remember what it was for.
Yeah, no, yeah, it's definitely, it will probably definitely happen that there will be requests for like blood samples along with the tissue.
Yeah. We can make that work.
Yep.
Yep. As they draw blood up there for other things, but again, if this is something that we're working into research, me and all my staff are experienced with a lot of this. We all draw blood. We could work it out regardless. So, yep. Cool.
Okay, very good.
Excellent.
Very good. Well, I'm
this
very
has
happy
been a
to
very
have
productive
spent the day
meeting.
with you. Yes, I'm very excited about this.
Okay, this will be mutually beneficial, financially beneficial for both of us.
Did you see the fire in her face when we started talking about that bus being funded by tax?
You know what? I didn't know how she would take it if I said, well, we're going to be funding you, so relax.
It's just one of those things. It just,
it grates on you, doesn't it?
It does.
So tell her, they're going to be paying top dollar. We're going to be funded, so relax.
Yes, we're actually, and this, because they bug me. They bug me at least monthly. Missy, do you have anything? Do you have anything? Do you have anything?
Aww.
So, yes, it's like, I can't make something appear. So, I think that's probably why I answered your email faster than anyone else does.
Because you knew that they would be waiting.
Yes, yeah, Trom's not, if I don't answer it and Trom CC'd me on it, she's going to be in my doorway. So, why didn't you answer your email today, Missy? So,
very good.
Yes. Well, great. I was happy to have met you guys, and thank you so much for lunch. It was awesome. It was a good way to spend an hour while we were
in limbo here.
Yes.
All right, and hopefully you won't need me, but you've got my cell phone in the event you
Excellent.
have issues.
Yeah,
getting
in
back.
Texas and
Yes, yes. All right.
Oh, this way?
Yep. All right, well, y'all take care. Have a safe
You
trip
too.
back, and we'll get back into contact with
Definitely.
you tomorrow.
Thanks. Talk to you soon. Bye.